It's about understanding the abuse victim cycle and how to get out of it, okay? When a traumatic event or abuse occurs, the abuser, the person who experiences it either identifies with the abuser or the victim, and therefore they continue to repeat the cycle, okay? Only when we have enough knowledge, care, and willpower can we break the abuse victim cycle. And I talk about this a lot in my podcast. Go back to the ones I did on that and check it out. It's about balance between the brain such that we're not in master think or slave think. Again, in my podcast, I cover this extensively. When you're in left brain imbalance, it leads to masculine domination, the suppression of the emotion, and eventually roots us into the lower brain, the reptile brain, okay? If you're in right brain imbalance, okay, that roots us in the mammalian brain, which means that our emotions are out of control, and we're not really stepping up with confidence, with courage, and standing up for our rights. We go into slave think mentality. Healing this divide, balancing both hemispheres of the brain by working with these different brain dynamics holistically is the way out of that imbalance. Genetics versus epigenetics. I just want to say here that I feel the power of consciousness can trump anything that has been done to us genetically. So to leave people with a little bit of hope. The answer is consciousness, and that could totally break any of the genetic programming that these beings have done to us, no matter how deep. Okay, no matter how deeply seated it is. But that's if we take the time to explore the knowledge of ourselves. If you want to look into how epigenetics can trump genetics, really look into the works of Dr. Bruce Lipton, cell biologist. His work, The Biology of Belief, is absolutely essential to that matter. Okay? Self-loathing is the underlying psychological condition that causes people to attempt to abdicate their own personal responsibility, to exercise conscience, and fall into the patterns of willful ignorance, order following, and the justification of immoral behavior. Self-loathing is created when earlier psychological trauma has been suppressed and buried into the subconscious mind, instead of being confronted, dealt with, and healed. The effects of such unresolved trauma often take the form of feelings of inadequacy and unworthiness, whether those feelings are real, suggested, or imagined. And this is the dynamic of a self-loather. I have suffered, therefore I shall cause suffering unto others. That cycle has to be broken, and this is the exact mindset, okay? I've suffered, therefore I'm going to cause suffering, that keeps people in the prison of their own making. 5 minutes, great. Self-respect, from the Latin re, meaning again, and spectare, meaning to look at, is the only thing that can ultimately heal self-loathing, and therefore help to put humanity on the path to healing and conscience. Self-respect ultimately means to take another look at oneself. Respect, to look at again, to look at the self again, to go in and understand the aspects of human consciousness. Okay? These are what I call the 3 R's: respect, remembrance, and responsibility. Respect, remembrance, and responsibility is the path out of this prison, okay? Self-respect, taking another look at the self, remembering who we really are, okay? Self-knowledge, knowledge of self. The ways that we can express our own consciousness is through thought, emotion, and action. This is the real holy trinity that exists within each one of us. It's been called the mind-body-spirit connection. The masculine and feminine aspects together with the creative aspects of the mind, the thoughts, to be unified such that we are a being that as we think, so we feel, so we act, and there's no contradiction between those 3 modes of consciousness. Here's the expressions: thought, emotion, and action, the fulfillments of which are the fulfillments of thoughts are knowledge, understanding, and wisdom. The fulfillments of emotion are true care, empathy, and compassion. The fulfillments of action are courage, willpower, and persistence. This is what humanity needs to develop. If we stay in the failures of thought, emotion, and action, we stay in the prison. The failures of thought are ignorance, foolishness, and naivete. The failure of emotion is apathy, indifference, and callousness. The failure of action is cowardice, laziness, and submission. Okay? That's the basic knowledge chart that we need to take into ourselves and understand how we work, because our controllers know how the human consciousness works, and they've done their best to keep that knowledge from us. We have to understand our own sovereignty. Sovereign is a word derived from Latin, the adverb super meaning above, and the noun regnum meaning rulership or control. Thus, sovereign means one who is above the rulership or control of another, or in a word, free. Sovereignty, the word sovereign, simply means, ladies and gentlemen, not a slave. It doesn't mean anything else. It never has meant anything else. It means that you are the ruler of yourself and no one else rules over you externally. It means you are not a slave. Every person in the world is sovereign, whether they know it or not. Slavery is illegitimate. None of us are legitimately slaves, therefore we are all sovereigns. An individual's personal responsibility to choose right action over wrong action for themselves is always their own. One can only make the claim that they can, quote, abdicate their personal responsibility for such choice, for such decision to someone else. This can never actually be done in reality. More simply put, an individual is always responsible for their own behavior, for their own actions. We need to grow up, think for ourselves, and stop following orders. Following orders is not a virtue. It is the path to total destruction. It is the path to slavery. It should not be looked at as a virtue. Really wrapping this up, the bottom line of all of this is, regardless of how troubled our cosmic childhood may have been, humanity's childhood is over, ladies and gentlemen. Humanity's childhood is over, and a choice stands before us all. That choice is either to enter cosmic adulthood or perish.
Hello and welcome to Health Revealed Part 8, and this is our final part. Before we delve into the solutions, we need to understand this very, very important topic called trauma, which actually affects a lot of people in ways they may not understand. And we talked a lot about it in our previous parts, detailing how it can affect this and that, and it can rise, and people don't know they have it. But what is it really like? Can we get more specific on the people and the researchers who have delved deeply into that subject? We start here with Dr. Gabor Mate, and I'm joined here by Scott Gordon, Stephanie Mo Davis, and Leslie Power. Say hello, everybody.
Hello.
Hello.
And so trauma can be defined as an overwhelming experience that exceeds an individual's capacity to cope. It can be caused by a variety of events, including physical or emotional abuse, neglect, loss, or violence. Gabor Mate emphasizes that trauma is not limited to extreme experiences, but can also result from chronic stressors in an adverse childhood environments. According to Mate, true healing from trauma requires understanding the underlying causes and providing compassionate support rather than judgment. He calls for a shift from punitive approaches to addiction, crime, and mental illness to ones that emphasize understanding, support, and healing. His insights prompt us to reevaluate social systems, placing empathy and connection at their core. And so as we bring in the solutions in this seminar, we're talking about how do we shift the old model into the new. And what we have is actually potentially a widespread trauma. He says cultural trauma, such as colonization, which we talked about, war. We talked about that as well. We delve deeper into those subjects. In case you haven't seen it, be sure to check it out. Discrimination or socioeconomic inequalities, these can permeate generations, shaping the collective psyche. Unresolved trauma can be transmitted from one generation to the next, leading to cycles of dysfunction, addiction, and violence. And again, not being able to see this type of thing that's happening, and maybe some of our belief systems and what actions we're committing, we're not seeing that as coming from this trauma. And you can expand upon this through the works of Bessel van der Kolk. Here's a quote. As human beings, we belong to an extremely resilient species. Since time immemorial, we have rebounded from our relentless wars, countless disasters, both natural and man-made, and the violence and betrayal in our own lives. But traumatic experiences do leave traces, whether on a large scale, on our histories and cultures, or close to home, on our families, with dark secrets being imperceptibly passed down through generations. They also leave traces on our minds and emotions, on our capacity for joy and intimacy, and even on our biology and immune systems. So, huge impact this problem of trauma, and it's widespread.
It seems to be that trauma, or that humanity and the majority of human beings have been able to survive all this trauma in our past because of an ability to suppress the trauma and to keep it apart or away from our day-to-day life or our day-to-day thinking. And this is the paradox or the irony that takes place in somebody who has trauma or deep issues that are very hard to reach, because that very ability to push them aside or to repress them is also a barrier to getting at them and to process them, because they can ultimately be reached and processed and relieved. And then the person doesn't need to spend some portion of their psychic energy repressing trauma. In theory, they should have more mental and spiritual capacity. So it's a very important concept to grasp, because this is how we've made it as human beings, is that ability to suppress and repress trauma out of the way so we get our jobs done, our work done, our family raised. But it can also lead to leaving these quiet lives of desperation, when we are unable to get to them because they are so repressed.
Yeah.
Go ahead, Leslie.
I was just going to add that another result of that suppression that you are recognizing is our worse health outcomes. So that the result of pressing emotions and not dealing with the trauma is the burden on the body. And Bessel van der Kolk talks about that in the name of his book, is The Body Bears the Burden, right? And pretty sure. Yeah. And so the body keeps the score is actually the name of his book, but it's the same idea. The body keeps the score. And so that you also can look at the Kaiser ACEs study as another example of that in action, that early childhood adverse experiences that are not processed lead to poor health outcomes in later life.
Yeah, and I think that we've hit some sort of cultural tipping point where the rise of not just physical disease and somatization, but we also have a massive mental health crisis. And I think a lot of people are looking to some of the expressions and the cultural narratives that we're seeing in media, widespread, and saying, what's going on here? Why are we having 5-year-olds transitioning into the opposite gender, and what's going on here? So people are starting to question much deeper. And when you're willing to go deep, that's where you're going to find this uncovering of things that are suppressed. And even in the intellectual spaces nowadays, you're seeing a lot of narratives talking about, or their presumptions that culture is suffering, or our children are suffering with mental and physical health conditions, and adults are suffering with mental and physical health conditions, because they claim that we're in the time of a true meaning crisis. And in order to extract meaning, you have to have the ability to go deep. And just like a yoga practice, right? Part of the yoga practice is using stretching as a method to tap into deeper levels of feeling, that actual, like Leslie said, the body keeps the score, that tension somehow settles in the body. So if we have physical tension, mental tension, emotional tension, and now we're at a cultural tipping point, the only way to uncover this and to get better is to go deep. And that's where I think we're starting to open our minds away from just seeing trauma as something that's war related, such as one event in PTSD, and moving to these narratives where we're talking about CPTSD and the accumulation of micro traumas over time and the effects that it's having on our mental and physical systems. So it is just the time in history now where this Pandora's box has opened up, and we're in deep. And we can't avoid it now. And we're all feeling, and things are coming up. So this is, we're going to have to find ways to cope with these repressed, suppressed traumas that come up, especially if we're talking about a meaning crisis. You have to go deep.
Yes. And the problem of statism is, of course, extremely deep. I mean, relentless wars, countless disasters. I mean, you're talking thousands of years, right? History that we're still figuring out and don't know exactly what happened and who and said or did what. And so, that's a long history of people obeying different authority figures, of people thinking that they're right and other people are wrong, of having assumptions about themselves, their world, and us trying to figure out who we are. So a lot of that confusion, is still being worked out on, and I think sometimes we may not see that, especially in an age of mass information and media technology. We're kind of prompted into that, and that's very new to us. We may not see how that also affects the future generations.
Mhm. A truth discovery process is often messy. And we just live in a time where we want truth. We understand that we've been betrayed on many different levels. We've been unaware. We talk about consciousness now more than ever. We want to be aware. And in that process is a truth discovery process that's messy, and it can create and bring up traumas.
Yes. And so what can also happen in the medical field is a re-traumatization. So Bessel tells a story of a woman who was previously raped for sake of YouTube algorithms. Can't say that word. While hospitalized, she refused to eat for more than a week and rapidly started losing weight. So the doctors decided to force feed her. So you can read the quote here. I think it's a little bit graphic, but it's an example of things that happen in the real world that affect people, and doctors may not see the pasts of their patients or their clients. And so they administer a certain drug or program, not realizing it's going to resurface a trauma that that individual had. And it's actually going to make them potentially much, much worse. And the doctors are not going to know how to treat it or what to do. And they might even go to more extreme measures and double down because they still have not gotten to the psychological factor. Crazy story.
When I went to my first kind of natural health provider, when I was dealing with my physical illness, which I was seeing Western doctors and some Eastern, unique, eclectic, alternative doctors as well. One thing I found so interesting and so in stark contrast was I had one in about 5 years, Western doctor. Now, this was 25 years ago, so it wasn't recent. And he said to me, Stephanie, my doctor said, "How are you, Stephanie?" And I was like, "Oh, well, my blood pressure or this or that." And he said, "No, no, 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 no. Tell me about your life. Do you have stress?" Well, I mean, my jaw dropped when he asked me that, because most doctors just wanted the basic story to try to get to the point. But when I would see alternative healthcare providers, they didn't shy away from saying the very thing that potentially could, I mean, for instance, one of my alternative providers in a first meeting, we went very deep into, some of my childhood stuff. And they immediately said, you realize that this is going to get worse before it gets better, right? You're aware of that. Like, there was no hiding some of this stuff, understanding that when we go in deep, things are going to arise. So just by the fact of them being conscious enough to make me aware of that made me feel confident enough and aware to go into it and go through it. Whereas I think sometimes in the other system, there's a fear of, again, re-traumatization, going in too deep, too fast, and then not knowing what the heck to do about it, right? This is why integrative care, I think, would be profoundly helpful, because there are people very comfortable with going deep. So I think the two together would be a powerful relationship if we can just get beyond our egos.
Yes.
Steph, you're describing something that involves voluntary consent, right, to the process. And this example, that Bessel is giving is really around in treating someone involuntarily, in situations where someone is hospitalized, like on a 5150, right, where they're being considered maybe a threat to self or others, possibly, I don't know for sure in this situation, but here's an example of someone who's choosing like not to eat. And then, so what do you have the right to do to impose your wish on that other person if
Right.
they're not cooperating. And so I want to read this last line because I think it's important where he
Yes.
says, it helped me, this experience helped me to formulate a rule, right? And that rule is if you do something to a patient that you would not do to your friends or children, consider whether you are unwittingly replicating a trauma from that patient's past. And it brings up a moral consideration. Does anyone, a doctor or anyone, have the right to impose a intervention on a patient without their consent? Do you have the right to restrain them? I worked in group homes, I've worked in residential treatment, and I've witnessed kids being put in isolation in padded rooms. I've seen them and been trained in and participated in even in restraints of their physical body, when a kid is being out of control or a potential danger. And there's so much training, that for staff to try to make these judgment calls. And yet it's not always consistent in how those decisions are being applied. And it can have a lot to do with the mindset and the mood and the patient's level of a staff or an interpretation or a subjective opinion to do things that really, if you were to witness it from the outside, you would say, what the hell are they doing?
Mhm.
It can appear violent.
Mhm.
Being tied down, strapped down on a table and held, still against your will. I've seen that with kids, my own mother. I've seen that done to my own mother, when she had a UTI and wasn't thinking clearly. So this is a very important
Wow.
conversation.
Yeah.
And I think that there's a lot of liberties taken in the name of the power differential in medical settings, or especially with children in residential and group home settings.
Mhm. Mhm.
Just think about how this also applies. I mean, we're just talking about, and we're giving a specific example about medicine, but this can apply to anything. We're talking about the issue of trauma. Right. So we can probably go down the list and give a political example as well. I mean, this comes down to the golden rule, do unto others what you want done unto you. She says here, what would you do to your friends, your children, and to other people? So, and bringing back the idea of statism and this idea of authority, what it comes down to again is being able to be consistent with your morals and not having this slight contradiction where you say, man, this person is an authority figure and I must do this and I must follow orders, or I trust the medical regime and they're going to take care of me and they're going to do everything for me when they could be causing a lot of big problems. So it all seems to kind of be applied to many different fields, not just medicine.
Yeah.
But
So some of the
uh,
interventions, even when justified, out of safety, are traumatic in themselves. They're creating an aspect of trauma.
mhm.
But even more so when a person has a previous trauma, let's say about being held down. This this is where Bessel's making an extra distinction, is that we don't always know what people's triggers are. We
Yes,
don't know what their trauma history are. They might not know what will trigger them, you know. And so we might be seeing people escalate or kind of freak out when
yes,
we walk towards them in a room and make the wrong assumption about their behavior and perhaps justify an excessive force when that would be the opposite thing that's needed, or justified if you knew what was really going on. So understanding trauma and trauma reactions in the medical setting is so important so that overreactions and misinterpretations are minimized.
and think about that. I mean, oh, this person's not reacting well. Now we got to give them another drug. Now we got to be more severe. Right? Or the policeman who has to control somebody else and they resist. And, oh, that's an extra felony. That's a couple more years. Now you're in deeper trouble. So it's like, what's going on here? How do you get out? And that sense of trap, that sense of repression is that really going to heal somebody? what you see here among these researchers is we got to totally reimagine the way we're doing this, get the force out of the equation.
Could you imagine if we started to work on our trauma behaviors to the degree where literally in our medical records, it could say like, these are my triggers, right? So then you go in and people are like, oh, okay, this woman had this particular incident. So when we're caring for her, let's be mindful of that. Like it seems like it'd be almost impossible to do, but I think it's something we should actively at least try to work on, at least bringing trauma to the mainstream for people's
Yeah.
medical care.
I didn't even know what trauma was, I'll be honest, until I started looking at this information and finding these researchers. They didn't teach me anything about this in school, certainly.
Yeah, I just thought of the example of modern birth and, birthing in a modern hospital. I do not think that that is, I think that it's traumatizing in a lot of ways, the way it currently is, and doesn't give consideration to triggers and real compassionately consider needs of women and babies. I mean, that's
Yeah,
something, can of worms to discuss maybe in a separate video. But yeah.
it's
I, I
huge.
think I think sometimes too, and you guys all know this, is that talking about medical settings, we all know what we've experienced and what we've heard. And obviously we can't make sweeping generalizations, but we can just bring things up that we've noticed. And I've had an extensive period of time in multiple institutions around the country for long periods of time. And sadly, I think what can happen is because of the pressures that a lot of providers have on them, their work schedule, the time they have with the patients. We've talked about this early on in our seminar, is that what happens is situations that are meaningful and serious and traumatic and life or death can become very normalized to certain providers. So then the level of compassion and empathy, it's not like they're looking at your pancreas bursts and like they're like, oh yeah, we do this 3 times a day, like no big deal. And then but the person is having a very traumatic experience or being re-traumatized in a certain way, and it seems like that energy can get very disparate and separate and off, right? So someone's having a very traumatic experience, but it's not being validated at all. It's just like, oh, no, forget it. We got it. We do this all the time, like trying to downplay. So again, it's just for the providers to just constantly remind themselves, just like any of us here or any coaches or anybody who's working with patients or clients in this sort of capacity, is to remind ourselves to be humble and to look at each patient with fresh eyes and to not try to go on autopilot based off of the pattern recognition that we do hold with certain situations, and to instead realize like this is a human, they're experiencing this. I may have done this and seen this a million times, but for them it may be their first time. Let me go into my heart and bring my compassion here along with my logic every single time.
Yeah, absolutely. And to prevent these issues from beginning in the first place, to where they, don't have to escalate and escalate and escalate, to where we have, all these different statistics to share of all these different diseases, maybe, sharing some of this Eastern philosophy can actually give us some relief. Like, having the fact, like I shared before, permaculture as a potential solution and growing food and how that can solve a lot of different issues, just having plants on your desk or outside. I mean, we underestimate some of these small things, but they can make a big difference at the end of the day. Just as these small events in people's life and their upbringing can make a big deal later on in their life. So, absolutely. Here we have more from Bessel van der Kolk on facing reality. Simrad taught us that most human suffering is related to love and loss, and that the job of the therapist is to help people acknowledge, experience, and bear the reality of life with all its pleasures and heartbreak. The greatest sources of our suffering are the lies we tell ourselves, he'd say, urging us to be honest with ourselves about every facet of our experience. He often said that people can never get better without knowing what they know and feeling what they feel. Healing, he told us, depends on experiential knowledge. Quote, you can be fully in charge of your life only if you can acknowledge the reality of your body in all its visceral dimensions. So you can be in charge of yourself if you recognize the reality, right? And again, going back to some of the ideas we talked about regarding freedom as being essentially like a human need, desire to help us actually gain health, we correlate health with freedom many ways throughout this seminar. If we say freedom is our reality, or that maybe even health is our reality, can we come into terms with that? And that involves honesty here, being honest with ourselves and saying it like it is. If there's a problem, saying what that problem is. As Stephanie mentioned, maybe there's a little sheet that says, what are your concerns? What are your experiences? And really get in tune with people, but be open and able to be in tune with others. And as we have censorship and suppression, it prevents that honesty. And as you have conformity and as you have groupthink and all these things, it suppresses that honesty. So to encourage more of that honesty, it seems like we're more so wanting to face reality and wanting to heal and actually become free.
Corey, I just wanted to add here in the first line here, human suffering is related to love and loss. I agree with that. And when somebody is deeply suffering, the proclivity to isolate can become very high. And you bringing up permaculture and having a plan on your desk, like that may seem very frivolous, and somebody may say, well, what the hell is that going to do? It encourages somebody to care about something else rather than getting consumed in their own trauma over and over and over again. So, we're a community species. We're interconnected. So it's just I understand this is that suffering can create isolation. And what is most healing is an ability for us to reconnect with ourselves and others in a way where we feel safe and supported. So it's the disconnection, the suffering that can lead to disconnection that can perpetuate these traumas. And then if the traumas, these parts of us are not seen, and then you get a medical diagnosis because of whatever, and then the part is still not seen and it's acting out and it's misbehaving, then all of a sudden you've got a mental health diagnosis because you just deeply have a suppressed part that's not able to be seen or discussed. And then you can go all the way down the road into psychiatry and be really medicated, and really you just needed someone, who like Bessel or Gabor Mate to really say, what happened to you? I'm here for you.
Yes. Beautiful. And so escaping the trauma, right? Here's another quote. The mere opportunity to escape does not necessarily make traumatized animals or people take the road to freedom. Like Meyer and Seligman's dogs, many traumatized people simply give up. Rather than risk experimenting with new options, they stay stuck in the fear that they know. Traumatized people are terrified to feel deeply. They are afraid to experience their emotions because emotions lead to loss of control. Traumatized people are afraid of conflict. Trauma is about trying to forget, hiding how scared, enraged, or helpless you are. And this reminds me as well of the psychology approach of radical honesty and how much that helps so many people just being radically honest and creating like these support networks of people who are honest. And Stephanie, when you were talking, it reminded me of Seymour Saracen. We talked about that research before, and he was a community psychologist, and he coined what he called the anarchist principle, which again applied to psychology was like very insightful. It taught us that like, hey, we are community-seeking animals, but we also want freedom, and so we have to understand that individual and collective balance. And as we move forward, so rather than giving up and feeling isolated and hopeless, we can have that community that supports us. But what if somebody can't find that, Stephanie? Just to kind of give a little challenge to you. What do you think about that? If somebody's trying to forget about this, they could be distracting themselves on social media instead. Maybe their form of community is online. Is that the same thing?
Can you ask the question again a little bit differently?
Yeah, if somebody seeks community support, could they seek it online, or what if they feel like they can't find any community support? And this is an
Well,
open question to all of you.
yeah, I would just say if somebody has to recognize that they're suffering. There has to be an awareness that I'm not in the right place and I want to take action to try to get out of it. Or I'm not in the right place and I'm noticing that I'm doom scrolling as a way to escape my problems. Or I'm starting to become aware that I run away from anything when it's comfortable. So before we just, there's a process. It's a difficult process of, if you're alone and suffering, first you have to come to the awareness that you recognize that you're suffering. And then once you recognize it, there has to be a desire or willpower to follow through and start to consciously try to choose at your own pace better decisions. So, I realize I'm doom scrolling, and I realize that now. So maybe I'll let myself doom scroll for this amount of time, and the other time I'm going to go out for a walk and see if that helps me. There's a degree of agency that one has to be able to take responsibility for if they want to try to move into a better place. Sadly, I think part of our environment that we live in today desires to just strip that autonomy and agency from patients. And they'll say, well, I got you. Like, don't worry about it. We'll make you feel better. Here's an antidepressant. Here's a pill. Hang out with this group over here who likes to talk about their depression all the time and be in victim mentality, and we'll give you support for that. So, it's tricky. It's tricky. I mean, people can find community online. I would just say you need to feel it to heal it. And then you have to try to have the willpower to slowly move in the right direction. And if you are having problems tapping into this, I would just give yourself space to ask yourself, how do I feel? And how does this make me feel? How does this person make me feel? How does this relationship make me feel? How does my job make me feel? And then have the courage to answer honestly. And then the will and the courage to try to do something about that if it doesn't make you feel good.
Yeah. We gave a lot of spiritual suggestions before too. So someone might think, oh, well, what if I join a local church or get involved with a organization, right? What do you think about that? I mean, they might feel like, oh, well, based on what we shared, I don't really want to get involved with that because they were all kind of stuck in a cultural norm. And, right.
I don't think people who are really suffering are maybe they're not. Maybe, but I don't know that they're totally logically analyzing or judging things if somebody's just in a really suffering state.
Okay.
So I would just simply say, if going to church is making you feel a little bit better for the moment, then do it. And just allow yourself the process to evolve through things as you start to gain the awareness and try out different groups or peoples. And that will change as you evolve. But whatever it is, if it's just taking a walk or talking to your grandma or going to the church or going to Tai Chi or going to bingo, it doesn't matter. Fishing, if something is making you feel some relief, do it until you have the space to start to process some of those feelings to continue the journey. That's what I would say. What do you guys think?
Thank you.
My approach is similar, and I think that is the very starting point for anybody who becomes aware that they need to work on themselves and has either some deep issues or or are in the middle of some crisis or with emotion. In life circumstances. So, the doing things that make you feel better is great advice. Anything that can has some element of catharsis, such as movies, plays, music, things like that are very recommended. Now, one of the first things I would do and advise people to do is that self-empowerment. You want to have the base to where if you venture out and communicate with other people or with another therapist, that you have yourself to come back to if it doesn't work out very well. Because a lot of people are afraid it's not going to work out, or they've had a bad experience talking with a friend or family member or therapist. It didn't work. But they know that they need that. Okay. So the thing is to create a system of journaling where you make friends with yourself. You take that time with yourself to write things down, express yourself in writing, read it back over, or whatever, something similar to that, where you have yourself to come back to. And then from that base, that safe point, that you've created for yourself, now you can go out and seek some relationships, churches, counselors, family members, friends, that you can start to get deeper into your trauma and see if they're willing to listen, to help, and see how that works out. But at the core, you need that friendship with yourself. Otherwise, you find yourself deeper in if it doesn't work out.
Yeah, I agree with what you're both saying. I think that it's important to identify and then cultivate your personal interests. And a lot of people don't know what they like. They don't know what they would enjoy. And I think that's a good place to begin as you're doing your self-discovery process is, reconnecting with like childhood passions and those ideas that you had when you were younger about, oh, I want to go here, I want to do that, do this someday, so that you can develop hobbies, you can develop passions and follow through on them. And watch out for over-identifying with your diagnoses or your illness. As Stephanie was saying, that's often not helpful to just deepen an identification with a deficit, with a problem, but instead start to build a new self-concept that involves possibilities and things that you love and finding things to be grateful for, and ultimately find connection with other people, because the isolation is very dangerous on multiple levels. And when you're depressed, by definition, your thoughts become negative. You become more pessimistic, and social isolation is compelling, right? And so in those type of situations, the tool that you want to be thinking about using is like doing the opposite of what the emotion is compelling you to do. Because by staying in isolation in a depressed, negative mind state, you're deepening the rut that you're stuck in. So instead, finding openings to step out very consciously and intentionally into new experiences, new connections, and new people. And this will propel your growth. And so oftentimes people who are self-isolated and then also have a coexisting like negative script about themselves and don't have confidence socially. So it's all the more important, all more important to step out and face those fears and to build some connections and build successes and wins along the way in small steps. I think it's really important, whether it's online or in person. And through that process, learning about what is it, when do you trust? How do you trust? How do you develop discernment in social situations? How do you build your communication skills, conflict resolution skills? Because it's really in the context of interacting with other people that we grow and that we can more deeply heal and transform some of the wounds that have been holding us back.
Wow, thank you guys. I really appreciate that. And to add to some insights I think I got from what Leslie you were mentioning in particular is this idea of not necessarily focused on the goal but the journey. Like along the journey there's going to be a lot of frustration, there'll be a lot of tension, and that's going to make you a stronger person within itself. So, you may be focused on like trying to achieve something, but whether it's like knowledge and you feel like you're in a state where you don't know something, you having the trouble of trying to learn it is actually what you actually need. Is actually the goal, which is the ironic part because you're always looking there, but it's like, wait, what if this is what's there? Right?
I think
And,
just to be mindful, sorry, Corey, go ahead.
no, go ahead.
Just to be mindful of, I remember working with a client once and she was in her early 20s and going through a lot of difficult times. And we were going deep. And I asked her, how do you feel? And she said, I have no idea how I feel. I don't feel anything. So I think if we can accept that much of humanity, not all, we weren't really provided this skill set to manage our emotions. Or maybe we grew up in traumatic environments as a child, or we've experienced things where we don't have the skills. So if you don't know what you're feeling, if that's where you're at, that's also okay. And that you're not alone. And many other people experience that. And you can, with the right help and the right people, you can slowly start to access those base feelings and then work your way in deeper as you know, the individuals at hand feel stronger doing that. So I certainly wasn't taught any emotional intelligence or throughout my entire educational process, even in college. Like, this is stuff that I had to learn through a lot of hard won work, pulling myself up by my own bootstraps and suffering profoundly. And people who suffer profoundly, if they have something to share with the world that can help other people become aware of how to navigate their own experience, I think that's a wonderful, beautiful thing.
I see that this escape mechanism occurs both consciously and unconsciously, and that when he says that traumatized individuals seek escape, this escape can happen through automatically, unconsciously, through our brain, our body, mind systems attempt to stay safe. When a trauma overwhelms us, and especially if we are experiencing repeated exposures to traumatic events and chronic stressors, and the opportunity for integration does not happen, though the mind will automatically kind of bury some of those traumatized emotions into the system so that you can keep on keeping on in your daily lives. And so people often don't even know what's buried and what has been hidden inside, and then can have triggers that escalate them into an emotional reaction, but not even understand why. And then, as Stephanie pointed out, some people are completely cut off from emotion and don't know what they feel. And that is an example of a dissociative response, a depersonalization. That is one of the ways that people can respond to trauma. And so if one is shut down and disconnected, then the solution is what would be called bottom up, would be body-based, through movement, through touch, through connection, through, the opposite of frozenness, right? So there's so many, there's a lot of complexity and nuance to this.
But
Thank
Leslie,
you.
I think what you just said highlights what we've talked about before, is that the current medical model tends to do, I mean, I would say we do a body approach, because if somebody goes into the doctor and their lab's off, they focus on the body. But what we're still lacking is the interconnection between the mind-body relationship, and that how they both affect each other. And at some point, if somebody's struggling with mental health issues a lot that maybe are causing physical health issues, you have to be willing to, instead of throwing the medication at them right away, say, hey, let's try some body-based somatic therapies to get you feeling safe in your body again, especially if you're in a survival mode. And that's something that I just, I pray in my lifetime that I start to see more of, is that when people are, showing up with trauma and mental health and even physical health issues that are rooted in mental health dysfunction or trauma, that we're offering more body-based approaches that are usually cheap, usually you can do at home. Maybe you find a practitioner, and that can really help to keep the individual grounded while they go deeper into some of the trauma to try to integrate it.
Yes. And what came up for me when Stephanie, you were mentioning how, these problems can in a way be leveraged because they're teaching you something, and Leslie, what you mentioned as well is a permaculture principle, because it's not just about growing food, it's an ethics-based system of how do you care for a plant. Like you said, Stephanie, it's much more than that. It's like how you care for a plant is how you want to care for a human being in many ways. You want to raise them with everything that they need, right? So the problem can become the solution. If there's a problem and the plant is showing a certain sign, right? There's browning, or there's like it's not growing any fruit, then it's showing you, it's telling you that there's something that you need to look at. And then that problem not only shows you the solution, but it can become the solution. And so, like you said, like people can make a whole career off of sharing their trauma and their whole story, and now they become a leading spokesperson. So, there is a leverage, there is an ability, there's a talent to that. And I just don't want people to lose faith in themselves, and feel like they're helpless and they're the only one, or that there's nothing they can do from their point of view, because they certainly can have a deeper understanding of trauma than somebody who is just talking about it, right? Who may has not experienced it.
Yeah, the experiential model, I think, is what we need to integrate into our Western medical model, is that the wisdom that comes through the lived experience. And, Corey, when I was teaching yoga, often we used to say, just to reduce it, how you do one thing is how you do most things, or we used to say, how you practice yoga, how you show up on your mat is how you do most things, right? And you could see behaviors in bodies just consistently over time that would show up on the yoga mat. Like, this one's very disconnected. This one's very hypercritical. This one is
True.
perfectionistic. You can see it through the body every single time. But when you're traumatized and disconnected or disassociated, sometimes it's difficult to preach self-love from the jump. So again, like you said, what if we gave somebody, I mean, I'm sure this therapy is utilized. I know I've seen different things regarding this, is okay, we give somebody a plant, or we give somebody something to take care of, and then externalize that care and love as much as possible. So then you start to understand, to be able to pull it back and to realize that you're worthy of that same care.
Yeah. My dad and then his father, it became a generational thing, was handing out goldfish for Halloween instead of candy, because it would teach kids how to be responsible over something. And so,
Oh, right.
yeah,
Oh, real goldfish, not the
yeah,
food goldfish.
no,
Okay.
like actual fish. And so, like, but that a small little thing like that, I mean, can have an impact. And my
Sure.
father
I'm
remembered
sure
it,
the
and his
parents
father.
didn't love it, but
Well, they were like, "Oh man, well now the kid has to be responsible over it." I mean, I saw their reactions from some of the parents who were like, we were giving the kid's like, "Oh, I really want to fish." Parents like, "Oh no, you can't take care of it. You're not going to be able to." Like, you see, this is what I'm saying is, there's a lack of faith in people, and I'm not just meaning that in a religious context. I mean that, in a psychological context, but in a way both, because obviously faith can be very healing for people and helping them see their sense of self-worth, saying, "Oh, somebody's
yeah.
watching over me. He loves me," or saying, "Oh, I love myself because I'm connected with nature, and these are all one and the same, and we're all suffering together in a way." There's different ways to attain that faith.
Yeah, you're right, Corey. Thinking about just the goldfish scenario, and I've seen this play out, I'm sure everyone has, is, the parent assume, oh, you can't take care of that. And really, what that's saying is, I don't have the time to help you take care of that.
Right.
And it's, we should be giving kids a little more, responsibility to care for things so they can understand the importance of that.
So let's talk about trauma and brain balance, right? We talked about left brain versus right brain before, and how we might be living in a very left brain dominant world, or a world of materialism or consumerism or a dominative type of mindset, as opposed to one that allows and trusts, right? And perhaps we have to understand what we are allowing and what we're trusting and what is dominating over us, and where to use our left brain, where to use our right brain. But more importantly, perhaps, talking about this idea of trauma and fear, how does that relate to brain balance? Here we have a quote from Bessel van der Kolk: "The fundamental issue in resolving traumatic stress is to restore the proper balance between the rational and emotional brains, so that you can feel in charge of how you respond and how you conduct your life. Recovery from trauma involves the restoration of executive functioning, and with itself, confidence in the capacity for playfulness and creativity." We talked a lot about playfulness and creativity as being this very freeing force that can help a lot of people achieve a freedom, not just internally, but also externally within the world around us. Okay. So when we're talking about trauma, we're often talking about things that perhaps occurred in our past, right? And things that maybe have happened in our childhood that comes to resurface later on in time as well. So here's another quote. Our scans clearly showed that images of past trauma activate the right hemisphere of the brain and deactivate the left. We now know that the two halves of the brain do speak different languages. The right is intuitive, emotional, visual, spatial, and tactile, and the left is linguistic, sequential, and analytical, while the left half of the brain does all the talking. The right half of the brain carries the music of experience. The left and right sides of the brain also process the imprints of the past in dramatically different ways. Right. And Stephanie, you talk a lot about the left and the right brain as well throughout the course of this seminar, talking about the masculine versus the feminine, right? There's different ways to perceive this yin versus yang, just to kind of recap on what we're talking about here. And so what does she mean by a left brain deactivation? Here's another quote. Deactivation of the left hemisphere has a direct impact on the capacity to organize experience into logical sequences and to translate our shifting feelings and perceptions into words. When something reminds traumatized people of the past, their right brain reacts as if the traumatic event were happening in the present. But because their left brain is not working very well, they might not be aware that they are experiencing and reenacting the past. They are just furious, terrified, enraged, ashamed, or frozen. After the emotional storm passes, they may look for something or somebody to blame for it. Work by psychiatrist Ian Gilchrist supports this, and he notes that Einstein said that the rational mind is a faithful servant, but the intuitive mind is a precious gift, and we live in a world that has honored the servant but has forgotten the gift. So it's very important to see what our brain hemispheres are doing here when this trauma arises, and where is it coming from? And we're also looking at perhaps this idea of the left brain versus right brain. Is this really a science? Is this something we get more specific on? When you start looking at the works of Ian McGilchrist and what he has to say about these hemispheres and how exactly they operate, it gets to be more clear, because some people might make statements about the left versus right brain, and some others might say, oh, that's unscientific, there's no proof for that. And he kind of distills a lot of those claims within his work. So if you're interested, definitely I would recommend checking it out.
One can really use these different hemispheres, the left and right hemisphere, to process the other. And what I mean by that is your left hemisphere getting stuck in loops or circuits of words. And when that happens, you know that you need more of your right hemisphere, and you can fire up some music or maybe experience some wandering of your mind. And in that sense, the right is processing the left. Now, we're a lot more familiar with, or maybe can see it more easily, the left processing the right, because that's exactly what the last slide was talking about. And that was basically that trauma stays in re-stimulation, as we say, in the right hemisphere. And this is why talk therapy helps, because you're putting words to it and you're explaining it, you're putting meaning into it, and you are discharging the experience, so to speak, and putting it into an analytical framework such that a balance is restored. So it's really good in therapy to make sure that you're balancing and to kind of adjudicate which hemisphere the person might be stuck in.
Yeah, I'll add that I think that the left brain operates well in today's mad rush culture, right? Of do, go, go, go. And the right hemisphere really needs more rest. It needs spaciousness and slow down and time to introspect and reflect and feel. And so that's something that in our culture and our society is really imbalanced. And I think that is part of this dilemma that we're facing, that is reflected in the medical system as well. But it's really much broader and larger in the way that we often are living our lives, running from thing to thing, jobs, parenthood, take them to soccer, entertainment, do. So I think that there's really one part of the prescription is to do less and to find more spaciousness in your life and to be more present, coming back to present moment awareness.
To embark on a process of even beginning to understand what is being displayed through these sides of your own brain is a process within itself. And I think the important thing, as Leslie said, is that in Western culture, and as the quote says, we honor the servant and has forgotten the gift. And our culture constantly pushing us away from valuing slowing down to get in touch with the right hemisphere of the brain. Our culture works against us in brain balance, in fact. And when you can detach somebody from the creative side of their brain and really focus them in the left hemisphere of production and logic and academics and intellectualism, people can be steered in particular directions more easily than when somebody is operating from a full hemispheric capacity where they have more understanding to switch back and forth from the brain hemispheres and know when to operate from each when. We sadly have a culture that is very disconnected from the right brain and vice versa. So remember, I look at this as a beautiful relationship. Again, you can do this processing however you find that suits you best, but using the template of the right and left hemisphere as an example or a demonstration of a man and a woman in a relationship, right? It's a good start to help you understand that these energies do lie within you, and that if you feel that your masculine energy is dominating or devaluing your feminine completely, it actually is going to be harder to reconnect with the proper relationship within that hemisphere. So what I'm trying to say is, if we don't know where we are within our brain dynamics, because you could be extremely right-brained, very creative to the degree of being disassociative so that you can't really function in day-to-day matrix life. Like maybe you're awful at making money and paying bills because you're so far imbalanced in the other end, right? So you could be really imbalanced and have proclivities towards one or the other. But in order to create a relationship with these two hemispheres, there has to be a willingness and a receptiveness from both parties. So if you're extremely left brain and you're dominating, you're never going to want to allow her, the right brain, into your experience because you're going to think it's not of value. And in fact, maybe it looks crazy and emotional, and you got to shut that feminine and keep that anima out of your life. So what this requires is for you to face your own very deeply withheld trauma. You can't just say, I'm going to balance my right and left hemisphere of the brain, because probably if you're extremely imbalanced in the subconscious, somewhere in the story of this relationship, the one side's going to be pissed that you've been ignoring them this whole time. So then you have to sit with yourself and say, where have I been taught that I can't value my feminine? Where have I been taught as a man? Or where am I very uncomfortable with my own feminine energy? Or for a woman, for a man, you have to go on to a journey to start to heal and cultivate a better relationship with both of the hemispheres. And it's truly a lifelong journey. It's not just something quick you can attain. It's about understanding, going back, healing what you've been taught, and then opening up a new relationship between both of these energies to operate according to what's most appropriate in the time space that they're in. So it's like doing your own trauma work at some point to get these to be more harmonious. You can't bypass that and just say, oh, I'm just going to learn I'm going to just educate myself in my intellect of how to do this. That doesn't work with inviting the balanced right brain in. Like we said, the right brain is experiential. The left brain is logical. So you can't use your logic to integrate your feminine aspect. It has to be experiential. So now all of a sudden you're using your brain very differently to try to integrate both of these hemispheres in a more healthy relationship. And the feminine might be more experiential and emotional. She has to learn the value of honoring her intellect to be able to have that relationship with the left side of the brain. So it's kind of like taking what you're normally used to doing and then understanding that there's a huge blind spot that's called your whole other half of the brain that you haven't been valuing. And then you have to learn how to expand your perception to start to create this relationship where you can operate from both.
Wow.
And getting into a relationship is a great way to do this. You can do this on yourself, but if you get into a relationship, typically that person will mirror back the aspects of the blind spot within you to help you integrate this. If you're in an aligned partnership that can show you these shadow elements. And it's complicated because often when we get into a relationship that seems complicated or they're mirroring something back that we don't like, we can have the tendency to automatically label that toxic or narcissistic. And this is where discernment is used. You have to say, is this person legitimately toxic for me? Or are they triggering things within me that I'm not comfortable looking at within myself? And it's better to press on and investigate what's going on here.
Wow. I love how you
Yeah,
also mentioned, like, you might overthink trying to use your right brain. Use
Doesn't
your
work
left
that
brain for
way.
your right brain. Yeah. It's very
Yeah,
interesting.
and a little more on that. I'd like to, talk about integrating the two. When you integrate the two sides, the left and right hemisphere, one of the things that you will see in a person who's done that is they're no longer trapped in black and white thinking. They can actually integrate a lot of things in the outside world and in knowledge together. And there are a couple things that have worked against it. And one is this idea that, the old school, which was the head should rule the heart. And, that's a very masculine concept. And it's actually a pretty essential concept for young men to take in, as long as they don't, completely abandon the right hemisphere. Now, along comes the new age, and the new age says, oh, well, the left side is pretty useless. It's not going to help you to grow spiritually. And so then you get this right brain or right hemisphere focus. I don't like to use the word brain on this because I think as a spiritual being, you have these two hemispheres. Okay. And yes, they're reflected or mirrored in the body as sides of the brain, and you can actually trace them out. But my point here is that, again, to reject one side or the other, and as Einstein's quote in that slide pointed out, that both of these are essential, and that the idea is that we put these together. Okay, that we don't. It's not a matter of which one's better. It's a matter of, we'll put them together. We have the power of both and the integration of both, and that is something that a lot of physical activities using the right side, left side of your body is a help to this. Of course, therapy is a help to this. Talk therapy, getting your right hemisphere experiences into the language and back and forth. And then you have a very intelligent and capable individual.
And I would add another tool to help integrate would be journaling by hand with a pen or pencil and paper. Yeah. Expressive writing.
Yeah, there's specific tools that can enhance the communication between the different sides of the brain. So I've heard journaling with your left hand, journaling with your non-dominant hand can help you get in touch with the right side of the brain. So if you're very logical, that is a skill that you would use to get in touch with your right brain. So if anyone is watching this and they're wondering what the heck we're talking about, you can go back in our lecture here, quite a few series where we do talk about and break down some of the qualities that are represented in each of these hemispheres, so you can get an idea. And you can start simply and just say, these are the qualities of the right, here are the qualities of the left. If you're more advanced, you can say, here are the healthy qualities of the right, here are the less integrated or traumatized behaviors of the right. Then you can start to see, where do I lie on that spectrum? And you can do that with both. And then you can simply just start to become aware. Okay, I'm analyzing everything and I'm very dominant and I'm very, oh, maybe I should pause here and see what I can do that's a little bit opposite of that behavior, so I can try to work towards a little more balance. So it is kind of this complementary opposites kind of thing. Doesn't have to be super difficult. If you notice that you're being very dominating and you're trying to control everything, you can be aware, which is a huge gift. By just being aware of where you are in the moment, you can catch it. And then you can say, all right, I'm being super controlling here. What is the opposite of controlling? Oh, the opposite of controlling is going with the flow. Okay, is there a way that I can start to lean into the behavior right now of trying to embrace going with the flow a little bit? And there you've just done a great simple practice and exercise for you to start this process.
Thank you for sharing that. Also, a very practical tip, trying to journal with your left hand. I like that.
Mhm.
And, I think Leslie also mentioned this idea of presence, which you touched on just now, Stephanie. Being able to perhaps like reflect on, okay, what am I doing before I do it? What am I going to do? And it's simple, not even a practice, presence alone, just breathing, just like taking the time before you do something. That's like a step of no step, I would say. And nothing's really required for it except just a breathing, being. So I find that to be rather powerful since, we're talking a lot about presence through a lot of these slides as well as being a potential remedy. We also saw in the Gestalt therapy, presence was heavily emphasized. So I could see that being very powerful for this because you don't want to get trapped on one end or another end. And how do you get trapped? To see that trap that you're in, you have to be able to say, okay, where am I? What's going on? There has to be some level of presence, awareness.
And that also involves developing a witness, which is a bit of a movement back, like to a bird's eye view, to that higher self, where you can notice the part of you that knows you're thinking, the part of you that is scanning your body for sensation, being in the present from that place of witness and noticing is very powerful and important for this
Yeah,
person.
what you guys are describing is actually working towards the spiritual, or you could say actually the feminine part of the brain. So if you're actively and healthy in a masculine, or say your job is a firefighter or an emergency room doctor, a visionary, holistic, a visionary, let me stop and be present perspective is not useful in those situations. So again, it
Yeah.
depends on what you're doing. That masculine is, I solve problems, I get things done, I'm there for you in a jiffy if you need me. It's not slowing down. It's not so being present, it's taking action. It's like, I got to act now. You got to act quick, and you got to be direct. So the goal would be then to say, well, eventually you do want to kind of be, this is very high level thinking, but you do want to try to be able to be in your masculine job as a firefighter or an emergency room doctor and immediately act, but still kind of have the holistic purview at the same time. So you're not so funneled in that you can't see what's around you. But the point is, I want to be very clear that we're not demonizing or poo-pooing somebody who's not having a witness consciousness when they're a firefighter. Because
Well,
these are
I'll add this. I think to be an effective firefighter, you have a very focused intention that's action, but to do it well, you also need to have a grasp on your own fight or flight responses and your own, um, presence in terms of evaluating the reality of what's going on rather than perhaps a traumatized part of you. So
Sure.
if someone's going to
Yeah.
function well and optimally in an ER, it does involve a certain self-awareness.
Right. Of
And
course.
that's what we're really calling for here, is that ability to be in action and be connected to, let's say, the empathic, do you have an empathic connection with your patient, let's say, so that you're not just, a robot, doing a job and not connecting, but to have an awareness of yourself walking into the fray. And I do think that is a high level skill. And it's one that, I'm familiar with as a therapist, because I need to be pretty grounded and aware of myself and my thoughts and my emotions and my responses to what my client is saying, right? As I'm operating from the left brain, so it is a skill, and I think that it's one that isn't really taught
It's not
at
required.
all.
It's not
And
required. And
yeah,
if you're going to school to be a young doctor, you do not have what you just described, Leslie, often. It comes with time and experience. You need to really, because if you're a med student and you go on the floor, you just don't have the capacity to be fully empathetic, fully holistic, fully in the moment. It takes time and experience. But I agree with you guys, is that we're missing an opportunity by not emphasizing the importance of this training sooner than getting 25 years experience for you to become the empathic doctor when you have the magnificent skill from the start. So I think we would start to understand that you don't have to say, oh, you'll be a good empathetic doctor in 25 years because of your experience. Actually, you can start to implement and teach that stuff along with the skill much sooner. So I totally agree with what you're saying, but it's not a requirement for the fields that we have now, because there's an assumption you're going to get your skill here and you're going to learn a little bit about this. But over time, that's when you're going to become excellent at your field in 20 years. Well, what happens to all the patients who are seeing those doctors or providers straight out of med school or early on? We're missing an essence there. So
the skill
like you
of
said,
self-awareness is missing. The skill as a learned skill that anyone working in a medical field, health field, therapeutic field really should, to be an ethical provider, learn, in my opinion.
Right. I think that is one of the most important clarion calls, Corey, my word, clarion calls that we could shout from the rooftops. It's what I was trying to do with my nonprofit, is teach the value of self-awareness in healthcare. And again, because it's so focused on the other, that usually, there's just so little focus on even the physical health of the provider when they get out. We're not even stressing physical well-being. So if there could be some sort of course or educational program where we're taking the providers and really implementing a course on self-awareness, not saying that the experience, they're still going to need the experience. But if you can plant these seeds early, my goodness, I think it would just be so remarkable to at least have that going right off the bat.
Yes. Wow. You guys touched on a lot of really big points. And of course, we talked before about law enforcement, firefighters, military, and what the traumas they go through, right? And how they might have imbalances within their own lives, their own relationships. Meanwhile, they're fighting some people across the world, and maybe there's a relationship there that they don't see that's causing them to have an imbalance in their personal life. So it's all relating to this idea of balance and opposites and yin and yang and masculine and feminine across the whole scale of society. And as we dive into politics and health systems and all the systems around us, it's the same thing as Stephanie's mentioning, as the male and the female in an individual relationship, but just on a bigger scale, perhaps manifested.
So you brought up the military, and I think that it's intentional that, let's say, people who go through the military training are trained to disregard, to ignore their right hemisphere, their feelings, their empathy. It is considered a detriment to doing the job of a soldier in some respects, right? And so I think that's also been carried over somewhat into the medical field, where you're seen as a technician, you're seen as a left brain specialist, and you're kind of going into battle and you just need to know how to shoot the gun and, kind of follow orders and so forth. And that's part of the mentality of the authoritarian dominant, world that is overemphasizing the technical aspects and disconnecting people from their emotional and empathic, compassionate parts. So this is a really important point, this imbalance between the left and right hemisphere and how it is translated into job duties and action in public, right? In certain jobs and so forth. I think it's part of what's creating the problems we have.
I will add that in Taoist thought, since we've talked about yin and yang numerous times, there's this idea of Wu Wei, which actually represents sort of the balance between the left and the right brain hemispheres. And it's taking the cold cognition into the hot cognition, as it's said, right? So you can look up these terms, cold cognition, very rational. Hot cognition tends to be very instinctual. So how do you, kind of connect the two? Wu Wei means without action or without effort. It doesn't mean literally like no action at all. It's really a sense of flow, as Stephanie Mo Davis even said, that, the opposite of control is flow. As you get out of the cold and into the hot, you start to get more into the flow state, as they call it.
Yeah, I'd just like to say one other thing quickly. So if we have healthcare providers watching this, okay, if we have people who understand this logic of how they're trained, I think one of the most important things for us to realize and conceptualize and try to mitigate is that if we can't figure out a way to cultivate providers and practitioners that can start to develop this skill, then what we need to do as a authoritarian system, right? Like, oh, we're the most advanced and we have all the research and all the information. You got to do what we do because we're the medical system, that we know best. Well, maybe you are extra skilled at being that technician or that logical provider or that surgeon, and you've got an amazing skill and you have no desire to start to become holistically minded. Okay, then we need to compensate for the lack in that system some other way. So now you are no longer the sole arbiter of authority. You are an expert in one part of the human experience of health and healing that you do well. And then now we're going to create some sort of parallel system where somebody's emotional, spiritual, and mental needs can be addressed as a holistic being, coupled with the expertise of that system that may want to stay more in the technical left brain side of things. They can no longer say we're the arbiter of what everybody should be doing with their health and wellness if they aren't even holistically minded to begin with.
Yeah. I also think, I want to be clear that I'm not saying that a technician, say if you're a surgeon, you're a brain surgeon, right? Your job is to be very pinpoint accurate,
Right.
and that's going to be more left brain.
Right.
And so I'm not saying that everybody needs to be all in their fields while they're doing their left brain job, but
Good
I am
point.
saying that there's a process internally when you are operating, let's say, as an EMT, right? And you're going on a site and it's like a horrible scene, right? But you need to be really focused and you get your job done, right? Your right brain is still registering. Your system is still registering the traumatic aspects, the grotesque aspects of what you're experiencing. And often frontline workers will experience accumulation of those traumatic experiences, and something can kick them over into a PTSD. So there is like a health maintenance almost, of being attuned to how your own system operates so that you can metabolize your experiences on the job, that you can reflect and visit and invite the emotional responses, and do work to become balanced. I think that it's not just like this magical thing about we're going to have a balanced brain on all the time. It's about
Right.
learning how to process your own mental, emotional bodies and check in on yourself and do that balanced work of, let's say, expression, the right brain work, as opposed to just shoving it away and shoving it down, where it then, later becomes a big problem.
Right.
Yeah, I mean, the reality is that sadly, there's going to be a whole host of people who aren't interested in doing this. They're like, oh, my life is great. I'm a musician. I don't have to worry about anything matrixy. I got people to do that. And there's going to be left brain
Yes.
people who are, just into their tech and their field, and they're not really interested in that. And we all understand that. It would be awesome if everybody did their inner work and we could work towards more of a holistic balance. That'd be ideal. But in the meantime, if you are a healthcare system and you're getting all the financial resources and the grants to be an exemplary system of whatever, and you're missing this holistic capacity, we need to change something within that system somehow to give the people who are interested in balancing themselves and health and healing, we need to provide something for that very formidable and growing group of people who realize that they are out of balance, they're traumatized, it's affecting their health, they realize their mind and body is connected. So now something needs to fill that space because it's a gaping hole in the system now. So that's, I think, where we're at, is if we can't get everybody to do their own inner work, and that's what we're hoping for. If we're not there, then at least for now, we need to come up with something to provide more holistic care in the meantime.
Yes. Well, when you say, these claims like people don't want or people should, or these are claims calling for health providers or for the whole idea of health to exist, I would argue, is because there's something that's missing or something's not fulfilled. The word health, literally, as we talked about before, means whole, right? So really, all this, what we're doing, whether we're talking about a brain disease model or not, is trying to fill the gaps and trying to create a balance out of the imbalances. And as Leslie mentioned, with expressing ourselves, goes back to this idea of expressionism and humanism, this idea of honesty, right? Just being ourselves. What if we already are whole? What if we already are one with nature, as the spiritual traditions have said, and we simply have been closed off to that, which we already are, which we have right here in presence, which we already have. We simply have not been channeling into it.
Well, we have a fix-it model. We have a disease-centered model, which is not a spiritual perspective model. And then one last thing I'll say is that no matter where you're coming into this conversation from, if you're a left brain person, a right brain person, a holistic intelligence person, if you're whatever belief you have and whoever you are, if you're involved as a patient or a provider, I would be hard pressed to say that almost every person couldn't be in agreement by saying the healthcare system is broken. So that at least demonstrates on a collective aggregated level that there's something we're all missing. There's something has gone awry and something needs to change. So that should at least be an invitation for a broader conversation.
Right. Well, let's delve deeper into this brain disease model then. See this perspective more from Besser van der Kolk. She looks at four fundamental truths that she says the brain disease model overlooks. And so, one, our capacity to destroy one another is matched by our capacity to heal one another. Restoring relationships and community is central to restoring well-being. And, Stephanie, you mentioned this idea of relationship. And community has been talked about quite a lot through the course of this work with Seymour Saracen, community psychology, right? Bringing people together is essential for their health, which is why isolation tends to cause a bit of issues. And we've faced that recently as a civilization, which frightens a lot of psychologists. Also, language gives us the power to change ourselves and others by communicating our experiences, helping us to define what we know, and finding a common sense of meaning. But of course, the other side to this, the shadow, you might say, is language can be a little bit on the left brain, right? If we aren't perhaps expressing more of the artistic sense of language, right? Depending on what we're using language for. And so you could always try to see the opposites of some of the things I'm mentioning, some of the shadow sides, being that we're constantly looking at this. Number three, we have the ability to regulate our own physiology, including some of the so-called involuntary functions of the body and brain through such basic activities as breathing, moving, and touching. And again, these help us bring us more toward perhaps the right brain and goes in line with this idea of presence and what we talked about with soma therapy, right? It's really able to free a lot of people, and people felt they were more connected to each other than their own families through the exercises of touching each other, just through the exercises of being present and aware of their own feelings. Incredible. And number four, we can change social conditions to create environments in which children and adults can feel safe and where they can thrive. Can we create those social conditions as a whole? And that means we might want to challenge some of these overarching systems like the medical system and the government, as we see these have great impacts on people's health, especially when we're talking about statism, which a lot of our work has been about. How is this affecting people on a trauma level? How is this affecting people with their brain balance, right? These are the questions we have to ask. And here is another quote. Psychological problems occur when our internal signals don't work, when our maps don't lead us to where we need to go, when we are too paralyzed to move, when our actions do not correspond to our needs, or when relationships break down. So again, Stephanie, you said relationships, this is a key factor of knowing when we're in our balanced state or not. And so maybe here are some of the warning signs we can find out. Are we paralyzed? We feel stuck. Our actions are not really leading us to what we want. And our relationships are just never really working out. What's going on here? Well, what if Bessel can help us look at these systems? Here are more quotes. Medicaid, the government health care program for the poor, spends more on the anti-psychotics than on any class of drugs. Children from low-income families are 4 times as likely as privately insured children to receive antipsychotic medicines. These medications often are used to make abused and neglected children more tractable. In 2008, 19,045 children aged 5 and under were prescribed antipsychotics through Medicaid. On one study based on Medicaid data in 13 states, found 12.4% of children in foster care received antipsychotics compared to 1.4% of Medicaid eligible children in general. These medications make children more manageable and less aggressive, but they also interfere with motivation, play, and curiosity, which are indispensable for maturing into a well-functioning and contributing member of society. So we're looking at this one and we're saying, hey, here's all these benefits, right? If we solve this, we could solve that, and this is what we got to do, but we may be overlooking something that is really important. And again, we can do this for a lot of systems we create, as we say, well, we have to create this big thing over all these people. And if we do this, the greater good, right? We'll make sure that they get this and that. But we're not seeing what we're doing in the long run. We're not seeing what's happening behind the scenes. And then these come to resurface, and then everybody wonders, well, how did we end up here?
Right. And another side effect of the antipsychotics is weight gain. So children will end up overweight, and then, all the cascading effects of that. And for individuals who are on antipsychotics for years throughout their life, and I've met some people in their later years, it causes cognitive damage. It can damage the brain in other ways that really limits their potential.
Yes, we talked a lot about, drug problems, and a lot of the issues with, illness as well. And it just seems like we're creating more drugs and there's more illness. So what's going on here? Is the drugs really helping the illness? Is the current medicine model really helping? Right? This is why
And
we're here.
commonly with an antipsychotic, there's a side effect that then they prescribe another drug to decrease that symptom. And there can often be a 4 or 5 pharmaceuticals prescribed, to the same individual.
Wow. Yeah. And we also know that, some brain diseases or illnesses, quote unquote, may not even be something that has to be treated with a drug and classified even as an illness. And
Yeah.
that there were many cases of the past where certain things were classified as illnesses that nowadays we'd say, what is that? That's not an
Right.
illness.
One really eye-opening experience I had working at a community mental health agency. It wasn't my client, it was a colleague's client. It had a little 4-year-old boy who was incredibly aggressive, and they put him repeatedly in inpatient treatment, and he would go in, he'd come out, and they put him on all sorts of medication, and it wasn't changing his aggression until a very open-minded and innovative medical provider did some nutritional testing and found that he was deficient in an amino acid. And
Wow.
once he was given the proper amino acids, his entire affect and behavior changed.
Wow.
Yeah, I think that this may be something that happens more so in the future, Leslie, is that I'm seeing now, I'm doing a lot of research too with a subsect of primarily women who have conditions such as Ehlers-Danlos syndrome and ADHD and autism and giftedness. There's this big correlation between a multitude of things that now they're linking back to methylation issues, biological pathway issues. So I think because for so very long, we either didn't have the skills or tools or determination to go deeper and again treat the present moment without really taking into consideration the long-term effects of some of this stuff, is that actually we've done this a lot with some of the ways we've treated disease, is we're not taking things deep enough or back far enough or looking into the genetic line or the DNA or the biological pathways. And I think that's probably going to be a part of the medicine of the future, is realizing that a lot of our conditions maybe are coming from biological pathway disruptions and things like that we've just, like Leslie were saying, are throwing not just one medicine, but now compounds of medicine to try to deal with these things.
Mm-hmm. And then soon, potentially machines, right? When again, the solution could be very simple and incredibly overcomplexified and overlooked at that point, right?
The
So, we
more
got to put a
rigid,
whole new
yeah,
machine go into somebody's body. It's like, to get to that extreme, right? What is required?
right. The more rigid the protocol, the more rigid we are in following certain protocols, that are just correlated with helping a certain disorder. And especially if we allow computers or AI to be doing the assessment and the prescription in some way, which I could see happening more and more, we're going to miss these subtleties and these nuances. We really need the human mind in a state of balanced brain to be expanding outside of the, I guess, best protocol, that doesn't always apply to every individual, right?
Yes.
So,
Be interesting to see what happens.
Yes, I mean, I'm sure people will make the case and say that there are AI therapists out there that may help them more than their current therapist. And that's a reason for why AI should take over, right? And maybe we say, hey, maybe they actually are because they're looking at more things than their therapist and they're talking to them and they understand them and they listen to everything they say and they remember everything, right? But like you said, Leslie, there might be some things, even still, even with all the knowledge in the world, that is lacking. And I don't know what you guys think about that. I mean, to what extent, how much knowledge is beneficial, and is knowledge everything? Well, we talked about perhaps the issues with the left brain thinking, but can the robot have emotional feelings or at least give the illusion of it? And is that illusion still good? Or is that illusion also a problem?
it's a
Corey,
big can of worms.
this is a great point, and I know they've already done studies where they've tested patients in a blind study, and they've said, "Did you prefer this provider or this provider?" And it was overwhelmingly leaned towards people preferring the AI over the actual doctor. And I think the reality is that part of the reality is that it doesn't matter how skilled anybody is in anything. It doesn't matter if you're prolific in your field. is that when you take an aggregated wisdom from AI into any subject from hundreds of thousands of other providers and put it together, they're always going to trump the human because they're going to have more information. But the thing is, if you look at this whole brain structure, like we're talking about on a macro level and not take it out of us and take it on a macro level into medicine, is that when you do that, when you have the AI algorithms to be solely the treatment plan of the provider, there's no feminine, there's no care, there's no consideration, there's no empathy for the story, there's no empowerment. Like, yes, AI can also, they're getting better at being able to hold that space as well, but there's something very powerful in a resonant human connection that's mutually caring and reciprocal and empowering that really does truly heal. So you can't take it all the way with just a machine. You need the human.
Yeah, I think this has a lot to do with how our world has become so online focused, where we are seeking services online through telehealth and so forth, compared to in person. And there is something that happens when you are in person with other people that you cannot get, you don't quite experience in the online forum. We try and we can get sort of close sometimes, but I really encourage people to shift away from all the telehealth and online to, to experience in-person relationships and community and really sense the differences and on a very deep level of satisfaction and fulfillment. Because my sense is that the online world is going to keep us hungry for something that we can't ever get online.
You know, what's very interesting about what you're saying, Leslie, is that you're right, is that we become more adverse to human connection when we have the convenience of being at home, often, unless you're, very needy or codependent or only trust being in person. But what's so interesting is that in the realm of, providership, we talk about transference and countertransference as something that needs to be mitigated and we need to be mindful of. But what nobody ever talks about, because this is advanced physics, this is more quantum physics, like the telepathy tapes that's being revealed in different CIA programs, is that there is actually incredibly powerful resonant energetic transference that can happen between humans too, that's not on the negative side. So there's not projection involved. It's actually an energetic connection that can amplify individuals' level of awareness and consciousness and love if you get the right people together in the right field. So again, nobody talks about this. We talk about the negative aspects of transference and countertransference, but nobody talks about when you get two right people together in the right space and time, what effect that can have on the human psyche and the human body.
Wow. And you're right. There are CIA documents talking about all sorts of this stuff that I could point people to if they're curious. And they're deeply interesting. It's like, why are they studying this? And they talk about it very deeply. They have a lot of doctors, a lot of physicians. They spend a lot of money on this. And so it is taken, I would say, rather seriously by some of these departments. And, while other people would say it's pseudoscience and you should not look into it at all, I think that eliminates the possibility of this, which can be incredible. And it's funny to me because possibility within itself is a right brain, I would say, tendency. So, when the minute we start taking out the possibility, I start to question things itself, right? In regards to science, because science is supposed to, I would say, challenge itself in order to truly evolve, as we talked about with scientism before. So, thank you guys. Great insights.
This technology is already being used, just not by the mainstream.
Right.
Right? It's been specialized, hidden, used in three-letter agencies. It's people do use this technology, and it's breaking through now. Most scientists are starting to break into the realm of quantum and understanding how things are working on a much deeper, profound level. But that is a next level power.
Yeah.
That people who have the access to it at this point, the agencies or whomever, are afraid to get in the hands of humanity, because then we become much more powerful when we start to tap into that space.
Right. Well, think about, this quote here as well. talking about drug treatments, right? And so, because drugs have become so profitable, major medical journals rarely publish studies on drug treatments of mental health problems. Practitioners who explore treatments are typically marginalized as, quote, alternative. Studies of non-drug treatments are rarely funded unless they involve so-called manualized protocols where patients and therapists go through narrowly prescribed sequences. So you can see all this kind of left brain orientation, even if you're trying to do something somewhat alternative or right brain oriented. It says mainstream medicine is firmly committed to a better life through chemistry, and the fact that we can actually change our own physiology and inner equilibrium by means other than drugs is rarely considered. So, what we're sharing here, this idea of telepathy or other ideas, I mean, these are rarely ever considered, if not just straight up denied in the first place. Like, yeah, no, it's not possible, and I don't want to look into it. When it's been talked about, if anything, I would say for thousands of years on this earth, right? So it's like it is plays a big part, I would say, even just in our psyche alone that concept exists, that there's such a thing as telepathy that we can call. Nonetheless, the fact that it may actually exist.
We're about to have a really big head-on collision here because the physicists and certain mathematicians and certain people, aside from the spiritualists, who again, a lot of the spiritual people have been aware of these kinds of gifts and mechanisms for a very long time, Corey. But what the current medical model really leaves out is the potential of consciousness. And if we elevate and become more conscious and aware, how does that change our relationships with ourselves, with others? Things they change, they level up. So the current medical model has no space, or there's no dialogue being discussed around, wow, can we elevate or make somebody more consciously aware? And does that have impacts on somebody's physical, mental, emotional well-being? So that's a whole nother body and field of study that if that opened up into the medical system would have to fundamentally change. So I think there's just this cutting off of this stuff seeping in because they realize it would really demolish the system as they know it.
Yes, I know Mark Passio in his seminar Cosmic Abandonment, where he's talking about the Sumerian history, and apparently, according to that history, there was a DNA splicing that took place, right, where there were certain figures that came to Earth and they modified DNA. Mark said within the seminar that if our DNA gets modified at any point in time with certain technologies, that consciousness would be able to override that, perhaps.
Yeah,
So I
and
think that kind of it goes into what you're saying.
yeah, it's funny because when you kind of think of like the whole time space continuum, it's like there's stuff that's discussed in the ancient past, but actually we're very much living it today in the present moment. So
What
you're
if
right.
it's resurfacing? What if we're trying to go back to the past?
Yeah, yeah. Well, that's what they say often, that sometimes, you're living life from present to forward, but at some point it tends to flip, have a pole flip where you realize, oh, you're actually living your life backwards.
Well, and I think that the past, if unprocessed, can create the future unconsciously, and the
Mm.
future that we don't necessarily want, because I don't think the goal is to go back in time to any particular ep, epoch of life. I think it's about creating something new that we haven't really experienced as a species, and that will involve a lot of work, right, on healing the past so that we can be operating from that balanced brain and that place of full awareness, and then activating our creative abilities to create something new.
Yeah.
And that's what I hope for the medical, field, and really for life in general, is that we can heal as a species and create something we haven't experienced before as a humanity that is much more, I guess, harmonious with our ability to be happy and to fulfill our potential, which I think is we're not. So.
Yes, absolutely. And here is, some of the other problems that we have, when it comes to treating trauma. this idea of CBT, cognitive behavioral therapy. Here's a quote from Bessel van der Kolk, has not done so well, he says, about CBT for traumatized individuals, particularly those with histories of childhood abuse. Only about 1 in 3 participants with PTSD who finish research studies show some improvement. Those who complete CBT treatment usually have fewer PTSD symptoms, but they rarely recover completely. Most continue to have substantial problems with their healthy work or mental well-being. So, this goes against a lot of perhaps some mainstream wisdom saying, hey, you got to use a certain therapy, you got to do this certain method, this is what everybody uses, this is the standard protocol. Maybe not, right? There's somebody here who's challenging that, who has written books about, who has talked to a lot of different people and shares a lot of different statistics showing the opposite, showing the different point of view. And if you don't see this point of view or consider it, are you really looking at all the potential options for treatment? Are we really looking at the whole? Another thing is SSRIs, right? So SSRIs can be very helpful in making traumatized people less enslaved by their emotions, but they should only be considered adjuncts in their overall treatment. After conducting numerous studies of medications for PTSD, I have come to realize that psychiatric medications have a serious downside, as they may deflect attention from dealing with the underlying issues. The brain disease model takes control over people's fate out of their own hands and puts doctors and insurance companies in charge of fixing their problems, right? So again, a lack of freedom, and he even uses the word enslaved there. Over the past 3 decades, psychiatric medications have become a mainstay in our culture with dubious consequences. Consider the case of antidepressants. If they were indeed as effective as we would have been led to believe, depression should by now have become a minor issue in our society. Instead, even as antidepressant use continues to increase, it has not made a dent in hospital admissions for depression. Right, so this should become more and more evident that the solutions may actually be causing the problems, if not making the current problems worse. And here's a final quote. The number of people treated for depression has tripled over the past 2 decades. 1 in 10 Americans now take antidepressants. So, whether there's a correlation between the two, either way, we can all agree, as we said, that the medical system is failing and that we need to change things. And perhaps we got to look at all our different options, and especially those researchers and doctors, physicians that are not really being heard, who are being censored, who have a lot of information to share, and they're not even being taken perspective of. I mean, incredible.
Corey, we need to really suggest to individuals who may be watching this that even if you are a longtime provider or you're really dedicated to health and medicine as your calling, is that these are the statistics. They're real. It doesn't mean that you're not doing a good job or you're not trying or we don't value what you do. But it does mean that you need to open your mind, because there are things that exist out there that appear to have outlying perspectives that actually need to be somehow addressed, heard, implemented, that may actually start to contribute to a more healthy system. So if you're finding a lot of resistance about challenging your own belief systems and indoctrinations and education, please try to soften for the good of the system, for the good of patients, for the good of yourself watching this, and open up to some of these things that are maybe just slightly outside of your comfort zone, and really be curious about how they might help your patients and the patient, and maybe even yourself.
Yes, thank you. Very necessary reminder for sure. And as we often talk about, we're not the health authority on this matter. We're simply sharing a different perspective and challenging this whole idea of authority, because where is that authority supposed to be placed? Is it supposed to be in the doctor, in the practitioner, or actually in the patient and the person that needs to be heard from, and the person that is actually trying to heal themselves and their own body, which has the capability of healing themselves? And can we see that?
Yeah. Healthcare providers are a part of the healthcare process. It just needs to be, we need to remind all of us of that. There's an important part there, But the goal is to integrate the patient as the center of the care in their process to become self-sufficient, if capable, to empower themselves to make some changes.
Yeah. Well, here's a slide talking about this. How could we achieve more of that agency with ourselves and others? Bessel van der Kolk tells us somatic therapists can help patients to relocate themselves in the present by experiencing that it is safe to move on. Feeling the pleasure of taking effective action restores a sense of agency and a sense of being able to actively defend and protect themselves. When people are forced to submit to overwhelming power, they often survive with resigned compliance. And I just want you to notice the words being used here, right? These are different quotes, but this idea of restoring agency, actively defending and protecting yourself, right? Not necessarily being dependent on other people to protect you. Somatic, what does that mean? We talked about somatherapy and somatics before, this idea of the body, being in touch with your body and your emotions and experiencing. Survival, that's a very low chakra, right? A left, you could say more of a left brain kind of primitive sense of like, I gotta make sure I do this, very reactive, but maybe we can get out of that, be more responsive rather than reactive. And compliance, are we just doing what we're told to do, or are we actively working with consciousness or conscientiousness and choosing what is right for us to do and knowing what that is, as opposed to just because a doctor says so or a policeman or what have you? Here's another quote. As we have seen, much of the wiring of our brain circuits is devoted to being in tune with others. Recovery from trauma involves reconnecting with our fellow human beings and maybe a true connection, not an inauthentic connection. This is why trauma that has occurred within relationships is generally more difficult to treat than trauma resulting from traffic accidents or natural disasters. Isn't that interesting?
Yeah, I wanted to comment on this idea of safety and the
Mm,
difference between cognitively knowing you're safe, logically, with data to be able to say, yeah, I know I'm safe here cognitively versus feeling safe in your body. He's making a point here about the somatics being very important, that we actually feel physiologically safe. And sometimes we could know we're safe logically, but not feel safe at all. And that's where the effects of trauma can be operating, unconsciously within our nervous system. And so it is with the somatic experiencing that and therapies that we can start to shift to integrate our somatic experience of safety with our cognitive and be in alignment. It's really, really vital.
yes. And then, through those soma different types of therapies, if we're doing it with others, we're doing the exercise with others and we're doing martial arts with them, or we're, getting out and active with them, with our neighbors, maybe we're growing food together, right, in the same neighborhood. I mean, imagine the community that builds. Imagine the benefits that are being layered on top of layers for health, right? We're talking about layers of problems. Well, what about the layers of solutions that can be built? I mean, that's a
Yeah.
whole nother ball game, but that can be incredible.
Yeah. And another point around the online world versus the in-person world is I think many people are getting their social needs met online because it feels safer
Mhm.
because of the distance in a sense, but are really experiencing anxiety when going out into the real world, having trouble, going into grocery stores, being anxious, joining a group, and so people's worlds can get smaller and smaller. And
Yeah.
we need to be careful that we're not just relying on the internet as our form of socialization as a way of escaping or avoiding the actual real world, because of an anxiety that hasn't been resolved around being with humans. Yeah.
And again, I think it goes back to potential as well. Some people don't see they can build a community in their environment when they actually can. I've been actually showing that to a lot of people in the freedom community and people who care about different ideas, is that it is possible to meet people local to you, and that there are a lot more people who think like you, and you're not the only one, even though a lot of people think that they are. And I would say if I talk to any average person, I talk about like, hey, living off grid or living with like a bunch of animals and like nature. Everybody's like, yeah, I want that, or I want that for the future. One day I want to have a nice garden. Like I hear this from a lot of people, right? But what is stopping them? I mean, they're on perhaps YouTube and TikTok and they're watching a bunch of other people doing it instead. Right. And it's getting hundreds of thousands of views, if not millions sometimes, of like, oh my gosh, that's so cool. You're living the lifestyle I want to live. But like, are we actually creating that? Can we create that right now? I mean, we could be following vloggers living their whole life the whole time,
Yeah.
and where are we living ours?
Yeah, living vicariously through others.
Parasocial. Yes.
Yeah, and I think a lot of these like VR glasses, this idea of having all these experiences through the glasses and separating from our actual physical reality in our world, it takes us, it's a way, it's in a form of escapism, honestly, you know.
Well, one thing we're doing is we're meeting in person, right? So we're not just doing the seminar, but we're meeting in person as well to discuss it, to actually talk to people on the streets and actually do very interesting things with this knowledge. So we're not just, sharing this with the online world. We're trying to integrate different aspects, even with just this work.
Yeah, that's an important point. Yeah, and it's a hard one to figure out sometimes how to do that and make room in your life for all of that. But I do think that is a next step, right? Is to figure out how to bring the online work into like streetwise work, street
Right.
level.
Mhm. I want to bring up something related to the slide before we move on that really struck me. It's a personal story, but I'll make it quick regarding the somatic therapists and regarding what Leslie was saying. Is we've come to understand now that there's a logical understanding, but then do you actually embody the understanding? Do you feel safe, even though you are technically safe? There's this separation and trauma. And then down at the last sentence here, it says, why trauma has occurred within relationships is generally more difficult to treat than trauma from traffic accidents or natural disasters. So I actually had the opportunity to play out the experience within a very traditional healthcare setting at a very prestigious institute in America, Johns Hopkins, where I was hired as a somatic therapist who had a lived experience, which in my case was organ transplantation, to be a part of the traditional healthcare team. And it was mind blowing. The patient's recovery process with what she was facing, when you had the Western healthcare model or the professionals alongside somebody addressing the somatic part of it, and then the true care and empathetic and experiential lens of having someone to sit with you who's had a similar experience. And at the end of that several month project, the patient who made miraculous recoveries in lymphoma, she had a team from all over the world with her, and I was a part of that team. And again, I maybe have appeared to be the smallest part of that team, the most irrelevant part of the team, right? Like, oh, here's another girl who had a transplant, and she also does yoga and somatic therapy and breath work. Like, oh, we'll just bring her along because it looks good to help the patient, right? But at the end of the day, that patient was asked in front of all of her providers, the entire team, and she said, you have recovered. They said, you had recovered so miraculously. What helped you the most? And one of her top answers was Stephanie. And I felt a little nervous when she gave that response, but I had the foresight. I was understanding. Oh, I get it. She's getting all the top-notch medical care, but her lived experience, her personal journey, her healthcare story is being coupled and met with somatic therapies to help her feel safe in her experience alongside somebody who already been through it. It was a really divine experience. So any healthcare provider that's listening to this, when we talk about things like somatic therapy, this is the potential, is to also take the emotional load off of the providers somewhat and have them to be able to emotionally process with somebody who's been through it is also another plus. So there's a lot of win-wins that can happen if we can just open our mind enough and investigate how we can do things a little bit different, which again, the system is so compressed for time and resources and energy. And then you have all of these, pandemics and things happening, which makes it even worse. But if we did have the energy and resources, there is an incredible potential to simply couple somebody who has a lived experience of a health condition, or a somatic practitioner, a breath worker, somebody who can emotionally process with you. It makes life easier for the provider, it helps the patient, and it provides further healing for the person who's the experiencer or the somatic therapist on board. It's a win-win-win if we can just figure out, open our minds enough to start having more pilot programs and trying these things out.
Yeah. So what do you think, about connecting patients with each other? It sounds like that's in a sense what you're talking about. I know that certain physicians can't share, or they might be afraid of sharing information about other patients to other patients, but in a way you're kind of arguing that might be necessary for healing, right? So you have to kind of set up a bridge in some
Yeah,
aspect.
I personally think that, HIPAA, which is the you can't violate Privacy Act, it's good and it's bad. But I do think in our case, it was actually done at a prestigious institution with me on board as a part of the medical team, even though I wasn't hired by the hospital. And it was incredible for everybody involved. So I'm hard pressed to think that if it was done there, that it could be done, it could be repeated with the right people who were willing to give it a try and start to change some of the ways we did things. Corey, they already have mass conglomerates of peer-to-peer mentorship programs where patients are helping other patients. Mm-hmm. It's different. It's still beneficial, but it's different when the team is valuing their work, their work in a patient who has overcome and is showing very positive results from the medical care and then the other things that the patient was doing to help them heal and recover. That seems to just amplify the potential for health and healing exponentially when that person is valued as a part of the health and healing process. Basically, what you're doing is you're inviting a healing component onto the traditional healthcare team. So it's not just healthcare. You're now inviting somebody, an energetic force, onto the team who has a lived experience, who's maybe applied some of these somatic therapies and done a lot of emotional processing as at least a bridge, a gateway to deeper inward potential for them to overcome and be on a healing path with their healthcare. So it's another option. I'm not saying it's the end all be all, but I think it has phenomenal potential.
Yeah, I agree with you that the key is trying some different creative solutions. And I worked at a healthcare center that was very committed to an integrative healthcare model, and they had care managers and care coordinators. So there were two levels of providers. One, the care man, oh gosh, I forget the basic difference was someone who was a therapist level, and then someone who wasn't, who was more of a peer, more of a case manager type, but we were available on the floor. And so when a medical provider, did an intervention with their patient, and if they perceive that this person had, emotional issues going on, that they needed more psychological or emotional support, they would hand off the baton to one of the care manager people or care coordinators to come in and to spend time with that individual and listen and go deeper and to figure out what are the psychosocial and spiritual needs that they could follow up with them. They could help link them to services. And it was very helpful. It was very effective. And so when in that setting, there was an expectation and an openness for the mental health team, the behavioral health team, to partner with the medical provider. So I had a very tight, rapport with a particular doctor who referred a lot of clients to me, and we would meet very regularly. We would talk about them, and we would provide a lot more support and scaffolding to these folks. And it made a big difference, and it's possible to do within our healthcare system.
Yes.
Yeah, I want to say one other thing, Leslie. I love what you're saying. Is I'm just going to be very direct and blunt here. Is that I've actually had providers tell me straight out that they're somewhat afraid to bring a patient on board because they might give the patient wrong advice, or there's liability issues, or maybe the patient isn't as empowered as they would hope, and that they're afraid that the patient might say something negative about the healthcare team, or like, and I've actually had other patients just come right out and say, yes, we don't think our patients are smart enough to do that.
Mm.
And that's very, very dangerous, because maybe there are patients who are in a victim state of mentality, and they shouldn't be the best example of one of these sort of on-team peer-to-peer mentors. But there are a lot of people who are very capable and prepared and well-trained, and maybe have some sort of education from their background that can really shift the needle. So to just simply rule it out and say, oh, we can't have a patient on board because they're just not smart enough to handle this kind of thing is very dangerous, very reductionistic, and they're missing out on, like Leslie said, you can get closer and closer to the patient's experience that has the greatest capability of a transformational process, either psychically, emotionally, or physically for the patient. So, I mean, I've had 2 organ transplants. I was asking for this along my whole journey. I went through my journey many, many years ago when HIPAA was really first being implemented. And when I said, please show me someone who's been through this that I can talk to, and they said, no, we can't legally because privacy. If I would have had somebody who just said, look, I went through this, you expect this, you might have this, I got your back if you have questions, it would have made my process so much better to know, oh, there's somebody who lived through this. Okay, I can breathe for a second.
Yeah.
It's a ridiculous excuse because all you need to do is sign an ROI, right?
Right.
That's all it takes. It's ROI on 2 sides to connect people. And it's very easy to do. And so, that kind of HIPAA confidentiality excuse is just that. It's an excuse, and it's a laziness. And it's a lack of understanding of the importance of connecting people with each other. Because just as this slide says, that the trauma that results from relationship wounds is more difficult to treat than trauma from non-human, right, experiences. It's the same. The relationship is what can be the most healing.
Yeah. Yeah. Leslie, I just want to just parlay on what you just said there, is that that's exactly what happened to me when I was in that process, was that the patient that I was coupled with, my friend, beautiful friend, said, this relationship that we're creating, this sense of trust and vulnerability and intimacy that I have with you to talk deep like this, to have this meaning around my health experience, is something that I've never experienced before. So I could tell right off the bat, like you said, this development of a healthy partnership in their relationship and deep intimacy, and going there and talking about the things that really scare you, or the very complicated things. And to have someone say, look, I've been through it. I understand what it's like to not be able to make it to the bathroom or whatever. To just have that vulnerability and sense of trust, again, maybe part of the healing is just creating a healthy, trustworthy, deep, intimate relationship with somebody. That's part of it.
So, and based on what you guys said, what comes to mind again for me is, well, somebody might go to YouTube then and say, oh, well, look, this person experienced what I experienced, so it helps them feel better. So, like, I can kind of make a little bit of a spectrum here. You have AI, right, which they could talk to. Maybe there's a certain AI that's like, claims that lived through their experience and knows all about a certain condition. Like, I am a diabetic AI. You can ask me anything about diabetes, right? But then if you go further along toward more connection, you have the YouTube person who experienced it is sharing their experience with you, or somebody online. But then you go further along and you have that person who's there with you, right? Who you can talk to, who you can build a connection with. Am I correct there on, like, in the degrees of which you are building a connection to to your
I
own
think that's
problem?
useful. Yeah.
It's
Observant.
useful. And I think one thing to just mention, Corey, as you were describing that, is this tendency or movement towards using robots or AI or tech to replace people is that it's an attempt to fundamentally change relationship. And if anything, the way we're going culturally and societally is that we need to get reconnected with our soul and back into human connection and relationship, not further away from it.
Yes. Powerful. Thank you very much, guys, for sharing that. And so we have to ask the question, how do we feel about traumatized people treating traumatized people, right? What if the doctors, the patients, even the peers, they're still traumatized? What if there's traumas that are not being addressed? And maybe, as we talked about before, the normal could be abnormal. What could be called healthy can be very unhealthy. What is called a doctor or an authority in health and somebody who should take control of everything that's going on in your health, what if they are still not fully healed? What if they are still going through a lot of different problems? Maybe that could be an opportunity. Like Stephanie, you shared, oh, well, what if the peer says bad things about the medical team? For me, in my eyes, like, oh, that's a big opportunity for the medical team to improve. But, we may not be looking at it like that. And it depends how we're going about this. Are we inviting the shadow? Are we inviting the dark side of ourselves to constantly heal, but never claiming to have the authority on health? Right? Because I think that's what we're getting at with statism is like, hey, there might be a bunch of people who can help you, but are they the authority where you have to use them for your help and for your health? Right? So how do we feel about this relationship? Are there traumatized people treating traumatized people?
Of course
Yes,
there
there
are.
are.
Of
And
course.
there's,
That was it. That was an easy answer. Gosh, you guys all answered at once. But I mean, that doesn't sound good, right?
I can imagine that statement being exceptionally triggering for certain people that may be watching this, especially who've
That's
worked along.
okay. Honestly.
It is okay. You're right, Leslie. It's okay because to a degree, we all have issues.
Because when we get triggered, by a statement like that, that is just a sign to go inward and explore why. Scott, you started to say something. Did you have something you wanted to expand on?
yeah, I wanted to comment that in this question, there's a follow-up question to that, and that is, what about the differences in the way people respond to trauma? And if you're familiar with Mark Passio's work, you might know about his abused abuser chart, in which there are two possible responses to abuse, and which, is a form of trauma. And those two possibilities are the person is going to become an abuser, or the person is likely to become more subject to abuse. Now, there's actually a third thing that happens with traumatized people, and that is, are they going to resist the impulse? Because the nature of trauma is that somehow there's a release or relief mechanism in the body where, and this explains why people dramatize trauma on others, okay? And there are two different kinds of possible responses there. The person is either going to internalize the trauma and keep it directed within, which is not good for their health. There's going to be health issues. Or the person is going to freely dramatize it, do whatever they, without restraint. And this is the potential therapist that you do not want and cannot have. So this is the therapist that would get his license taken away pretty quickly. And that is the person that is unable to deal with trauma when the trauma comes up or comes up in the course of therapy. And it's going to come out in passive aggressive little ways that the therapist may not be aware of and may not realize. And that is basically the therapist is going to sort of sabotage the whole trauma therapy. And I can't say there's a perfect way of identifying one or the other, but if that is known in a group that is, and I come from a group that does, groups that have done a lot of co-therapy, okay? And in the course of co-therapy, you have two traumatized people are going to help each other. And most of the time it works out very well because there's a lot of care involved, and that care factor and understanding of two people that are trying to get through their issues can be a very big plus. And like I said, there's just a minority of people that you'll have to watch out for if you're supervising this type of group or getting people to do co-therapy, is that you're going to have a certain individual that's going to need that extra support to get through their deep trauma, which they cannot seem to help themselves refrain from dramatizing. And that's destructive in the therapeutic relationship. And there's the abuse victim cycle. And on one side, the experiencer is going to identify with the victim, and the experiencer becomes even more of a victim. And, they're the victim of the abuse, or the experiencer identifies with the abuser. And so this is the type that I was referring to, someone who's unable to restrain that impulse, because it's kind of a psychic field or a psychic energy that is taken in during the trauma, and it's waiting to be released. And it can be released in one of two ways: through illness, one of three ways: through illness sometimes, which is not good, health breakdown; through therapy itself, which is ideal because then we can process this; and then there's the unconscious dramatization. This person goes out and, you look at all these people that are in the institutionalized in the prisons and in the psychiatric wards. A lot of them are unable to restrain the dramatization, and they're, you can sometimes even see it in their behavior. They're dramatizing what was done to them, often as a child, and it can be in almost any type of abuse situation, but often as a child. I know that I can see in myself when I endure a lot of attack from others, I have to be a little extra careful that I'm not on a short fuse myself. And I think a lot of people can relate to that. You get enough abuse, stress, or attack from others around you, you kind of feel this pressure where you have to let that back out. And we've talked in our presentations about getting out into nature, which is a very nonviolent and very healthful way of dealing with it. There's therapy, which is a very productive way of dealing with it. But if you don't have a productive outlet, you're at risk. So that's something to keep in mind.
I liked that chart because at the bottom, both sides went into the box that said, like self-abuse, like abusing oneself. And I think that is really true, without proper, healing, direct healing work, the self ends up suffering, whether you are an abuser, that, there's going to be a consequence to your own psyche and your own health, and often, even a self-punishment that might come. And then if you are becoming more of a victim on a, repeated cycle, then you are also self-abandoning and there are many people that end up turning to suicide or addictions, different ways of abusing your body, and different critical parts that do not allow one to really be at ease in the world, right? So this is a pretty important chart, and I think that that window in the middle is the window to take, is to face the traumatic events of your life, to be willing and open to do proper healing work through knowledge, care, and will.
Mhm. Yeah, I just want to add, Scott, you were talking about being mindful to not be on a short fuse, hopefully, if things are coming at you. This is one of the reasons why proactive health, a healthy lifestyle, can be very, very powerful. It just simply helps to keep your battery more balanced and in a positive polarity. If you're drained and you're unhealthy and you're partying or you're an addict or you have unhealthy relationships, all of these things break down your core life force, which creates more tension and the capability for you to handle less tension in your life. And life can really throw you a lot. So if you're constantly running on empty because you don't take care of yourself, or you don't pick healthy relationships, or you eat terribly, or you don't look at your inner workings, you're more susceptible to being tripped off and that fuse to go off much more frequently in your life. And then maybe all of a sudden you identify as somebody who got a poor card at life, or you're a victim. And well, maybe it's just simply because you aren't sustaining your own life force as well as you possibly can. You got to take responsibility for trying to keep your energy and health in the upward direction as much as possible, fully understanding that some people do have illnesses that's not, they can't do that. But for the most of humanity, we could all do a little bit better job keeping our life force energy up by simply being healthy, mentally, physically, choosing healthier relationships, and having the courage and having the willpower to change when we need to make changes in our life. Some very fundamental core life tenets.
Beautiful. Thank you guys. Great insights. And yes, this chart came from Mark Pascio, in case you're curious more about this abuse victim cycle. So thank you for that. We have another question. Are we ever suppressing or contradicting our choices or our own conscience? Right? So we talked about this idea of like, okay, we may be traumatized and treating other traumatized people and not seeing this sort of contradiction. But what if there's also that contradiction as well within ourselves that we have to address, and with our own conscience, our own decision making, right? This may relate with the previous question. Are we choosing right action over wrong behavior? And do we understand the differences? What's going to actually help us and what's not? Like Stephanie just mentioned, are we healthy or are we not? I mean, there's a lot of debates about, what is considered healthy and what is not, right? But I think generally most people understand what is considered healthy as opposed to what is not. So, is there a contradiction taking place where you're saying, hey, I should not take this healthy action that I know is healthy? And am I going to create all these justifications, all these excuses not to do it? Am I going to suppress that capability? Am I going to be externalizing that, right? The external locus of control, and give it off to somebody else? Are we in control of our own choices? And do we see where it might be false control or where we might be contradicting ourselves?
I venture to say that we're all, to some degree, in some area of our life, if not many areas of our life, suppressing and contradicting, and not acting through conscience. And I think that is a result of living in an authority-based system, and all of the catch-22s that we've alluded to throughout our conversation. It puts us in a corner. It backs us in a corner to some degree, where we have decisions to make in our work scenarios, in our personal life. And I think it's an important question, what choice is aligned with my conscience, with what I know to be right. And sometimes just to keep your job, or just to keep, for a person to keep their job, they're making a choice to suppress their own conscience. And that will you know, take a toll on you mentally, spiritually, physiologically? So this is a really good question for people. And not to say, are you? And you can say, oh, no, I don't. But to say, I know I am. Let me find out where.
Mhm.
The other point to what you're saying, Leslie, is that we don't really have a culture that really promotes evolution, self-evolution. It's that we have these structures that kind of lock us and bind us into legal things, contracts, jobs, marriage. I mean, like these things are, I'm not saying these things are bad, but when you start doing inner work and you start evolving as a person and healing and integrating and individuating and becoming more aware, sometimes you do find that all of a sudden you really are not aligned with the career choice that you made 15 years ago, or maybe even the partner. And then because you're bound, you're legally or bound into a relationship, unless you can find a way to work on that within that context, this is usually when the psyche or people begin to fragment and then do other things that contribute more harm into the public or into the self or into the relationship, because there was never room to really evolve in it anyway. So for an extended period of time, it seems that we've just kind of lived that way and have accepted the amount of honesty and vulnerability that could be shown in public. But now something has changed where people are realizing we haven't been honest. I haven't been honest. I haven't done my self work. I want the truth. I want to evolve. I want to become better. I want to have something better. Well, then that requires a lot of structures, how we've had them, to be dismantled somewhat and be shifted into a degree where we can show up as we evolve in that new state of being. I mean, just think of, the medical culture, and what happened very recently in the pandemic is that if somehow you went through an awakening process through that pandemic as a healthcare provider, you didn't have really any other choice but to hide it and lie and conform to the culture, or to leave and break out of the culture and be seen as a conspiracy theorist now. There was no room to simply question and be curious, which ironically, I think that's the whole fundamental basis of the scientific method, is to remain curious and open and evolve and admit when you're wrong.
Right.
But most of the structures that we're in don't freely allow for that sort of growth and change to happen. And even if you're in a partnership, unless you have a partnership with both parties are really willing to do the work together and evolve mutually, often you find a problem at some point if one wants to move and the other, doesn't want to change. So it's just a different way of living and doing things. If we structure things around our hope and expectation that we are going to improve and evolve and change, and we need a little bit of freedom to be honest and have these difficult conversations, not just to be back in that black and white thinking of, if you're not with us, you're against us. Now that you're questioning experimental therapies and medicine, oh, you got to get out, now you don't belong here. Very immature and reductionistic way to live as a human being with the potentials we've been given, I feel.
This is a really important question, and it kind of addresses another side or another dimension of therapy, actually. And we kind of touched on it in the abused abuser chart. And that would be, if the person winds up identifying with the abuser. But on a much more subtle level, and this is inescapable in life, and Leslie and Stephanie both have brought out that life presents us with all these choices. And inevitably, with so many choices to make every day, under a lot of pressure for some people, inevitably we're going to make mistakes and we're going to regret some choices. And when that happens, the temptation is to justify. And here we're getting to the solution, therapeutic solution to this, is to really dig in and find our excuses and justifications. And that's really behind a lot of self-improvement, especially the positive self-improvement, where do you really want to go out and make money and take life by the horns? Because you weaken yourself when you allow justifications and excuses. And so they're entire movements, or surrounding this self-improvement movements. But basically the simplicity of it is, yeah, we got to realize that we do make mistakes, and how do we recover from those? Do we try to correct them? Do we review them regularly? That's called processing it. And if we are doing reflection, or in real time, if we're doing like mindfulness, we're mindful of our choices, and we check back to see if we made the right choice. And we can probably make the most progress here for all concerned by just seeking to uproot our justification. Say, look at that and say, that's a justification, that's an excuse, recognize those for what they are, because enough of those will tend to cloud our conscience enough to where when we get a serious abuse, we are a little bit more likely to slip into the, well, I'll just be an abuser because I'm no longer listening to that little voice or that conscience. So that's how that happens, actually, when you work all these things out in therapy. There's the little things and the big things, but the little things can add up to a really big thing.
Would you say, Scott, then if to get away from all these justifications, that we try to find some level of principle then, right? This idea of principle, which is like acting according to some sort of norm, but not necessarily a norm that constricts us, right? So trying to find like a balanced type of principle.
I think, yes, that principles can be extremely valuable, because principles are stable points where we have a preset decision. I will never do X, when faced with Y, or, various things. You can call it policy or principles. And if you have those set, whether you adopt them from religions or your favorite, principles to live by, or you just collect them. I collect them as I go along, and then I sometimes put them together, my personal code of honor or something. And it's really so helpful, because when we look at the stress of being faced with so many choices, it lessens the stress considerably, because we go, nope, I'm not doing that. That's trouble, and you keep your marriage in good shape, and you're much happier for it, right? Or whatever, your job, your personal integrity is very important, because it's what we get up, or we go to bed with, and we get up in the morning. Our personal integrity is so key to all this. So yeah, I would say that principles are a very helpful thing to adopt and to have in mind.
Right.
Great point, Scott. I think that, if you operate through those principles you're describing, that type of way of establishing kind of like boundaries of your own behavior, then you have a lot fewer regrets, and you create a lot less chaos.
Yeah. So perhaps we'll talk more about that with, Thomas Saz here, and our hypocrisy that we might see within ourselves and our world in relation to our conscience and our decision making, so we can get clear on what those principles are and perhaps achieve more self-sovereignty or autonomy. So Thomas says, in fact, most individuals diagnosed as mentally ill do not initiate violence, while most psychiatrists routinely do just that. So perhaps here's some of the hypocrisy, typically at the behest of parents, spouses, social workers, lawyers, and judges. This violence is conceptualized and accepted as diagnosis and treatment. And we talked a lot about the problems of these labels, but going back to it, we can see that there's maybe some trauma, some things that have to be addressed within ourselves. And using a quote, we claim that mental illness is the name of a bodily disease, but use it to identify behaviors and conditions for which we do not hold the actor responsible, because this fictitious illness supposedly impairs his ability to control himself. And so this idea of self-control is something that we keep emphasizing a lot through our work, right? And this relates to this idea of self-ownership, which is core to basically libertarian philosophy, he tells us, right, as a psychiatrist. And this is the belief, self-ownership, that basically everyone has the right to themselves, right, to own themselves. Very basic. And that initiating violence is a fundamental wrong, or claiming that you own somebody else. In contrast, he says psychiatric practice is based on the belief that self-ownership, epitomized by suicide, is a medical wrong, and that initiating violence against persons called mental patients is a medical right. And this is, again, a very unique perspective, but it's one that has been shared across a lot of the researchers we've talked about regarding psychology and looking at the issues of psychiatry, which, these two can relate. But the point is that people are being labeled, they're being diagnosis. There's going to be diagnoses for all sorts of things, some things that might actually be helpful, but in many cases, we're labeling this person, it's dishonest, it's not really caring for them, and it gives us an excuse to perhaps give them drugs and for insurance companies. And we see there's a lot of issues with the DSM and that there's alternatives to that perspective. So in case you need that insight, be sure to check it out. What we did, we talked in depth about these topics, but understand this idea of self-ownership, right? Because this goes beyond any book. This goes beyond any doctor or politician. This is an idea that, you are in charge of your own health. You can create freedom. You can take back your own power. And you don't have to be a victim, but you also don't have to be the abuser, right? You can simply be yourself and be healthy and happy. I think this is what most people want, but we often are playing by these extremes and these imbalances and contradictions, and we may not see it.
I just wanted to share that this these two slides remind me of individuals I've known who have been involuntarily hospitalized and had very horrific experiences, some of them life-changing, altering experiences made by individuals who worked in the facilities who then judged, wrongly. And there's a lot of, actions towards people who are in hospitals that are very traumatizing. Many, many people come out of psychiatric hospitals very traumatized and afraid to even to go into a mental health system again for fear of that experience being repeated. And I have stories I can tell, which I won't do here, but I will say that this is an important topic for discussion because there is in the system the option of a provider designating the other person as unable to make their own decisions, that we could 5150 a person if they're a risk to self or others, or if they're gravely disabled. That's a really big place of power to be, to make that decision. And then when that decision is made, then that all of a sudden can lead to justifying police force. And like you said, Corey, all sorts of pharmaceuticals and kind of locking people up literally. And it can go wrong. It can become very hurtful.
Yes, and Scott, you're very familiar with Thomas Haz's work as well regarding this, libertarian philosophy of self-ownership and, this problem with psychiatry. So, thank you for sharing your experiences before regarding even, your escape from Scientology and wanting to share those tools freely for the public and helping them achieve their self-ownership, but without reliance on a whole new medium called Scientology to have to achieve it, right? Because of course, when people escape one cult, they might go to another, or when they escape one trauma, they might fall to another. And there's this issue, again, of contradiction or hypocrisy where we have to be very careful.
Exactly. And in all those cases, you're talking about losing your right to self-ownership, whether it's in a cult or with the state. And I wanted to make some further comments, yes, about the state. Thomas Saz is confronting the state head on. And we have examples in history that are absolutely horrifying, whether it be the Nazi Germany of World War II, or the experiences deep within Soviet Russia in the camps, or even in China with Mao and the education camps there. Or anytime the state gets out of hand in a country, whether that be South America, Southeast Asia. And to our shame, in the United States or in Western civilization that should be civilized, we preserve that exact same situation when we take away a person's individual rights and make them, quote unquote, a ward of the state, which is what happens when you assign somebody into psychiatry, institutional psychiatry. And the horrors that we are horrified against, these wartime or Iron Curtain situations are right there in our hospitals in our own cities. And a lot of people are unaware and in denial. Actually, sometimes I'll bring up to somebody that, did you know that electric shock still goes on? Oh no, that they haven't done that for decades. Yes, they have, and they have been. And involuntary drugging with some extremely debilitating drugs. The drugs are actually designed to debilitate so that you're unable to move. And yeah, the straitjackets, the other things. And granted, there are some cases here that appear to be unsolvable. And so, but yet we have examples like a psychiatric hospital in Italy where violent psychiatric criminals were taken in by someone who did no drug therapies of any kind, no violent treatments, and was able to run an institution without those things that we think are necessary, because it's very difficult to confront a person in a state of psychosis or in a psychotic break, or, which can involve a lot of violence. So yeah, this is a very, very difficult thing to look at. But one of the things that a healthcare provider can take from this is that, and we saw a little bit of this maybe during the lockdown and the hospital protocols, is when individuals begin to lose their rights and the state begins to trump those rights, and then you get a medical situation, it can result in death and wrongful death. And we saw a lot of that during the lockdown, and those things are still being litigated. And we're still actually in danger because we haven't resolved the whole idea of pandemics, whether valid or not, as health crises, and how the state is liable to take over, and impose authority on individual choices in healthcare. So this is a very, very important thing. It's one of the most difficult things to confront in the field of healthcare, in the field of human rights, is the idea that we don't know what to do with Joe because he went crazy. So we called up the cops and they took him away. And I mean, Joe is being subjected to violent treatments, most likely, brain surgeries. That is still being done as well. People won't believe it. It's not very common anymore because it's been recognized as barbaric. But the fact that it's being done at all is outrageous. But that is still the state of this branch of healthcare, which is psychiatry.
Unfortunately, I think a lot of people who work in psychiatric institutions are afraid of the expression of mental health disorders, and because of their own fear and likely lack of holistic training, they often overreact. And if that overreaction, like let's say restraint, is culturally accepted and promoted within that institution, it can be abused in a really extreme way. And I've witnessed that myself. And so there are a lot of, being in a mental health, a state of disorganized mental health, or being decompensated in some way mentally is frightening. But it's very vulnerable. It puts that person into a vulnerable state, which is why it's so important that those who are intervening are ethical and have self-awareness and self-control and are brave enough to speak up when wrongdoings occur.
Yeah. Yeah, I mean, it seems like based on what both you guys said, Scott, Leslie, is that there needs to be self-ownership everywhere, whether it's, in the medical facility or the political realm. Any of these systems, people need to be conscious of themselves and their actions, and not just see self-ownership as like a privilege, but a right, a fundamental thing that's like inherent, because you cannot, be another person, and you cannot control another person. You can only attempt to do so. Right. So that this is an understanding that's being given, right?
I think it's a responsibility,
Mm,
even more so.
yes.
And it takes a real saint, to use a word, to implement. I mean, these people that can handle psychotic people are golden. They're very valuable. They're very amazing people, because it takes a lot of personal stability to confront the degree of instability in another, and to do it in a nonviolent way that can de-escalate situations. I've aspired to that for a long time as a therapist, and I want to be able to confront and cover the whole range. But it is terrifying to confront psychosis in other humans. It's just, there's no word to describe it unless you've seen it. And I've been inside an institution, and I've been surrounded by psychotics that were kind of babbling, and I would classify that as one of the most terrifying experiences I've had. And yet I lived through it, and I'm glad I did. But it's for those who are not aware, I mean, we've had movies about psychiatric institutions, and even, One Flew Over the Cuckoo's Nest is a great movie because it introduces this idea. But that's a very tame institutional environment that you're watching there. We're talking in these padded rooms, real violence, and situations, and unpredictable situations that break out. Some of them are depicted in the movies, and I don't think a lot of times Hollywood overdoes things, but I don't think they do when it comes to mental psychosis. That's a real tough one to confront.
And the interesting thing is, you say this, and you're saying, oh, it's really bad. People usually use that as an excuse to say, we should not look at these ideas of freedom or self-ownership because of all these bad people. But you're saying, no, we should look at the self-ownership and freedom, and there's all these big problems. So isn't that an interesting connection? Because people usually
Well,
separate the two.
yeah, and the thing I like to point out is what we're afraid of, that these psychotics cannot calm down or cannot be restored to sanity, is actually not true at all. It's the fact that we feed this violence by meeting violence with violence. And I'm trying to describe how the person who's trying to de-escalate or process this violence, it's possible to do. And like I said, they are rare people. There's a psychiatrist in Italy that you can find on the internet that has done it very successfully. So it can be done. The problem is that, knowing that it can be done, the state has not been able to or willing to, because the state is the state. And they have thrown police and police force type force at this problem instead of intelligence, intelligently getting through it. So that's a great point. We don't want to get into the idea that we're justifying these systems because those people can't be helped. That's not true. Those people are a challenge. We should pay the people who can do it very well, and it would actually save us a lot in the long run because people can be restored. And Thomas Saz has books about this, you know, and he was that type of psychiatrist, and he had many people that he helped. There's some other guys like modern day Peter Bregan, getting up in years, but his entire life has been defending the rights of psychiatric patients and helping people do a non-drug, non-invasive therapy to restore their sanity. So all these things are possible. It's do we have the will to do it? And we should be doing it. And why aren't we? Is a kind of a question. But the other thing I wanted to point out and really point up is when we're talking about the state or statism, in conjunction with healthcare and human rights, we're talking about the same type of thing. It can be a house of horrors very quickly if we don't hold up human rights and self-ownership as the highest, you know, the basic rights. I mean, a psychiatrist, Dr. drawing a blank on her name, but she basically says all human rights start with health rights. You know, the right to our bodies and the right to health.
Good point.
I agree with what you're saying, Scott, 100%. And I really think that psychosis in particular is misunderstood and mistreated, and that there's a common assumption that when someone experiences psychosis, that it's like a permanent condition, or that they are, you know, need to be on medication for life. And I have seen unequivocally that's not true. And it's in fact can just lead to further and further clouding of the human mind and really stealing the life possibilities from people. And I have a friend, and I'm going to do an interview with him one of these days because his story is amazing. And he worked as a staff in a correctional group home, basically for adolescent males who had committed crimes. But what was so unique about this place is that it had no locks. It had no locked doors. It had no, you know, 20-foot tall fences. It was basically built on honor, building a sense of honor and accountability and responsibility and self-ownership among all of the kids that were there, as well as the staff. And he has these amazing stories of how he really created this environment, this milieu of honor that these kids stepped up and into, and where I think got true healing. Unfortunately, now that program has been closed. And so many good programs have been not supported through, you know, the funding system. I worked in a program once that was called the Challenge Program, and it was a psychiatrist who had a very unconventional approach. He was a runner, and he was in New Mexico, and he loved to run up the mountain. And he found that this experience of physical challenge really helped with one's mental clarity. And so his treatment in this inpatient, again, for adolescents, was to create, they gave them martial arts classes, had a running coach, had yoga, had, you know, cooperative kind of games and interactions. And they would work up to running up the mountain as their graduation. And they would leave and graduate this program with this sense of accomplishment. And it was a beautiful thing. He did psychodrama, you know, and it was beautiful. And I worked in a residential treatment program there, and we did wilderness activities. So we were taking the kids out and hiking and climbing. And it was, you know, it was a beautiful thing. And yet the payment system for Medicare or Medi-Cal, wouldn't support it. So they had to like eventually like all of the creative activities were ended,
And it's so basic too. It's that's profound. Yeah, that's incredibly shared the story. It also reminds me of Finland, and there's some videos online about the prison systems in Finland. Apparently, they're all like open, and it's totally different the way it's done there, as opposed to other places. So it just shows the possibility in how we go about treating anything. So as you can tell, there's been a great importance on trauma and getting more understanding as to what this is and how it affects the mass population of the world. And here you have a quote from Irene Lyon. A massive percentage of our population is struggling with a different kind of infection. What I'm talking about is early adversity, childhood trauma, and its strong connection with chronic illnesses. Of course, this parallels Gabor Mate and what he was mentioning to us of the physical and mental variety. For example, here's a partial list of the diseases researchers at the Center for Disease Control suspect originate from the barrage of fear and threat dosed out to young children and infants via abuse, early trauma, and adversity. And there's many people, talking about trauma now and shadow work because they're just experiencing so many issues that they find out may have stemmed from their childhood or their past, or realizing, wow, there's these deeper problems they never saw before. So you can see, I mean, these are some of the most prevalent symptoms and diseases in our world. So this can be pretty dramatic. Metaphorically speaking, the early adverse traumatic experiences are the infection. Chronic toxic stress to a child's survival and safety is the root cause, and the chronic illnesses listed above, plus many more not listed, are the byproduct, the symptoms. So we're trying to get closer as to what is, the root cause to some of these problems. It may not be, introducing another pill or another drug and trying to look at the physical aspect of things, but really this mental, emotional side of things, right? Not even mental, but emotional, like deep into someone's childhood.
Yeah, I'd like to add that as every carpenter or builder knows, the foundation is of utmost importance. And this is true for the foundation of our childhood, and the nervous system of children is of key importance to their whole future and how they unfold as an adult in their health and their nervous system resilience and capacity to handle stress.
Yeah.
Based off of my personal experience with years of chronic illness and now doing mentoring with other patients, I can tell you firsthand that it always comes up naturally in conversation that there's some sort of stress or environmental component, usually stemming back to childhood or a particular figure in their life that has stuck with them for a very, very long time. I don't know that patients are cognizant to this actually being a potential root cause of dysregulation for their physical health. But in the counseling that I do with people, it inevitably always arises, especially with people who are dealing with chronic conditions, that there's some sort of environmental trigger, usually a human being, whether it be stem back to, mother or father, or somebody in their life that's reflecting the absence of those primary core relationships, that tends to cause an overwhelming amount of stress on the individual's psyche, which then can cascade down into the nervous system and all the other systems of the body. And in particular, one thing that I've done a little bit of research around myself, because I myself was diagnosed with an autoimmune disease in my late teens. I work with a lot of other people, women in particular, who do have autoimmune disease. And there are some correlations, doesn't mean that it's, necessarily causation, but there are some really uncanny correlations between women that have autoimmune disease and chronic illnesses and childhood trauma that then usually starts to replay itself through the dynamics of interpersonal relationships throughout their life and into their adulthood. And what's happening is because, most of our family members have not had the tools either to deal with their trauma, this is something that's uncomfortable to deal with. If all of a sudden we're talking about the revelation of trauma in our health, to have one particular generation turn around and point the finger on every baby boomer or every person that in our generation that has parented them, because their trauma is also coming from their parents, and it's epigenetic and it goes back. So it appears to be delicate, but the reality is, if we don't open this can of worms and start to understand how we can take responsibility for what we haven't known and how we've projected dysfunctional behaviors or stress or fear onto others, we can never really turn the story fully around if we don't delayer this and open the uncomfortable areas of things like parental abuse, generational abuse, behavioral abuse from people who didn't have the proper tools and they were unaware of how these projections are actually affecting our physical body and health.
Yeah, Stephanie, and I'd like to add something. So in addition to the adverse childhood experiences, which we've touched upon earlier in our seminar, Irene Lyon really makes the point of saying that there are very common practices amongst parents and the medical system that add to this problem of dysregulating a child or an infant's nervous system. That practices in our everyday life that we've come to see as normal are actually destabilizing from the natural needs of humans. You know, it's destabilizing us without us recognizing it because we've taken it on as normal. So things like parents having very short leaves, like a mother having a very short maternity leave and then taking her child to a stranger for childcare, or you know, any kind of separation from mother and baby at birth, which happens often in the hospital setting, or types of like, let your baby cry it out, things that have been taught to parents to do have been discovered to really be problematic and set this stage for this weak foundation.
You know, to be frank too, and I'm not afraid to say this because I have a lived experience and have worked with a lot of others with this, is that it's uncomfortable and there's a bit of a conundrum because not only do most parents not have the proper tools to understand how they're projecting onto their kids, but then the medical system is typically set up in a way that could potentially re-traumatize or at least regress the psychology of the individual or reduce it to well, here's a surgery and now you're fixed, and no real upstream awareness if that person is going to re-enter that same psychology or behavioral pattern that destabilized them and created this discoherence within the body in the first place. So it's either like a regression can happen in the psychology of a patient, or one feels like they have to play the role of the victim and the patient the entire time within the system. So there's a suppression of their full potential or a reduction. And, you know, for some people, if, you know, you have a physical wound and you have a surgery, maybe that does wrap things up and you don't really need anything beyond that. But what we're talking about is this proclivity and propensity towards immense chronic illness within our society, and things that are not just going away with surgery. And in that case, in my opinion, you just cannot decouple the psychology and what the person had experienced within their environment and how they may be unconsciously replaying these dynamics, contributing to this destabilization of the body. And then the other conundrum there is that we still are very underpopulated with psychologists or trauma therapists who can handle that if this can of worms opens up. Mm-hmm. So, you know, people like Irene, she's wonderful, Gabor Mate, amazing. But what's going to happen is if we feel confident enough and courageous enough to address this as a root cause, we need to change the way the system is functioning and add in a whole bunch of other trained trauma specialists who understand complex PTSD and the correlation between that and physical well-being.
Yeah, I'm sure if you were to ask an individual like Gabor Mate, you know, would he want to be the authority on trauma in this topic? He doesn't want to be the person that everybody goes to necessarily for help with their trauma. There should be plenty more people. Mark Passios says the same thing about his work when it comes to sharing his material. He's like, there should be plenty more people than me. I should be able to walk off the stage and have somebody take my place, you know. And he's saddened by the fact there may not be enough people like him sharing the knowledge. And so there's a lot of people, I believe, who can rise up in their authority for themselves and their self-ownership, their responsibility, and see that they can address their trauma. They don't have to be dependent on these even celebrity-like figures that are helping them with their health, because that can happen too.
I think one of the greatest resources we have under our belt and armed and prepared are what we call like the subjective experiencer, or a person who has a lived experience, who has the ability to have integrated their experience to the degree that they also have started to help others, but then they can also start to see the flaws and where people are really getting caught up and trapped. So it's not a doctor, but it's a form of a mentorship, or somebody who says, hey, look, I've been through cancer. I know some of the ins and outs. Let me inform you. Let me be there for you emotionally, at least as an adjunct to the system. And then maybe they can eventually get filtered off to professionals if they discover, oh my gosh, yes, I have an immense amount of childhood trauma and I need to meet with a professional. So this person there's many of us out there who have a profound lived experience with some sort of a health issue. So if that's you and you don't feel re-traumatized every time you talk about it, these people should stand up more and say, hey, I see where you can get caught in the system. Let me share with you some of the things that I did to help overcome in a more healthy way. So there are people that it has to be like a chain of events. It has to be, the healing process has to look a little bit different. And we have to find where the individual's at and what kind of support that they best need. Do they need compassionate, healing sorts of support from a feminine type of an energy, or do they just want information and knowledge about what they missed out on? So just really kind of gauging where the person is at and then linking them up with the proper support as time proceeds would be really helpful.
Yes. And then creating those systems and those solutions we definitely want to delve into here. I think you're absolutely hitting on exactly what we're going to be talking about. And so let's talk more then about the nervous system and how trauma first, kind of takes place in the body in a physical level, not just on the psychological level. And we have here the polyvagal theory, Stefan Porges and Deb Dana. Through these interactions, I became informed about the profound disruptive impact of trauma on a significant portion of the population. I became aware that survivors of trauma often go through life without an opportunity to understand their bodily reaction to the trauma or to recover the ability to regulate and to co-regulate their physiological and behavioral state. Many of these individuals are re-victimized when discussing their experiences and are often reprimanded for not fighting or fleeing. So that is quite a shocker. And of course, Stephanie, you just mentioned that too, that some of these things can resurface if people are unaware. And we also gave an example before of a very touching story where we see that taking place as well.
It's important to be mindful of resurfacing of trauma, but it's also equally as critical to not bypass it either and somehow reduce it to, oh, well, that doesn't really help, or that won't really help you with your illness if we talk about your family trauma. So it's this spectrum of, for some people, it's incredibly important and that should be valued. And for the people who it's not important to, then that's okay too.
Yeah, so here we see it again, though. Different researchers saying, hey, trauma is, significantly affecting a great large part of the population. And so it's something that we should look at.
Yeah,
And
I'll
here,
just add,
go
I'll
ahead.
just add something that I think that the behaviors that providers might see in their patient that seems adversarial, like a fight response or a freeze, a shutdown, may be sometimes misconstrued as not cooperating with their care. And I think that this can open your eyes to kind of ask the question, maybe there's something more going on than just a resistant patient, but maybe someone who is being triggered in a trauma response and in a fight, flight, or flee state.
The beautiful and tricky part of what you just said, Leslie, is that patients and providers are all at different degrees of conscious awareness. It doesn't always mean that a patient is less intelligent in certain areas than a provider, and vice versa. So maybe you have a provider who's very intelligent, but maybe they're not as emotionally intelligent. And maybe the patient embodies more emotional intelligence than the provider, because the provider may be used to checking out and focusing on academia and differently. So it gets tricky because it's not just that a provider can address a patient differently. Sometimes the patient actually is outgrown from the provider in different areas of conscious development as well. So sometimes the patient might be able to have to say, like, I know you care about me, but I'm really feeling infantilized. I can see that you're projecting your fear onto me. And now I have to have a mechanism to protect myself from your projection too. So it's definitely tricky. And that's why at some point, I know I had made a video several years back with some providers about resonance, about actually taking the time to find a provider that you trust and that you feel safe with, and that you can actually create some sort of a bond with. Because the way the system operates is that there's a wall around a particular type of bond between a provider and a patient. There's a degree of bondage, and then, oh, we don't cross this line. But in order for somebody to really tap into their potential and their healing ability, there needs to be a resonance in the relationship. And very often, I think that's lacking from the start. I know for many patients that are friends of mine, they're just assigned a provider. They don't necessarily get a choice. And I always say, look, if you're not resonating, you don't feel comfortable, go interview, find someone else who you can work with. So I think that relationship is really key. Can you really be honest and open to your provider? And can the provider be open and honest with you? Because if it's one-sided, we get stuck in the role and the hierarchy of patient and provider, and the patient's always stuck in the victim mentality, usually in that role.
Yes. The experience of feeling safe is really important in a relationship between a provider and a patient. And that resonance you're talking about is an expression of feeling safe. And if you don't feel safe with your provider, then listen to your body's responses. Your body's responses, as Stephen Borges is referring to, is communication within your own system telling you something, and that you're not feeling safe or resonant for some reason. So this is something to be discussing with your provider or with a therapist or a friend, in order to establish whether or not it's the right match, or whether this is something that is internal to deal with, et cetera.
Yeah, I just want to say one last thing, guys, is that because I've seen a lot of providers over the country for many years for my condition, I learned very quickly that there was a doctor mask that was coming in to see me that did care and did feel a calling towards healthcare and medicine. I understood that, but the degree of personalization for me always felt very limited. So I learned very early on as a patient to feel as though my needs were getting met, and simultaneously, so that I could really listen and be the best patient and try to recover from my illness as best as I could, I developed a strategy. And that strategy was, when I would meet a new provider, they would ask me questions, and I would say, well, what about you? Do you have kids? How long have you been doing this? Have you always been at this hospital? I paused their mentality to try to get some information and create some sort of an opening or a channel for a friendly, honest type of relationship. And I made it very clear at some point, like, if you're going to come in with this one persona, we're not going to be a good fit. Because I can only express myself to a certain degree in that sort of a container, where I don't feel that, we're actually developing a relationship.
Wow. Very good points. Yes. Can we have that, right? Again, we asked that question before. Is it safe to be honest, to create that environment where we can be honest? if we're being pressured from many different angles, there's stress on part of the provider or the patient, and it's playing into this theory here, which you can see charted on the screen. You can see it might be quite difficult. So there's different points here in which we have freeze, fight, flight, and then there's social engagement, right? So you can look at the different things that increase and decrease on each part of this chart, right? Certain parts of the nervous system here. We have the parasympathetic nervous system, the sympathetic nervous system, and the parasympathetic nervous system. And it's worth mentioning that we shared before like movement and exercise, and this can also have an effect on the nervous system, right? So we talked about how that can be potentially helpful when it comes to the psychological health. Well, I actually know that there's certain moves in Taoist yoga, right? I think they call it yin or yang yoga, where they actually can activate the parasympathetic nervous system. And meditation, of course, involves slowing your breath so you can get into the parasympathetic nervous system. So this type of system might be quite important to understand in our world where we might be surrounded by different distractions, a lot of pressures, and we feel like, as it says on the screen, we can be trapped or we feel shamed or there's numbness and there's this level of which we feel like we can't escape. We want to be in a position where we are flexible, where we are open and curious. And it also means that we're able to discern in our life. And so when things come our way, we're able to handle it properly, perhaps.
In a well-functioning nervous system, when we feel stress or threat, we may go into this fight or flight or freeze space, but there's a quick and an expedient downward return back into the social engagement state, which is what we would call rest and digest, and it's connected with our vagal nerve, and that being toned and activated, then we are feeling safe. And in this space, we can be curious and open and calm and grounded. That is a natural state to be in. If you're finding yourself stuck or frequently in a fight or flight state of irritation, frustration, anxiety, rage, then your nervous system is not relaxing back. You're in a stress state and at risk of these sympathetic nervous system issues of raising your blood pressure, becoming adrenalized, and over time that takes a toll on the body. And if that threat, even if it's not a recurrent or continual external threat, but if your physiology is feeling threatened and that is ongoing, then eventually that can lead to a freeze response. The system gets tired, basically, and shuts down. And sometimes people can end up in a bit of a ping pong game going between fight and flight or hyperarousal and then exhaustion, hypoarousal, without fully having a sense of safety and a nervous system that is in that rest or digest social engagement place. So a lot of diseases are a result of staying in the upper two layers of this chart.
Sure, yeah.
There's an exorbitant amount of research done on the impacts of, like you said, Corey, yin yoga or a slow-paced yoga that is intended to activate the parasympathetic nervous system. There's Harvard studies, research studies all over the place. This is the lowest hanging fruit for the medical system. If you want to help your patients, just start to teach them how to breathe and do some meditation and some very, very basic stretching to get them to understand how to activate the parasympathetic nervous system. Should be so ridiculously easy. It's embarrassing that we're not offering patients this to help them de-stress. It's radically embarrassing. And, we understand that some of the material we're talking about is very heavy. It's very dense. It's very complex. It's like, oh, how are we going to get Sally over here, who's on chemotherapy for her cancer, to talk about the evil in the government and how, our psychology is making me sick. It seems like a long way away. But the reality is that when somebody is sick, there's a physical issue that needs to be addressed often, but then there's an opportunity in a long-term healing process that can start the moment that they get a diagnosis. And depending on, whether the person has a full recovery or not, doing this inner work is always going to be valuable no matter what. Because when you realize some things about your life or your health or what contributed to what, or some of your downfalls or some of your shortcomings, when you realize this and it brings meaning to your life and to your story, which creates a process of inner healing. So for me, maybe we start with, maybe we just start with breathing or some very basic, yoga to help patients with stress, just with stress, besides all the drugs right away, or at least in conjunction with. And then as the person evolves and develops and has more strength along their journey, then we start introducing some of the more complex subjects, like, okay, we're going to do some trauma healing around your childhood development. And when the person has a little more strength, but at least from the get-go, if somebody walks into your office with a physical illness or any kind of stress, why aren't we talking about meditation or breathing and teaching them that from the jump? I mean, that's embarrassing to me that we're not doing that, at least as a conjunction to the other therapies.
Mhm. And then tying this back into childhood, right? We might say children go through a lot of these emotions as well. They go through a lot of fear, a lot of worry, concern, rage, anger. I mean, I believe I see this in a lot of kids, and there's a lot of hyperactivity, they say, right? This is an actual term that is used, usually even coming from things like artificial flavoring and coloring in our food, causing these types of reactions. So being able to not just recognize that the food may cause those types of reactions, but being able to have an avenue that can help release that and knowing how to would be important. So I would assume that maybe it would be important to teach children some of those methods as well, Stephanie. What would you say about that?
I mean, I would say, it's a sensitive subject because obviously the parents have the rights to their children. We shouldn't have the government or the school system
Of
telling
course.
people what we should do with our kids. But I think if we can keep maybe some more of the esoteric spiritual stuff out of the yoga and meditation and just teach them the basic physiological effects of yoga and meditation for the body to help them stay calm and as a grounding mechanism for their life, I'm all open to do it as soon as they can. And in fact, you see that with some schools. Some schools have introduced meditation. They're teaching kids from a younger age how to regulate and at least communicate their emotions. There's room for that. So I'm all for it. I think when we start to introduce spirituality or some sort of esoteric concepts, then religion comes into play and things get all
Sure.
confused and messed up. But there's enough physiological proof and studies out there of this helping people with stress. And I don't know anybody in my life right now who doesn't have stress.
Corey, I'm glad you brought up children because this is very important and at an even more basic level than exposing children to breathing techniques and yoga, but it really comes down to the parent's nervous system. And if a parent is soothing themselves and keeping their nervous system in regulation, then that in itself will help soothe the child. And parents are the original teachers of children and how children will build and develop a healthy nervous system. And it's done through very simple attachment behaviors of things like presence, listening, or not self-soothing, but soothing a child through holding, through a kind voice, through letting them sit in your lap, because children are not born with the knowledge of self-soothing. It is developed through being soothed by their parents, by their caregivers. It is through the experience over and over of a responsive parent to a child in distress or under stress or duress that the child learns that there's the potential of safety, that they actually experience their nervous system calming down into the social engagement state. If a parent is unregulated themselves, if there's yelling and fighting, if there's neglect, if there's depression, if there's absence, and a child is left on their own, they are in a hyper-aroused state of unsafety.
Wow.
So this relationship between early ages, 0 to 3, especially 0 to 5, crucial that the adults in children's lives have emotional intelligence and that they have an actively regulated nervous system and are present and observant of the child's emotional needs and responsive in appropriate, caring, and compassionate, calm ways. This is huge in our society.
Wow.
And you cannot decouple what Leslie just said with the effects of our government and state on our environment. So, most parents, this is like listening to Leslie's words are very powerful, because for most parents, they're falling short of that. And there's many reasons as to why they're falling short. Maybe it's, well, I'm already a single mother and stressed, and I have this and I have that. And so now, like, getting back into that place of being emotionally stable is going to require the parent themselves to undergo an incredible awakening process. So we're already in deep shit, if I can say that. So, we have to hear the words Leslie's saying as a true North Star for us. But then in the meantime, there's a lot of cleanup and meeting people where they're at, which is very messy, and helping them get the tools that they need to at least try to do better.
Yes. Thank you. In fact, I just saw recently Gabor Mate was asked, like, where's the source of ADHD or anxiety coming from? And he's like, well, it's that a child is left in a room by themselves crying and there's nobody really giving them any attention. And I thought, I was like, whoa, that kind of came to mind when Leslie was talking, because they're noticing some of those patterns as well.
One last thing, Corey, too, is that there are natural things that happen in childhood and through development with parents that obviously we don't have it all figured out. And there's a learning process that needs to occur. Yes, we need more information. We need to do better. But there's also a lot of parents who aren't just undereducated or under-resourced, but they've acclimated to their own trauma by becoming a very unhealthy parent, or even emotionally abusive or mentally abusive to their child. So there are children growing up with parents who are truly narcissistic, psychopathic, and it's not just they're not getting held enough. It's that actually the parent is emotionally and psychologically torturing them, which is awful too. But that's their parents' coping mechanism, and the unconscious behavior just projecting back out. So that's really messed up.
Well, you mentioned a good point, Stephanie. I mean, let's say a parent is trying to outweigh maybe the risks. Maybe they say, oh, well, I got to work. I got to provide for the family. Like, if I don't make enough money, I'm going to cause stress in other places. So isn't it better maybe I don't hang out with my child as much and work a job so I can provide for the child instead? I mean, do you think there's some of these trade-offs that can also cause issues, or how do people navigate that? What would you guys say?
This is the dilemma of the modern family. Two working parents, motivation by money. It is a major problem at a large scale that needs to be talked about.
Well, then I think also too, Leslie, is that, okay, we need something different. We're in a time and a space where something needs to evolve or come into fruition that's different. What about having people step in as healthy proxy caregiver roles for kids who had two working parents, or unavailability, or they need some sort of, emotional development. The healthcare system as we know it today is taught this dynamic between the proxy parent and the patient, but it's all covert. It's all covert. It's all like behind the scenes. The providers don't tell the patients, well, I'm going to act as your proxy father right now. Why can't we just open this conversation and say, if you're struggling and this is the type of environment you grew up in, like we understand why you might be struggling. It's normal. And we have this sort of environment where we can provide you with some of the care that was lacking in your childhood. And what that looks like is us being a proxy caregiver mirror for you to try to fulfill some of these needs that you didn't have. I think the problem I have with it is we're going about it through academia and education covertly and not just being open and honest with the patient if they can capably handle that, and just say, look, this is the role I'm going to play. And by doing this, like it's going to help you to fill that hole that you didn't get from your particular childhood situation. The covert attitude of healthcare providers, knowing that they're can play a parent. And then what I've discovered is that often that relationship is the dysfunctional parental. It doesn't necessarily provide the healing that maybe they had hoped by being that proxy role, often because the provider maybe hasn't even done the degree of work on themselves around that sort of trauma. So maybe the education is there, but have they really integrated their own trauma to be having conscious conversations with their patients about this is another story.
Mm. Yeah. And would you say that, I mean, maybe practitioners think that they don't need a practitioner for themselves, but you have been, Stephanie, you said many times I've talked to you that you have been, in a way, a practitioner for practitioners. Do you think practitioners should reach out to somebody that, has expertise in some of this?
I think that we all should be a little bit more open-minded when it comes to healthcare and healing at this point. It's very evident we're not doing that great of a job. And maybe technology and AI is taking a particular role that's advancing certain aspects of medicine.
Sure.
But when it comes to the human being and the health and psychology of the human being, we're regressing. And yes, I do think that if providers were more open-minded to learn from their patients, to reach outside of their own box and get more education by people who seem like they're outliers to the community, but do have a good source of education or wisdom or knowledge around a particular aspect of the field. Yeah, I think we all need to learn and go outside of the box. Otherwise, you're resisting the truth, staying stuck in your own echo chamber, thinking that everybody else is crazy. And really, maybe it's just that you haven't dealt with your own childhood trauma.
We've referred to the prevalence of burnout in the field, and it
Yes.
exists, and the tendency of helpers to go into helping professions, and often that results in an imbalance in their own lives. And this system promotes that. It promotes overwork. It promotes overstimulation, really high caseloads, et cetera. And so there is a need for the providers to get support and to recognize their own, the signs of their own imbalance before it gets too extreme. So I think that really every person who's a helper, healer, doctor, therapist, who's really giving a lot of their own energy, be very mindful of how that is affecting their own emotional resilience. And for many years, I worked as a therapist, and I realized in hindsight that my work took so much of my emotional energy that it did affect the quality of my emotional presence with my children. And I didn't see it quite at the time, but in hindsight, it's really clear to me that I was tapped out. And it was like when my children had a problem, I just didn't have the capacity to take on another problem. And so there was a cost to the amount of energy that I was expending in the work. So yes, I think that people who are working need the education, but also the support system and the the benefits that often some people have better like vacation benefits and paid time off benefits. That's one of the
Sure.
things I've missed the most from not working in an agency. So when people are working on their own in independent private practices, for example, it's really easy to get very much in a work all the time mode. etc. But I think that we're really missing the day-to-day types of self-care and balance that people need to be optimally functioning at work and at home.
Mm.
There
Yes.
are different people who need different types of care, provider and patient, and there are different providers and patients who are more sensitive or less sensitive. And to expect a healthcare system to run without that empathy or recharge or emotionality of the experience dealing with life and death is asking for a psychopathic healthcare system. And some people can do that. Some people can decouple from the spiritual aspect of life and death and the emotions and just get the job done and be very practical and left brain. But that doesn't promote healing. You may fix a problem that way, and that's great. But is our healthcare system model going to be a fix-it model or a model where we fix and have an open invitation to heal? That's the question.
Right.
And if it doesn't want to work on healing, then we need a parallel system. That's it. For the people who want it, because they exist and they're crying for help.
Yes. Yes, good point, Stephanie. Here's another chart for those of you out there talking about undischarged traumatic stress. All right, and there's many different charts you can find on stress, of course, considering it's a very important, very highly affecting thing, affecting so many different diseases and ailments. See, it says anxiety, exaggerated startle response, hypervigilance, inability to relax. There's many different ways to also detail, what is stress and the different reactions that go on.
So, Corey, what this chart is indicating is a nervous system that is in a actively dysregulated state from likelihood of chronic types of traumas that are stressing out a person's system to the point where they're not able to stay within that middle line, that middle area where they're calling the optimal arousal, which is where we are basically able to, maybe we get stressed out, but we're kind of going down. We're in a window of tolerance where we're fluid. And when people have experienced chronic unresolved stresses and trauma, they can end up being more like a very choppy kind of lightning bolt where you're getting stuck on, where your anxiety is heightened and staying high for long periods of time, which then leads to exhaustion or a shutdown and a disconnect or depression. So if you are on this roller coaster ride, that is a clear signal that your nervous system is not in good shape and that you need some help.
Yes, stability, grounding, presence, right? I don't think it's a coincidence that the word presence in this case also can kind of represent this idea of a stability.
And I'll just add, some people might need some additional trauma treatment, whether it's through internal family systems or EMDR or a combination of both. They both work well together, or other types of trauma treatments, such as what Scott provides. But there definitely are indicators that our body and our nervous system, our emotions give us that let us know that we need to do something different and we need support.
I get curious around this topic in regards to the younger generations, if they're actually even aware that they can work on healing their nervous system, if they understand that if doing this sort of work, that they can feel better potentially. There's so many young kids and the younger generations that I know of, they weren't really taught, or they've never even felt relaxed. So in my mind, I get very curious and I wonder, wow, do they even realize there's things they can do naturally that can actually really make them feel better? If they're just given meds or a different, a therapist and meds, and they just somehow think, oh, I'm always going to have this and I'll just identify with people like me with this condition. And are they even aware that very often they can do things to make them feel better and to shift that state of mind?
Mm. Yeah, Stephanie, that's a good point. And I would say, based on what I have seen, religion is the only thing outside of the medical system that seems to be somewhat mainstream for a lot of folks, at least that I'm surrounded by. So I don't know if it's necessarily healing this response, but it definitely is acting as something outside the medical system that people have if they don't have natural medicine or anything else that's alternative. Here's two more charts talking about the sympathetic and parasympathetic nervous system. So if you want to get more sciencey with this and look at different organs and how it affects each individual organ, you can look at this chart. Right, so this can be helpful for seeing signs, for saying, okay, I got to be more present. I got to pay attention to what's going on here. And it's also worth noting that in Eastern philosophy, there's this idea of like trying to be happy or trying to be relaxed. And in that effect, it may not be actually relaxing, right? Until you learn to kind of let go. So, just a perspective I wanted to share here because there can sometimes be too much fixation on like, am I doing everything correctly? Am I making sure that everything is perfect? And then in that process, uh, causing the very thing that you're trying to prevent.
It's interesting you say that. You know, some of Irene Lyon's work talks to this, this topic, especially around breath, where she will basically say, observe your breath, notice your breath, rather than try to change your breath or correct your breath, right? There's
Right.
something about that that just adds to the tension. And the more that we can be in that calm state of observance as the witness noticing, then that the body may naturally shift to some degree from that attention and the kindness that we're, giving ourselves. It's an interesting concept.
Yes, I believe sound and feeling can assist that process. Absolutely. Feel your feet on the ground, feel your head, your eyes. Is it relaxed? And just asking those questions, like you said, just saying those words has an effect because it directs your attention to something that you previously just kind of, you know, just live with until you start realizing, wait, I was tense all this time. My shoulders were up and I didn't even know.
Yes.
There's something in the yoga philosophy called drishti, which is single pointed focus. And it's a commitment, part of the commitment to ritualize your practice so that your body starts to understand every day or every other day at this time, I have this safe place I can go on my yoga mat. And the body starts to understand. It's like you're educating the body and implementing a tool within yourself to be able to decompress your mind, your body, to relax a little bit. And I understand that some of the concepts we're talking about aren't that accessible for maybe a young kid, like talking about, witnessing and witness consciousness, like this is more advanced stuff. But if you can at least create a health ritual, like every day, I'm going to do this for 10 minutes. Every day, I'm going to pray, meditate. It starts to condition the body. The body starts to wait and rely on that moment where it can just settle down.
Yes.
Right? So it's always better. When I was teaching yoga, I would say to people, if you're very busy and you only have, 1 hour to practice straight through every other week, don't do that. Just take 5 minutes a day and create a ritual, a sense of consistency for your psyche and yourself and your mind and body to help you to just detach from the busyness of the world, to get present with yourself and to just be aware, how am I feeling or what's coming up in my mind, a check-in, a little check-in. So, something like that is, again, that's pretty easy. Do you have 5 minutes a day to do some breath work and to sit still and quiet and ask yourself how you're doing? Like if you were just to give yourself that once a day, 5 minutes, that could start, again, one on a journey to start to become more self-aware and make better choices in their life.
Yes, I
So
know.
basic yogic principles.
Right. I know firsthand, my Qigong teacher says, "Hey, I have this one move that all these kids do, and it gets them to a relaxed state immediately." Like, they know these types of things. You start talking with them, it's like, wow, okay, very interesting.
I think it's becoming more and more clear that besides, you know, as a supplement to healthcare with the doctor, which is fixing the problem that seems to be in the body at the present moment, we know that it's a product of a lot of things, including stress. And we also know that the body is not healing or functioning optimally in a state of stress. More and more, it's becoming clear to me that we need, for a full-bodied, holistic healthcare, we need more than just the health practitioners. We need the teachers and we need the therapists. And the teachers could be anything from how to manage stress in present time to how to understand yourself and how you react to stress and things that you can do about it. And then you have the therapist that helps you get to the knowledge, the self-knowledge of what are the roots of it, help you to get to the roots of your trauma. So with all these three things, the doctors, the teachers, the therapists, we have a way that we can dramatically improve health. But I don't think any one function is going to do it alone, right? It's going to take it, although you can have one person, all of these embodied. There are some really good doctors that are also good counselors and teachers, and they know these things. But in general, as a people, as a human race, we have to cultivate a lot more of all three: the teachers, the therapists, the doctors, if we're going to enjoy optimum health.
Yeah, I've told you guys several times about when I went to work for Johns Hopkins as a patient experiencer and yoga teacher for a patient. And basically, it was a unique circumstance where the patient was allotted a nutritionalist, a therapist, her healthcare team, and then somebody who's been through the experience who also taught her meditation and yoga. She was getting very high-powered chemotherapy for her health situation. And the doctors were always so shocked how she was getting hit with this high doses of medications, but she was doing so well. And they would say, "What are you doing? Like, what's?" And she said, "I'm being cared for with all my needs are being cared for." It was just what you just said, Scott. It was an embodied experiment, and it worked really well. But it's very complicated to somehow organize that. So, but we do need to be more open-minded to people being a part of the team, however that looks. And what's most important, if I can just stress this, what's most important is don't do what happened to me when I was first diagnosed with my autoimmune disease in my early 20s. And one of my healthcare providers, one of my doctors, a physician, said to me, "Stephanie, put the yoga aside, put the meditation aside. Don't worry about what you eat. None of that is going to save you now. You just need to listen to what we're telling you to do." Somebody actually told me that. So basically they were saying, like, we want you to do what we're doing, and anything that you feel may be a part of your meaning making and healing process, it's not going to help you.
Yeah.
Shame on that person, because many people do need holistic care.
Here's a story I'll share. I haven't shared before. There is a family members that I have that have got breast implants, right? And they went in to their doctor. The doctor was like, "You got to take these antibiotics for the surgery." Well, I create a natural antibiotic, and the doctor found out about that. And it's a very strong natural antibiotic. It's got like all the top things that people like, garlic and whole lemon and olive oil and certain things, part of it, apple cider vinegar, so forth. And when the doctor found out about it, he like yelled at them. He's like, "No, what are you doing? Well, you didn't take my antibiotics." And like started like saying, "Whoa, if you didn't take it, like this could have happened to you, that could have happened to you." And I found that interesting because obviously, the family member was perfectly fine with it. and they wanted that for themselves. And, nothing happened to them. And the doctor's like, oh, well, you're lucky. But this is the type of thing that even a small little experience like that, I have observed in my family.
There's liability. It's liability. And, I will say that I'm open personally. I have a little bit of a unique situation because I went to school to be a natural health practitioner and provider, also yoga teacher, but I've had this very extensive experience within the system. And what I'll say is if I can take a natural antibiotic or a natural herb or a substance to help me, I'm always going to choose that first. But there's times where I've needed an antibiotic to survive. And again, why can't we just accept that? Again, it seems that we've gotten so black and white within the healthcare system that again, oh, no yoga, that's not going to help you. Natural medicine, not going to help you. No, nothing, just me. At least open your mind and give another option where maybe these can be integrated.
Yeah.
Otherwise, you just look like a control freak. It looks really insane,
I would like to know, yeah, like what is the reasoning behind it, right? Not just because I say so or because I'm a doctor, but I want to actually know, like, what is it behind it? Why do people go to things like garlic and apple cider vinegar? Why are there tons of articles? Is it just an internet trend? I don't think so.
The providers are trained that the pharmaceuticals are the way and that you can't trust the client to come up with any alternative, and there's a liability there and risk of lawsuit and all of that. And a big phrase that I've heard so much is your scope of practice. Don't go out of your scope of practice. Don't practice medicine without a license. These are phrases that you hear and that give you a certain anxiety around what you can or can't say to your own client, even though it may be based on really solid knowledge. If I were to say to my client if I gave them your recipe, I'm risking losing my license,
Yeah.
Right. And that you're right, Leslie. They don't have control over the patient's product, the dosage. There's a lot of things that they just don't trust the patient with. And when it has to do with surgery or Corey, like you were talking about with the breast implants, there is an incredible amount of fear that's embedded in the providers because of liability reasons. So of course they're gonna say, this is what you need to take, this is what works best according to us, and it's this dosage this many times a day. So at least they know they're covering their bases so they don't get sued. But again, it's one of those things where I can see them being used in certain situations, definitely. But then in other situations, we've gone so far and so extreme to just devalue anything alternative, natural, Eastern, holistic. And that's when it's gone too far.
Yes. Right. Well, you guys made a big point about the systems, and we're going full circle here. What is the mode of the state? We talked a lot about healthcare. We talked a lot about the government, how that affects our health. And now we're looking at trauma on a mass scale. Is politics and these mass events and these mass ideologies contributing to these different symptoms that we're noticing? Well, the state operates in such a manner that it keeps humans stuck in their sympathetic nervous system, which is a chronic state of fight or flight, which significantly contributes to all health issues. And this is us saying this on behalf of this slide based on what we've studied so far as well, among many different researchers. And being sympathetic doesn't help any problem at all. I would say it's very important to be present. And as we see a lot of the systems we have, a lot of them are built upon the past. A lot of them are built upon war and trauma. So when recognizing that, like Stephanie said, perhaps we can evolve and get beyond this mode of the state and that mode of the state that we've been in for thousands of years and start to actually become free and healthy as a civilization, which, as you've seen through many of our slides and what we've talked about, these two ideas go together hand in hand, freedom and health.
This is a call for a more unified way of doing healthcare. It's blatantly obvious. Society's traumatized. A lot of things promote fight or flight. We've got issues with caregivers, issues within our systems. People are burnout, on meds, sick. I just don't understand why we've complexified this to the degree that we have. It's just traditional healthcare needs to be expanded to offer holistic mechanisms to help society, period, end of story. That's it. Do you care or don't you care?
Yes. Well, we don't want to suppress our emotions, and the emotions we have are not something that we should fear within itself, right? They're there for a reason. It's just about understanding perhaps where they're coming from, how we deal with them. Here's a quote: "The heart of what I teach is effective emotional management." This is from Helene Day McCusick. Learning to dance with our emotions, she says. When we learn to accept our emotions as a healthy and natural part of life, we enter into a fluid relationship with them, whereby we simply allow whatever emotion is arising at the moment to arise and do its thing. And by the way, just want to mention before I go on, notice we're having a relationship with our emotions, we're having a relationship with the doctor, we're having a relationship with the state. It's like these are all relationships. We may not view them as relationships, but it might help to view them as relationships to kind of get more connection to it and to understand like we need to treat it more consciously. We let it out in some way and then we move on. Unexpressed emotions generate stress, and ultimately the state of our health comes down to how we manage stress. Even the Centers for Disease Control and Prevention says that 85% of chronic illness is stress related. So there you have it. Stress is emotion, plain and simple. Our emotional response to a situation rather than the situation itself is what causes most stress. The solution in our current healthcare model is to give people drugs, but what we really need is to identify what's going on below the level of our symptoms. What's going on with almost every single person I've worked with is that there are unexpressed and undigested emotions in their bodies that they don't know what to do with. And it's amazing to seeing this quote, reflect on this if you have to. But digestion too, when I think about nutrition, Hypocrisy says digestion is the root to all disease in regards to nutrition. I mean, this is it. Are we digesting our emotions? Are we digesting our food properly? Right? I mean, I see so much gold in this quote here, talking about emotion and the stress. And another thing that came to mind is this idea of the victim or the person who is responding to what is happening. Well, what we're talking about in the seminar is statism, a mindset that's in a lot of individuals. They're responding to, conditionings. They're responding to people who are in power. They're responding. The order follower is responding to the order, and it's their choice to take that order. It's their choice to comply. And so there's a lot of emphasis here in our seminar on empowering the patient or empowering the person who has to respond and choose. And they may feel like they can't choose, but I think what we're saying here is you absolutely can. And part of that is, not suppressing your emotions and burying it, but understanding it so you can really dive into it.
Yeah, Corey, you really picked up on this direct link between undigested emotions and gut issues. And it's very evident that chronic anxiety, which can be defined, and I've heard Irene Lyon define it as unresolved survival stress, is very linked to the body's digestive process. There's the digestion, the gut is very connected to our emotional responses and whether we've metabolized them or not.
Yeah, good point.
There's a, not to get too spiritual here, but I've mentioned this before, the old mapping of the chakra system, which is vortexes of energy that are mapped around the lymphatic system and different nerve points in the body through the spine. It's such a profound map of just kind of understanding how interconnected we are. So the root chakra would be our survival. People who have issues with their survival tend to have lots of chronic illnesses of all sorts, including financial issues with their weight, food, very things that are related around survival. The second chakra is around really the emotional body. And it's about how we go with the flow in our life, ironically connected or not ironically to all the fluid systems in the body, right? The third chakra is the gut. It's the ability for transformation and rebirth, getting out of ego identity. That's in your gut. That's the solar plexus. When you're stuck, you can't assimilate. You're not moving. You're not flowing. Then you have all sorts of digestive issues and things in around the gut and the belly, right? So we're stuck there. The more enlightened areas of the chakra system are, moving up through the heart, the throat, the third eye, and the crown, connecting to greater wisdom and, spiritual abilities and just all sorts of beautiful things and gifts that we have. But if we can't get out of this lower three nature, this lower three chakra system nature of fear, feeling stuck, not digesting our emotions, no room for emotional processing, I'm in fight or flight all the time, I'm in survival all the time, then we have a system that makes a ton of money off of us. Because we're stuck in fight or flight, we can't transform, and we're just recirculating around the same lower nature. And then we find other people and we think it's normal, we normalize it. There's no room for an enlightened, conscious mentality in this system. So what we're inviting is to break out of this trap of being stuck in the lower nature, which changes a lot.
Yeah.
Changes everything. But if people are ready, they should be offered the ability to go on that journey.
Here's Bessel van der Kolk talking about healing trauma. Fundamentally, three avenues. One is top down by talking, reconnecting with others, and allowing ourselves to know and understand what is going on with us while processing the memories of the trauma. Two, by taking medicines that shut down inappropriate alarm reactions or by utilizing other technologies that change the way the brain organizes information. And three, bottom up, by allowing the body to have experiences that deeply and viscerally can contradict the helplessness, rage, or collapse that result from the trauma. Which one of these is best for any particular survivor is an empirical question. Most people I have worked with require a combination. And this kind of, mentions the nuance that we've been detailing through the course of our seminar and saying like, hey, I've even made the disclaimer many times, like, don't take our word because there's always nuance to some of the things we're saying. And we see that, which is why, sometimes we bring it up and why I give those disclaimers. It's important to not only think for yourself, but to see that we're not discrediting conventional medicine. We're not discrediting the way things are. We're simply saying there can be a better way to do things. And if we don't have that goal, we don't have that utopia vision or that potential progress, that new island to go to, we're not going to see a whole bunch of different things that could be right in front of us, even, right? And we just gave the example of chattel slavery and just being present, how that goes overlooked. Right? So something very basic, we're just bringing awareness to it. We're observing it. We're making these observations, and you can really observe with us, honestly.
Corey, at some point we have to just ask, what are we afraid of? I mean, like, this is ridiculous now. What are we afraid of? We have to be willing to get honest about this stuff, So I'm hoping that, not just this presentation, but as time proceeds with all of these beautiful people coming out, is we keep speaking and we do what we have to do to serve the public in a way where we can start to become more aware and see our true full potential.
And it's important to also understand pain, right? So we talked about stress. Pain is related. And you can see here Dr. John Sarno, professor of rehabilitation medicine, he proposed that many chronic pain conditions such as back pain, fibromyalgia, and tension headaches were often not solely the result of structural abnormalities or tissue damage. Instead, he suggested that they could be attributed to a mind-body interaction influenced by repressed emotions and unresolved psychological issues. He believed that repressed anger, anxiety, and other negative emotions could manifest as physical symptoms, serving as a distraction from psychological distress. He argued that the brain created pain as a defense mechanism, redirecting attention away from uncomfortable emotions or deep-seated psychological conflicts. To address chronic pain, Sarno emphasized the importance of uncovering and addressing these root causes. By bringing repressed emotions to the surface and acknowledging their influence on physical symptoms, individuals can break the cycle of chronic pain and initiate the healing process. His strategies include specifically empowerment through knowledge, reducing dependency on medications, and enhancing emotional well-being. And again, through no repression, creating resilience, self-discovery. We talked a lot about creativity before as well. He also encourages empathy and compassion within relationships and communities. So another perspective to hear from, talking about pain, this also affects many individuals. Of course, we can go down the list and talk about every sort of disease, but this is one in particular that stress is related to.
I just wanted to bring up with John Sarno, he talks about something called TMS. And basically, that is a pain within the body coming from a repressed trauma, fear, something that's repressed within the body around the pain. But what our system has conditioned us to do is go to the doctor. You're in pain, go to the doctor. Take a Tylenol. You're in pain, just do something immediately. We've normalized this. I'm uncomfortable. What do I got to do to get out of it? And I don't know about you guys, but I've done this experiment with myself many times, and it doesn't work every single time, but many times for me, because I am a somatic person, if I have pain in an area, I witness it now. I can see, around my move, I started to have a little bit of discomfort. I'm like, oh, here comes some TMS. It's around my move. It's just going to show up. It's going to just be there. And then as soon as my move day was over, pain totally gone. So just creating a little more time and space around pain and understanding that if you just sit with it a little bit, maybe it's being triggered by the situation you're in, maybe just give it a couple of days. And I've learned a lot that very often it just subsides on its own. There's nothing that actually needs to be done if you just give it a little bit of time and space.
I notice like I will get, headaches if I'm on the computer too much or I don't sleep well, right? And it's like those are the things I'd say, okay, I got to pay attention to my health more. I never think like the
Right.
first thought that comes to my mind is, oh, I got to take a drug or I got to I always think first thing comes to my mind is what caused this? And, how can I prevent this? And, what is what could I do to solve it on like a natural way? I don't even
Right.
think that far. And I know that's what a lot of people think, but I've already conditioned myself to think otherwise.
Going back to the yogic philosophy and the emotions and Irene's work and Garamate's work and John Sarno's work is, again, you can condition yourself to notice the pain. Most people, again, they're on autopilot to the degree where they don't even notice the pain until it's too late, and they don't even question it. They don't, there's no conscious relationship with your pain. You can have a conscious relationship with your pain. And you can sit there and say, okay, why do I have a migraine? Well, I've been on the computer, I have been sleeping. Oh, okay, let me try to resolve it that way, right?
Mm.
Or it can be, oh my gosh, why did this pain come up? Okay, what is my pain? What do I feel? What's happening in my life right now? Just be self-inquiry a little bit. That can be very, very helpful in just allowing the pain to be seen, to be validated, and then to give it the space to move. I see you, it's going to be okay. You're worried about your move, whatever.
Right.
Like, let's just get through it. And you can, like Leslie said earlier, you can learn to have this relationship with your pain and self-soothe it and say, I see you. I understand why you're doing this. It's going to be okay. I'll go to the doctor in a week or so if it hasn't resolved,
Mhm.
But for me, just acknowledge your pain, be inquisitive about it. Hey, body, do you want to say something? Are you afraid of something? What's going on right now in my life? And very often you can put the pieces together on your own, and it makes total sense.
And you just touched on it again, right? With what I mentioned, relationship. We're not necessarily treating these things as relationships to
Yeah.
put emphasis on. And I shared the example before, I believe I have, but there's a video that's viral for headaches. And the guy is just like, sit down with yourself, close your eyes, and ask yourself, where is the headache? What color is it? And what shape is it? And so many people in the comments were like, this helped my pain so much. Incredible. And then he had a second video of like just literally taking a glass of water and playing with the water cup to cup because the water sound and then drinking that water because now it energizes the water. And people were skeptical, but these videos got a lot of views and many people in the
Mhm.
comments said it helped them. So, what's going on with that, right?
Yeah. And just to have somebody, like you said, we're talking about relationships here a lot, is you're right. Everything's relationship. Everything's a relationship. Yes, you have a relationship with your body. You have a relationship with your pain. You have a relationship with the checkout person at the grocery store. Like everything is a type of a relationship. And if you just give yourself the ability to communicate authentically in that relationship, even if it's with yourself, okay, body, what do you have to say? And you
Yes.
just give yourself that time and space to love what's going on in the relationship and to have friends who you can communicate with, right? And say, I'm afraid. That's the suppression of the feelings that's creating that concretized feeling or muscle pain. If you can just call up a friend and say, I'm really scared, I have this pain, but I'm also really scared about this, and can you just sit here and hold space with me and have like an honest dialogue? A lot of people don't even have that. We don't have people that we can call and say, I'm afraid, I'm
Yeah.
scared, you know.
Good point, Steph. Corey, can you repeat the name of the guy who did those videos about the color and shape of pain?
I actually don't know his name,
Oh,
but I could try to find the videos. They're
yeah,
like
I'm
some of
really
the top
curious
headache
about that.
videos, surprisingly. And he just sits there for like a minute, like, I'm gonna ask you these three questions over and over again, and you're just gonna think about it, and you're gonna focus your attention on that area. And it worked actually for me too. And then I would combine that too by laying on a certain side. If it was like a one side headache, I would combine that with like heat or compression or other things. Like there's so many things you can compound into it. If it gets really bad for me, I use peppermint oil or frankincense oil. I put it in the back of my neck. I put it on the temple areas. Like I start massaging, right? I do tapping, I do vibrations. Like there's so many things you can do.
Yeah.
Almost like a drug is like the last resort for me.
Yeah, that's great. And I think that that shows the spirit of internal locus of control. Like I have choices, I have actions that I can take that will impact myself and alleviate my pain.
Right.
Yeah.
You
And
don't feel like you're a victim to your pain. That's the
right.
most scary thing in that
Mm,
situation is, oh my gosh, I don't know what's wrong with me. Oh, help me.
mm.
You see?
Yes, I see. Right? I don't think people are given the tools to know how to do that, or they don't believe in themselves enough to find those tools since they do have the tools at their fingertips. Here's some helpful solutions from Dr. Carl Jung. So we shared a lot of research material from him before. Here are some of his main solutions or strategies he has to share with us. He says, be wary of miscommunication, the importance of understanding one's own unconscious biases, projections, and the shadow aspects of the self. By developing self-awareness, individuals can recognize their own emotional triggers, prejudices, and preconceptions that often lead to miscommunication. Self-awareness. Jungian psychology encourages individuals to embark on the journey of self-discovery and individuation. By exploring their dreams, fantasies, and symbols, individuals can gain insight into their unconscious motivations, desires, and fears. This process of self-exploration allows for greater self-awareness, leading to a more authentic and meaningful life. Jung's concept of the persona, representing the social mask or facade individuals present to the world, reminds us to examine our true selves beneath the surface. Healthy relationships, the importance of embracing and integrating both feminine and masculine qualities within oneself. By recognizing projections and unconscious patterns, individuals can avoid repeating unhealthy relationship dynamics and foster genuine connections based on mutual understanding and acceptance. I think this is a great summary of a lot of what we've talked about through a lot of the different researchers.
I love Carl Jung's invitation to self-knowledge. And I I want to contrast it with that, the last slide where we had this spiraling down into chronic pain, um, people escaping actually.
Mm,
They're reaching for the medicine cabinet to escape the signals that the body is sending through pain.
sure.
And you know, depending on how stressful or overwhelming life gets, we all go from one side to the other. But there's basically two paths, and that is if we stay in ignorance and we don't break into self-knowledge or seek to find the root causes of what we're in, we're going to be the effect of life and the effect of the authorities, and it's going to be a pill for everything, which is modern pharmaceutical medicine. Whereas if, when we're going for a balance, like I mentioned earlier, we need knowledge. We need to know about health and what makes us healthy and what doesn't. And we need self-knowledge, learn about our traumas and become self-aware and break out of the modes of fear and this downward spiral of chronic pain and chronic suffering, and to go above that. And that's helped by embracing these the fields of knowledge that are going to help take us out of that trap. So, like I said, none of us are perfect, and we all get faced with things that we can't, or feel like we can't overcome. But the more we set aside the time and the energy and discipline to get on the path of self-knowledge, the happier we're going to be, the more things we're going to discover that are solutions, rather than have to reach for the solutions that are being sold, at a price, or
Right.
or are being pushed because that's what the government wants. That's what authority wants.
Mm. Yes. And you can see here, right? Authentic. Is it authentic? A lot of these systems that we live in, and you can kind of go back to, what Scott just mentioned, the government systems we have in our life, mentioning statism. Do we have that system based on fear, based on desire? I want this public benefit. I want to be protected. I have this mother or father-like figure in my life. The masculine and feminine qualities. What does that mean? Are we saying that we need AI and control of the government and control of our health? Think about a lot of things that we've talked about so far. You can see it in this slide, right? If you could just break down one sentence at a time, you'd be like, wow, this is profound, right? The prejudices and preconceptions. We're born into this world. We have to do certain things. We're kind of just part of it. Everybody's just like, oh, well, I'm just doing it because everybody else is doing it. But it doesn't make it right. And if we really start to evaluate it, are we thinking about it for ourselves? Are we having the self-discovery process of creativity, or are we living on other people's, creativity? And like I said, the past 300 years ago, we're still living by documents that we uphold as some sort of holy document. Carl Jung talked about how we treat the state as God. Where is our source of higher authority? Is it a God beyond government, or is it science? Is it the experts? Is it the God of government? What is it? Right? What do we look to, and what do we use for our own life to truly heal us?
If we don't take responsibility to choose to grow up and to become self-aware and self-realize ourselves, we will always be at the behest of a system or the government to help fix us. So, transcending out of this lower nature, as we were talking about, and moving into more of a self-realized state where you're committed to doing your own inner work, and you're committed to honesty and vulnerability and communication and to proper relationships and to right your wrongs and to be radically responsible for yourself. It automatically changes, like Leslie said, the locus of control to one of where you're taking as much responsibility for yourself and your relationships as you possibly can, with using the systems as a last resort. And now they have us where they want us, because sick people who are unaware are very profitable. They make a lot of money. So we're in an inversion where we run to a system to get the answers. And then maybe if we're lucky, somehow we have an awakening or a near-death experience, which helps us to fully more heal and self-realize ourselves. But, we're always going to need healthcare. So none of us are saying here that we're going to abolish healthcare completely. Like, that's not what we're saying.
Right.
This is just an invitation to grow up and to let humans grow up psychologically and to cultivate a system for those patients and providers who do want to grow up.
Yes. Like you said, it's an evolution. You could say it's a collective evolution out of the collective unconscious here, because Dr. Carl Jung's emphasis on the collective unconscious and archetypes also has implications for societal relationships. It reminds us that we are all connected by shared symbols and universal themes. And by recognizing these commonalities, we can bridge cultural and social divides, wherever they may be, fostering empathy, understanding, and cooperation. I would assume most people listening to this would agree, like, yeah, we want empathy, understanding, cooperation. But do we recognize it's in getting beyond these divides and not necessarily falling into them, right? Because we say, oh, my way is the most compassionate, my way is the most empathetic. What's going on here? Notice the language, my way, right? How do we expect to be empathetic if we're going your way, right? So it's about being aware of perhaps the masks and the personalities and getting rid of them, not perhaps adding new ones. And that's something to be aware of here.
Most systems are house collectivists, right? And there has to be a relationship between individualizing ourselves and realizing ourselves, and the collective. But again, most of us are indoctrinated into a collective mentality before we've done any self-realization or individualism work upon ourselves. So the issue is that's where we lie. And then there's safety in a group, in the masses. We know that, right?
Yes.
So then the person who decides to add in and implement self-realization into their collectivist life can become a pariah or an outlier, or even get kicked out of the group, because now all of a sudden they're taking in more knowledge that maybe contradicts the primary collectivist mindset. So this is where we're at, is we have to understand the relationship between collectivism and individualism, and understand that they're both necessary, and we need to work on self-healing within both of those models.
Right. And what we're talking about does transcend culture and nationality. Everything we've talked about regarding the psychology. I mean, all human beings, at least, from my understanding, it applies this masculine and feminine quality. Talking about voluntary cooperation, talking about meditation or using certain exercises, right? They may vary the specific practices, maybe the names and the languages, but generally speaking, if you look across all these cultures, they share this commonality of trying to better the individual and maybe even free them from the systems, which is why you may have seen, many religious figures throughout history getting persecuted, but many people still attaching to those ideas, despite all the changes in the culture and in the government and the environment. Those spiritual ideas just keep to remain, right? And they keep resurfacing. So it's something to pay attention to. What is resurfacing and what are we suppressing?
Yeah. Corey, you're right, is that there's this universal theme of understanding, again, this dual relationship between the collectivist, individualist, masculine, feminine. It's in the very physics of our world. It's the anode, the cathode, these two things that appear to be opposite, but they both radically are complementary and inform one another. So that's exactly where we're stuck. We're in this gridlock between the collectivists not wanting to look at their shadow. And simultaneously, on the other side, we have a lot of people who do shadow work who haven't yet figured out how to go back out into the world to be a part of a group that functions in a healthy way. So it's both ends. But what we need to focus on is becoming aware of the knowledge of this relationship.
Thank you. And here's a little analysis that I put together based on a lot of different works, particularly Gaber, Sarno, and Jung. And I said, we have to be honest, and individuals are biased toward the state. I kind of highlight certain keywords basically in this summary of a slide based on a lot of what was shared, right? So we have the school indoctrination, and that creates preconceptions about a world without a state, or people start getting attached to these labels like anarchism, and we talked about that quite a bit. Any question as to the illegitimacy of the legitimate use of violence may be emotionally attacked. People say, you know, this is impossible. Like, how are we going to live without this system or that system? And division takes place among those who are biased and wanting their worldview imposed upon others, not aware of how that may affect those who disagree with them, such as, you know, how their worldview is going to be carried out through the use of law, through the use of medicine and AI, these types of things, right? Individuals are also less encouraged to be themselves as they are presumed to be merely an order follower if not given a position of statist authority, right? So it's all coming back down to honesty. Individuals are also in fear, less able to pursue a life of interest since they are limited by what the state permits in their life. The relationship created between those with the statist authority and those who permit such creates an involuntary and unhealthy relationship for those who do not consent, which leads to conflict. Furthermore, we should not suppress our conscience or our underlying feelings about an action, and we should have the awareness to act on what we know we should act on to prevent problems and build more self-discovery, right? So there's the word self-discovery there. The core to every statist system is the guaranteed use of violence or theft, as well as that false identity for every means of support or action, which we can say is counterintuitive to compassion and building all those systems that all those psychologists were saying that we need to build. A system that relies on violence for its continuance, but also existence, means that war is perpetuated, leading to further trauma through the generations. And a class system, which then gives more rights to an authority figure, also promotes inequality. Such a system may also encourage the lack of knowledge among the populace. So, and you see, there's just so many layers of disempowerment that is put upon the population, and the population becoming aware of that can then further empower themselves. And I also, again, make the comparison to chattel slavery because the main factor contributing to it was the lack of knowledge, the lack of awareness of saying, hey, I could be something more than this condition that I was kind of just born into. And this is, I believe, how we can evolve as a human species, coming from my point of view.
Yeah, I just want to add something in quick, Corey, is that we understand that some people are able to go on this process naturally and do a lot of self-discovery work along their journey. They somehow get hooked up with the right people or the right form of support, or they have their own experiences, and, you know, they can get through things, you know, understand this awakening process that can happen and kind of move through things. What we're really referring to here is the aggregate and the result and the research and results of where we're at now in America with our healthcare system and how providers feel on aggregate and patient health on aggregate. That's what we're really focusing on. So if anyone's watching this and like, well, I didn't have a problem, healthcare was great for me and I was able to heal my trauma, and that's great. That's great. But we're talking outside of just one person. We're talking about more of a collective you know, vision of how we can make things better and broaden our potential of what's possible by bringing in, you know, bringing this to light.
Yes. Yes. And so to speak more about the unconscious and the shadow, Stephanie, maybe you can break down this chart here from Colin Evans, talking about the shadow, and it's basically what we call this is like the 4 quadrants, right?
I think Scott, I'm going to hand it over to Scott. I'm
Sure.
going to nominate Scott to break it down. I think Scott will do it more justice.
Well, we've got 2 sides here, and we also have a top and a bottom that makes this a quadrant. The collective is on the bottom. We've talked about the contrast between the collective and the individual. The individual's on the top, and as well, what we have on the left is the shadow side, or our inner states, and then the manifestation of that, or what comes out, is on the right side. So we have that in the upper and lower, left and right. And so when we do work, the inner work on the personal shadow, we will see results on the right side, less disease, less illness, because those are the outer functions of an inner conflicts and inner trauma. And then again, if we go down, move down to the bottom of this quadrant, there's a lot here. You should read all the different things that he has listed. You're going to find that how this applies to the group, right? So on the left side, you have cultural evil, or the shadow of the collective unconscious. And when that's not addressed and processed, you have the manifestation in the world on the right side of the, he called it the collective deep state, which is the shadow governments, the gangs, the mafias, the criminal gangs that you're going to find manifesting what is in the inner collective on the left. So it's a very useful chart and very useful tool to understand how these interact. The individual interactions on the top feed, and by multiplying, feed into the collective, and the inner on the left is manifested in the outer. So, when you address, I think this is a good, probably a good summary. When you addressed what's on the left, the shadow, the inner work, you're going to get a better result on the right, which is the outer manifestation.
Great
Thank you.
description, Scott. It's interesting. I don't watch much TV, but just recently I got caught up on a series called Severance. And in Severance, interesting thought is that there's characters have an innie and an outie version of themselves. And very often the innie and the outie are at odds, and they're in different environments and expressed differently. So this is, when I look at that, it's kind of a creative way to introduce shadow projection, and how sometimes if there's things on the inside that archetypically want to be realized or come out, that sometimes we don't see it, but it will, Scott, like you said, it will show up somehow externally, either in your experiences, or maybe you're in difficult relationships, or you're blaming other people for what's going on, because actually the mirror is trying to help you to realize there's something on the internal state that's coming up that wants to be seen and heard. So just kind of interesting in how, media, it seems like some people are starting to become aware of this being a very real thing that's affecting our culture at this very moment.
Yeah, I would say this chart is definitely very deep into, if you understand a lot of what we've been talking about through the seminar. If you look at this, I mean, we even mentioned a lot of these researchers here, Jung and ponerology and mass formation, mass psychosis, and we just talked about pain. We mentioned Wetiko. We talked about the shadow, like all these different things we've talked about individually, and so you can go back if you want to learn more about them. But then, just the expression here, I mean, even showing like monopolies and globalization, like we shared historical examples of what can happen as a result of what Scott said, is on the left side of this chart, if that's not being worked on. So it's all there, and it could seem perhaps a little loud to somebody coming upon this for the first time. But if you go deep into it, you're like, wow, there is actually a lot behind this, and there's many researchers who have detailed this from various angles.
The beauty of working your way through a self-realization process is that you become aware and you take full responsibility for your inner psychic and emotional material, which means that there's less bullies out there, which means you don't have that many opportunities to be victims, like the culture wants to try to encourage us that, we can all be victims for whatever reason. So yes, victimization still does exist, but it diminishes when you all of a sudden become the sole proprietor for your psychic material, and you start to do that work. And it is deep and it is a little difficult, but you can do it very easily with simple tools. A very, very simple tool to start doing shadow work or mirror work would be, when something out there affects you, before you start pointing fingers and reacting and having, emotional behaviors about it, make sure you're also turning the finger back on yourself and reflecting, what was it about what that person did that really bothers me? oh, maybe this is something repressed within me and I'm projecting it, my anger out onto that person because this is something repressed in me. And they're just shining a light on something within me that needs to be addressed or something that's dysfunctional within me. So just becoming more self-reflective and have personal inquiry around what bothers you out there, that it's a high likelihood, even if you deny it, that somehow lives within you, either aggressively or suppressed. And it's like an opportunity for you to be aware of that and then see maybe how you can implement something to create more balance.
Yes, thank you for sharing. You can see how we get stuck on all the isms. You can see how there's all these different things happening. I mean, it's just, I believe this chart is very comprehensive. Again, something to reflect on as we are concluding this seminar. You see all these solutions and all these synapses. I find it quite profound. And going back to Eric Fromm, right? I mean, you'd look at authoritarianism, you look up totalitarianism, the psychology of it, you're going to be coming across his works plenty of times. So it's important to just realize, who is out there really talking about this. And what he has to say is always very good to look at. There can be no doubt that in this last quarter of the century, the reasons for man's fear of freedom, for his anxiety and willingness to become an automation have not only continued, but have greatly increased, right? So these are people warning us of what's happening. Man's brain lives in the 20th century. The heart of most men lives still in the Stone Age. The majority of men have not yet acquired the maturity to be independent, to be rational, to be objective. Stephanie just said, we're maturing. They need myths and idols to endure the fact that man is all by himself, that there is no authority which gives meaning to life except man himself. Right? So, again, can we find purpose? Can we find meaning in our life? Can we see there's a God or a truth or a nature or natural law or essentially something to follow outside of the government? And can we understand that in part that also means self-ownership, taking charge of our own life, seeing the authority in ourselves, but not getting stuck in it, right? So again, the nuance here. And so he shares with us, how can we perhaps make progress? He says, as far as I can see, there is only one answer: the increasing awareness of the most essential facts of our social existence, an awareness sufficient to prevent us from committing irreparable follies and to raise to some small extent our capacity for objectivity and reason. And he says progress in social psychology is necessary to counteract the dangers which arise from the progress in physics and medicine. Wow, right? What a quote that just says, man, we're looking at the medical system, we're looking at all these social systems, and we need progress in this social psychology. This is why we're doing this work, I would say. We've had this warning several times from researchers saying, hey, if there's going to be any revolution at all, if there's going to be any change, we need to look at the psychology, which is not something necessarily that is out there in the prevalent conversations. Here's a quote from Eric Fromm. The term normal or healthy can be defined in two ways. Firstly, from the standpoint of a functioning society, one can call a person normal or healthy if he is able to fulfill the social role he is to take in that given society. More concretely, this means that he is able to work in the fashion which is required in that particular society, and furthermore, that he is able to participate in the reproduction of society, that is, that he can raise a family. Secondly, from the standpoint of the individual, we look upon health or normalcy as the optimum of growth and happiness of the individual, right? And we talked before about this like normal abnormality, or this idea of like we're looking at something as normal when in reality, is it really normal at all? Huxley talked about this and George Orwell, and they were reflecting on the future society and how people would become conditioned to their servitude, conditioned to a type of slavery, even to machines if it's not people. Here's another quote. If we differentiate the two concepts of normal and neurotic, we can come to the following conclusion. The person who is normal in terms of being well adapted is often less healthy than the neurotic person in terms of human values. Often he is well adapted only at the expense of having given up his self in order to become more or less the person he believes he is expected to be, all genuine individuality and spontaneity may have been lost. On the other hand, the neurotic person can be characterized as somebody who was not ready to surrender completely in the battle for his self. Right? So this whole idea of like know thyself and becoming more honest with ourselves, like it's a battle, it seems, in our world because we're surrounded by so many different personas or personalities and different identities and ideologies. It's like, who am I supposed to become? And as you're born into some of that, and you're surrounded by it in your family and your friends, and they all expect you to follow the same norms, are you going to uphold yourself, in that environment? And how again, how simple is that? Like we're talking about presence, we're talking about honesty. It's so basic, it's within you, you have it. But upholding that in the world can seem like such a challenge. But here you see the emphasis on it again, not just from Carl Jung, but from Erich Fromm, who talks a lot about this issue. So as you can see, the battle is here with ourselves. Here's a quote from Erich Fromm, another quote. He says, "We also recognize that the crisis of democracy is not peculiarly Italian or a German problem, but one confronting every modern state, nor does it matter which symbols the enemies of human freedom choose. Freedom is not less endangered if attacked in the name of anti-fascism than in that of outright fascism. This truth has been so forcefully formulated by John Dewey that I expressed the thought in his words. The serious threat to our democracy, he says, is not the existence of foreign totalitarian states. It is the existence within our own personal attitudes, within our own institutions of conditions which have given a victory to external authority, discipline, uniformity, and dependence upon the leader in foreign countries." So another reminder to the internal authority or the internal locus of control, as we mentioned before, and seeing how the problem is perhaps more within ourselves or in our own nation than throughout the world. Especially since you can say we are ever connected by technology. We now have our country basically connected to other countries, and some people talk about this idea of like a world government. In a sense, things have become much more connected in the world. So the threat of something being more internal is something that we can question at any point in time, but especially now, being that we might be sharing a lot more problems than we think with the countries that we tend to attack and with the external identities that we tend to attack and put ourselves in the opposition to. And so he talks about the structure over individuals. He says, if the structure of a given society were such that it offered the optimum possibility for individual happiness, both viewpoints would coincide. However, this is not the case in most societies we know, including our own. He also says that most psychiatrists take the structure of their own society so much for granted that to them, the person who is not well adapted assumes the stigma of being less valuable. And what's interesting is we were actually just talking about before recording this idea of structures and how we might have a tendency to really want to structure everything and put things in neat little boxes or look at things in terms of the way I'm used to looking at, or maybe certain frameworks, because it makes it easier to understand, but at the cost of what, right? Maybe we have to connect with individuals beyond that and really sit and listen.
Yeah, for a long time, the only criteria for psychiatric care or commitment was that the person was so nonconformist, right? And it took a long time for society to sort of wake up to that, transform and reform to the extent where we're still doing that. We're still sending people into institutions because they're not conforming to what we think is normal, but we have a much wider tolerance for normal than we used to have because of the social transformation. So that's a good thing, but it's still a bad thing that we haven't woke up to widened our tolerance for normal so that we don't have to have so many people put away just because they're a little different or a lot different than what we're expecting.
Mm. And we saw quotes before about this idea of like the normal abnormal or the abnormal normal, and even, the father of psychiatry creating certain diagnoses for people who are considered, abnormal according to certain, metrics. But here's a quote from a philosopher, somebody who is respected in more of the realm of spirituality. He said, "It is no measure of health to be well adjusted to a profoundly sick society." And this is a pretty famous quote, but it lines up with what the previous quotes talked about, which is this idea of like, what if we actually are just in a sick society and the people who are outcasts, the people who may be attacked, or the people who have these alternatives are really they're just finding the natives. We call them alternatives. They're just finding the natives. They're finding what has always been here and just bringing it back to light. And it seems foreign due to some of the conditioning and some of the changes that we've gone through, not realizing what our roots are. And people are trying to find out, what are my roots? Who am I? And Judo has a great amount of talks talking about this idea, right? What is time? What is money? What are these concepts? The very basic things that we grew up around, and we're starting to question, what is this world that we live in?
Yeah, and one of the things I realized, because I kind of span a few different areas in my work, which is, individual therapy, and um, studying society, studying, mental therapies, things like that. But I guess the point I wanted to make is that there's, in order for a therapist or a worker to really recognize the value of this quote, I think they have to get into philosophy to some degree, because philosophy is the only area that we have of the studies that, I know of, other than religion, and religion is a close cousin of philosophy and contains philosophy. But is the idea that we can study something from an objective viewpoint and figure out and that's the role of a philosopher. A philosopher is actually a doctor of the society. What is reality? How do we measure reality? How do we arrive at truth? And when you have that as your philosophy and you use that as your study, then you can get a look into what is a sick society. And then you can help a lot of people to understand if they're just not conforming to a sick society, or if they're, maybe it's the reverse. Maybe the social norms do make sense. So that's the role of, I guess the point I wanted to make is that's the role of a philosopher, and it's a very important role and often a forgotten role when you get into subjects like therapy, psychology, medicine, things like that, is that you need that external viewpoint, the person who's studying multiple disciplines, to go back and say, hey, what are you guys doing? These guys are not crazy. We have a crazy element in our society, and I can demonstrate that with, get some perspective, maybe with other cultures. Anthropologists can help with this as well because they're multicultural. But philosophy is a forgotten subject that has an importance that we may not always realize.
Yeah.
I agree, Scott. I think it's going to be a big part of how we have to navigate the waters moving forward, especially with health and healthcare, primarily because we have to agree at some point as to what is a healthy culture actually look like. I think that's kind of where we are at this point, is that we still don't agree on actually what being adaptable in our modern culture should look like and what is actually unhealthy. So I think the only way we can parse through this is actually having a Socratic and philosophical debate where we're willing to start to agree, so we can actually then downstream meet the clients and the patients and have a better understanding of what we're agreeing upon is actually a maladaptation or an adaptation from the sick society that we're in. It's a bit complex.
Mm.
Yeah, I will add that this reminds me of one of my favorite philosophers, Mark Passio, and a particular presentation that he did for a Freedom Under Natural Law conference, and it was called De facto Satanism, where he really talks about the norm in our society among average people is serving the ego. It is a service to one's more selfish desires for getting ahead, for material wealth, and that this is infiltrated our Western society very much, and it is in fact a sickness that is really lost from care and true um, ability to look for the needs of all individuals.
Mm.
I think that's one of the primary challenges we're facing in Western culture is those individuals, no matter what their root belief system, where it's coming from, it's individuals that want to continue to fight for the pleasure of the ego and the world and be more focused on that. And then there's people who want to take a spiritual approach to living. And that looks like many different things. You know, a spiritual way of living could be religion, it could be natural law, it could be a new age philosophy. There's a whole category, there's many categories that fall under the desire to lead more of a spiritually inclined holistic life. And it, you know, I don't know what's going to happen, but I think that is the war. We talk about having a war. I think the war is it's a spiritual battle with are we going to serve something greater than us and help to get along and not just go along to get along so I can get more power and influence and money. And maybe there is a bifurcation, maybe there's a split. I know in the New Age community many years ago, there was lingo referring to the new earth. There's going to be two earths. The earth is going to split into two.
Mm.
These are all channelings of the same exact subject, which, and just biblically, it's separating the wheat from the chaff. It's who wants to lead a spiritually inclined life and who wants to continue to serve the Satan, the lower nature, the ego in a way that harms others.
Mm. Yeah, so it reminds me of the phrase doctor as teacher, in a sense, or you guys are saying doctor as philosopher. In many ways, as Scott said, I mean, religions maybe in the traditional sense, or doctors could be seen as teachings. You know, these are teachings that are shared through many different generations. Yeah, this medicine works. My grandparents used it. You know, this recipe, if you make this, then this will help you. If you have a cold, you know, it's things that are usually shared for many, many ages. And I think people are starting to uncover, like, huh, how come my grandparent is stuck in a retirement home and can't share that wisdom with me anymore? How come I don't have my family's ancient recipes? How come my grandparents are, diabetic in a wheelchair, stuck in a retirement home, not with their own family? And it's like, well, they could be a teacher too, and they can help heal their family, and they can take responsibility over their grandparents as they get older and have problems. And these teachings are meant to be for everybody. But perhaps they can be included within certain groups, right? And they're kept away from other groups, or maybe there is infighting, and like Stephanie and Scott, you guys were saying, like there could be some of this not promoted within the current mainstream systems. And it's interesting is there's new fields that come out of that, right? Like the new age, these new fields that emerge because of the old failing models. So psychology, in a way I see, is kind of like a bridge between religion and science and trying to find a way of like, huh, we acknowledge there's something called the soul or the psyche and the mind, and then we could study the mind, and all of a sudden we find ourselves in spirituality, but we're still dealing with human behavior. So I think it's fascinating. And it's not something to be denied that these changes are revealing to us something much more profound. Like the fact that people are making these types of statements or can agree to these types of statements that we live in a sick society and people are becoming adjusted to it should be telling enough. It's like, okay, what's going on here? Why do people resonate with people like Jiddu Krishnamurti when he's not claiming to have any special knowledge? He just wants people to be free and live their own lives. Why are they finding his message so profound for being so simple? That's the question. Why is natural medicine becoming so profound, these spiritual teachings so profound if they're so simple and so universal and timeless, right? And I think it's because of some conditioning that people are realizing is present. And that brings us to really, if you've gotten to this point in the seminar, our action steps, right? And I think through this whole process, you start to see we're entering new paradigms. Stephanie, could you break this down for us, going from the 3D to the 4D to the 5D?
Sure. Well, we could perceive that we live on Earth, which is a 3D reality, which is matter-based. It's what we see. It's part of our senses, what we feel, the Earth realm. Sometimes people call this the matrix. It's part of the 3D. Okay. It's these structures that exist. Some are seen and some are unseen based off of years of historical, conceptual ways of doing things like we talked about, and they're set up as a part of our living situation. For example, medicine, psychology. Scott was talking about psychology earlier, is that we've cultivated these frameworks that have been accepted as doctrine, so to speak. And what happens is they become very embedded in society and culture, that it becomes very difficult when some new revelations come forth. It gets very difficult to try to create space and room to make these changes when these sorts of concepts are very embedded in deep systems that permeate throughout the entire world. So we could say that's our 3D. Moving to a different paradigm, which we could call the fourth dimension, is really has a lot to do with your perception. It's an opening up of a broader way of seeing something. Just like geometrically, things become different shaped. You get to see things from different perspectives. It's the same as the 4D. So this is more related to consciousness. And it's more related to being able to expand out of our limited way of seeing things that maybe we've learned or been socially trained to in the 3D, to open our mind to a broader state of consciousness or awareness, to be able to hold more without getting necessarily emotionally triggered when our personal belief systems or ways of doing things are now being challenged. So that's the biggest setback between opening to a more feminine, somatic, understanding the emotional side of our world, or into the heart, the 4D, is that very few people find it comfortable to be able to face the own ego and attachment to the ways things have been structured in this reality over time. Because then maybe they realize that everything they have believed to be true, now there's a way of seeing something that actually makes them question whether their life was lived in right living in the right way. So it's very difficult. So it's very well known that most people don't surpass consciousness beyond the 3D, the surface level, because it really requires, as Scott said, a metamorphosis process that breaks down most of what you knew to be true. And it feels very much like a physical death or deaths to be able to break your beliefs and your awareness out of the indoctrination. There's a lot of fear. There's a lot of the emotional blockages that come up before you can get into the heart. Just like the chakra system, the mapping of the chakra system, the third dimension would be the top of the lower nature of emotion. So the first, second, and third chakra represent our base consciousness, surface reality, and things below that. So in order to break into the heart, or to have a heart awakening, or to get into the 4D and to expand your consciousness, it has to do with an inner working process where you deconstruct most of what you knew to be true. And you're able to start to let the mind relax and soften from being right, from being super cognitive and conceptual all the time. And the mind fears that, because the mind thinks it's king. So the mind is going to continue to fight from one not opening to heart consciousness because it thinks that it's going to be diminished by this other force being invited to the table, which really is the feminine to that lower natured type of masculine force, these lower nature behaviors. So once we start to go through our own metamorphosis, sometimes it's called we have a spiritual awakening. Sometimes people say I'm opening my consciousness. Some people say I'm having an existential crisis. Sometimes people say I'm having a nervous breakdown. These are all very similar opportunities to be able to see with new eyes and an open heart, and to be able to hold more dichotomy without being emotionally triggered, and to start to expand your consciousness or move more into integral ways of multidimensional thinking. And then beyond that, it requires yet another process and some more disintegration and changing when you can start to, in the 5D, sometimes people call this the divine mind, where the heart and the mind are in right relationship. And they're able to discern and work together within yourself. You don't have an internal battle anymore within yourself. You're really able to understand when you need to talk and create conceptually, and when you just need to totally surrender, let go, and not talk. It's this discernment of understanding the relationship between one's heart and mind. It's very, very mature, and definitely not as cognitive as what tends to happen before somebody breaks into the 4D. A lot of times that mind is really trying to latch on, so they get very hyperconceptual, start to get addicted to hyper novelty. They don't want to just let it dissolve. It's afraid that it will be consumed, right? To let that feminine in. So it's a process, it's a life journey, maybe a multi-life journey. But I think that if we can start to even just move into this sacred heart realm, would be massive progress.
Wow. Thank you for sharing that. And, we have many different researchers that we've talked about who have kind of guided us through this chart as well, encouraging more of body exercises, somatics, and listening, being more intuitive to help us shift to, you can say, the 5D over time, or to an enlightenment type of experience, trying to, or in a sense, not trying, seeing the yin within the yang. Would you say, because I think this might be a question that comes up for people, that the 3D or the mental material is considered masculine because the 4D is feminine? Or how do you perceive the masculine and feminine in relationship to this? Because I can see there could be some confusion here. For instance, it says mental, then it says material. Does this also include, like, where does instinct come in? Because instinct isn't necessarily intuition. How would you navigate that nuance, Stephanie?
Yeah, it's a little tricky, and this is from my understanding. People have different ways of describing this. The best way I've discovered to explain this is through the chakra mapping system. So that there's 7 chakras, and let's talk about the first 3. So within the first 3, you're asking me, the matrix, the 3D, is that masculine? There's actually 2 masculine chakras and 1 feminine in the base consciousness. So chakra 1 and chakra 3 are masculine distortion. And then 2 is feminine distortion. It's when the shadow side of the sacred masculine and feminine are more permeating throughout someone's life. So it's hard to give it a gender. I know that a lot of people will say, well, Mother Earth is matter. That's mother. Yes, nature, that matter, right? That's a part of the mother. But in terms of this biopsychology philosophical view we're taking with this, is the first 3 chakras are considered base consciousness, which embody both masculine and feminine, but it's when the shadow sides of those energies are permeating into reality. And some people think that's just a natural part of reality, more so over the elevated versions of the sacred masculine and feminine.
Okay.
One way that I conceive of this progression is moving from material to more of an energetic, from the visible to the non-visible, from the linear to the non-linear, and starting to recognize maybe a more profound interaction between the masculine and feminine energies, and how that think, like, for example, in epigenetics, this is a profound concept that goes beyond the more observable our concepts of genetic material to an energetic memory that it has some reality to it, in how the experiences, let's say, of our ancestors are passed to us, and how maybe we can actually impact different timelines, through our activation of principles embodied in the material realm, so we're getting into deeper complexities around frequency and vibration, and spiritual concepts that are not typically talked about in our modern medical system, for example. Very
Yes.
Right. Yeah. And Corey, one other thing I wanted to say, when you were talking about, some people think the feminine has to do with somatics and intuition, and those are all very feminine qualities that are revered within the feminine. Those are tools that one needs to get in touch with to be able to transcend the dominant ego and mindset of the third dimension. So basically what we need to do, if we're going to simplify this, is we need to stop thinking so much, and we need to start to feel. We need to slow down and allow ourselves to really investigate sensation again. Nature, trees, feeling, intuition. So it's a process. This is the crazy part of this process, that it feels like, because you're so used to thinking, and you're so used to the observer and the observed kind of being all enmeshed together and not knowing which is which, that when you there has to be a surrendering to the feminine. There has to be a conversation between this feminine energy and this 3D that says, like she says, trust me, let go, stop overthinking. And the mind's like, what do you mean? I can't stop overthinking. Thinking is how I get through my life. What are you talking about? And there's like a distrust that can happen between the both. And that's the epic battle that happens within. But she's trying to guide through her own natural innate skills and say, let go, feel. Do you sense me? Do you feel? And she teaches you these other profound tools that we all embody, that a lot of people who are navigating our 3D world want us to be detached from, because we're more easy to control when we're detached from our true intuition, skills, gifts, and desire to connect through love rather than separation. So it's almost like she's inviting into the unknown, or like a dissension, like a Persephone, like an invitation to the underworld. And he's like, where are you taking me? Oh my gosh, no, I'm not going down into that cave. I'm never going to come back out. And then he gets pushed and pushed and pushed. And then he just drops into the cave, and he's lost a little bit. And then he explores the sensory realm, right? And it's a beautiful way for us to level up our human capabilities and abilities. Because when we have right thinking with our feminine and our sense experience and intuition, we do become much more powerful than any of the social engineers want any human to actually be. But there's also processes of refinement that go along with it too. So some people just come into this knowledge and they think that they're a guru. This is lifelong work, so just relax. We're all on a journey. But it's a beautiful journey, and it's a beautiful love relationship between these energies that we all embody. And if you can do both, that's like Ian McGilchrist's work. When you have your right and left brain in right relationship through the communication of the corpus callosum, and you know which to use when, you're operating with 50% more than most often in the general public.
I think that's what I was trying to get at. It was like there could be a bit of confusion in regards to, say, oh, well, what if someone's too emotional or too feminine in the imbalance? Well, wouldn't they be starting at the 4D and then going to 3D? But then that's why 5D is there on this chart because it's a balance, you're saying, right? It's a
Exactly.
unity. And then another question comes to mind is like, where do kids start then, right? Do kids start at the 4D and then they end up in the 3D? They become lesser as they get older and they have to realize that in order to then get to the 5D? I think that's very interesting.
I'm going to
I
let
think
someone
I
else
think
answer
they
that. Yeah.
I think they actually start in the 5D and then
Hmm.
they're
Hmm.
sort of knocked down a little bit. They go through puberty, and when puberty hits, it's an incredible energy and energetic struggle for a year or more that they are transforming their bodies. I've seen good kids turn into bad kids, so to speak. Bad kids turn into good kids. It's just such a powerful transformation. And I
Hmm.
think at that point, they sort of get a little more fixed into that's when they become a little more sexual. That energy is coming forward. And I think that's when they sort of dive down into the 3D and get stuck with everybody else for a while. And it takes a little bit of a life experiences or spiritual awakenings to sort of get back to that. And I'm assuming a normal childhood, right? I'm not talking about a traumatic childhood in which that 5D may be knocked out a lot sooner. But a lot of people, I think it happens during puberty, from my experience.
Okay.
Mhm.
Would you say that the new age is stuck in the 4D? That would be my next question.
I
That's a
would
good
just,
point.
yeah, it's a good point. And I just want to mention, Corey, because you brought something up,
Sure.
is that make no mistake, when you're an adult going through this process, in order to arrive, continue to try to arrive in the healthy state, you have to continuously or go through a profound shadow process. That's why we're all here. You, Corey, Scott, Leslie, and myself are here to talk about this inner work that is the difficulty that we need to move through when we face our own shadows of these energies of these lower dimensional frequencies. As Leslie said, these cultural attacks that we have is that you can't truly evolve unless you're addressing your shadow. That's the tricky part, the part that culture has most often ignored, hidden, suppressed to be performative in society. And that's why we're all here, is to bring the importance of the true work to the surface so we can actually evolve.
Hmm. Yes, thank you guys for sharing that. And finally, as a reflection on this point, what comes to mind going in this transition process is seeing that space in between. And tell me if I'm wrong, but not just using the example of the breath going inhale and exhale and seeing the space in between, or between the eyes and seeing the third eye, in the sense also the observed and the observer, right? In the case of meditation, if you have thoughts coming to you and you're able to simply observe those thoughts, not necessarily even judge those thoughts, but to witness them, you're creating a space between the observer and the observed, and that space, I think, has commonly been touted as like that's the point at which you might be hitting on the 5D. Am I wrong on that?
I would just like to say, I love this conversation. But yeah, some people like this space is such a sacred space. It is everything we know to be true about sacred space. And some people call it a liminal space, some people call it dark matter. But this, you hit the nail on the head, Corey, is that when we're working towards right relationship with our own masculine, feminine, the 3D and the 5D, the right brain and the left brain, is that we have a tendency to be someplace at most of the time, whether that's local or non-local. So whether you're thinking about within the brain or within the field, the biofield of consciousness, we tend to be in a similar space for long periods of time with little true evolution. So in order to evolve, what happens is you need to have a feedback loop. And we're used to getting the mirror or the feedback loop through people outside of us. We're just starting now to realize that, oh my gosh, everybody is a mirror to me.
Hmm.
right? But when you start to do this work upon yourself, what's happening is you're creating your own feedback loop within your own self by having your subjective and objective experience start to get into a relationship. And at first, if you look at it like a man and a woman as an example, the man or the scientist wants to observe the patient. He wants to stand back and look and observe. What am I looking at? How do I feel about what I'm looking at? How do I explain what I'm looking at? Right. So, and then the subjective, let's say the woman, she's there doing her thing. She's not really worried about what he's thinking. She's creating, she's being, she's beautifying, and he's watching her. So when we're evolving, what's happening is that relationship between the observer part of us and the experiential part of us. And sometimes one doesn't like the other. We don't like what we're feeling, or we don't like what we're seeing. And these two get into that battle. And then we project that battle outside of us as people that are bad. This is bad. This is bad. This is bad. So the battle starts within us, between this relationship between the observed and the experiences we're having and how we discern and perceive things. So as we move to the 5D, if you go into the 4D, the masculine part has to step back and become the observer again instead of running the show. He has to step back, trust her, and you have to experience the world of the feminine, whether you're man or woman. And you have to really surrender. And this is why you see many, many men, and very recently, they're being more vulnerable. They're being more emotional. They're getting in touch with their feelings and their intuition. And maybe they're crying more. Maybe they're more sensitive. This is part of the masculine surrendering to the feminine and just allowing that energy to soften his heart, right? So then eventually he wants to come back, right? And she has to let him come back. Like you asked me, is the New Age community stuck in the 4D? They can be. It's part of the process, but they can get very stuck and disassociate in the feminine and never come back down and integrate with matter again, that's what you need both. So yes, you go high in frequency with her, but then the goal, because we're still on Earth, is to reintegrate him and matter and what's going on outside with our new belief system of this multidimensional perspective. So then he comes back on board and he's different now.
Yeah.
He's evolved now, and so is she. And now this relationship that you have between your right and left brain, it's almost like the corpus callosum they want to make it smaller because they want to be closer together all the time. They want to dance together all the time instead of one hijacking the other, right?
Mm-hmm.
Yeah, I wanted to add from a perspective around a therapeutic model called internal family systems, which I think is related to this conversation, Corey, when you're talking about meditation, and you get to that place in between the inhale and the exhale, where you are slowing down in the gap. And in that stillness, connected to things Stephanie has said, where this is a place in internal family systems, they call it self energy. And I think it's very connected to Jung's concept of self, which is it's a witness state, right? It is the observer that is a God connected, right? It sort of transcends the dance of material life and the emotional battles and things in our head, but being able to be in that state of witness that is not only kind of truth seeking, but also compassionate. And I see this as that blending of the divine father and mother energy, that we're able to kind of have this clarity and also this love that is able to shine down upon and witness ourselves and within ourselves and between each other. And from this place is where the healing can come. It is where the integration can come, so I just felt that this was relevant in this conversation here, in a way that one positive note in modern psychotherapy is, I think this model is bringing some depth psychology into the mainstream and creating a connection to our spiritual self when it comes to healing our injured parts and our wounded selves.
Mm.
Yeah, I totally agree. That's why you'll hear people, like Leslie said, refer to the 5D just reductionistically as, oh, my higher self or my lower self. And it's not necessarily, that we want to demolish our lower self and it's bad and we always want to be our higher self. This is just the journey of life, spiritual evolution, spiritual recalibration. But there is the 5D would be considered, if you hear somebody say the higher self or the big S self. It's the self where I'm able to bring, as Leslie said, my full integration of parts into a harmonious relationship. So I'm not projecting unconscious parts of my shadow sides out and hurting other people publicly. So you hear that higher self, big S self, and then lower self is just what we've all been born into, the matrix.
Yes.
And it's about expanding beyond that consciousness.
Entering a new paradigm, we're going to be talking about the awareness to act, Dr. Joe Dispenza. And here's a quote from him. When we can change some feeling or thought inside of us, we can see changes outside of us. And when we observe that we did it correctly, we will pay attention to what we did and do it again. That action creates a constructive habit. By demonstrating how others perform such feats, I want to show you how powerful you can be. So, Joe Dispenza, you might be familiar with some of his work, maybe you're not, but very empowering. And here's another quote. Our students know how to influence the autonomic nervous system, the ANS, the system that maintains health and balance by automatically taking care of all our bodily functions while we have the free will to live our lives. It is the subconscious system that gives us our health and gives life to our bodies. Once we know how to gain access to this system, we can not only make our health better, but we can also transform unwanted, self-limiting behaviors, beliefs, and habits into more productive ones. I think this is a very good quote, summing up a lot of what we've been talking about through this great seminar that we have developed called Health Revealed, where we're looking at all these different things that affect people's health. And what we tend to notice is maybe there's some beliefs, right? There might be some beliefs in government that is influencing people, media, right? All the time they're seeing the news and it's influencing people's beliefs. And people may believe what they see, what they hear, maybe in the schooling system we talked about as well. And these form these habits and actions where if we're unconscious of what they're doing to us and we feel like we're powerless, how can we get out of that powerlessness into one of empowerment?
And something this brings up that's really powerful as an idea is that when you're doing inner work and you're working on changing something, it's usually you're working on changing something that's, whether you know it or not, it's a bad habit. And when you make progress on that, it's very important to go out and consciously work on a different approach to life, a different attitude, and you have the inspiration to do it. And I think, like in the Bible, Jesus warns against, casting out a demon and not changing your habits so that these things will come back to you sevenfold. And there's a truth to that. So this is a very powerful idea that it's important to do the inner work, and then we'll make progress with the inner work. It's important to make that manifest on the outside so that we actually channel that into some new habits, new ways of dealing with things. And that's how we become more successful and happier.
Scott, I love that. It reminds me of the need for humans to always participate in our own scientific method upon ourselves. And you always hear, follow the science, follow the science. But in terms of my life and my growth and my integration processes, you're exactly right. It's something I come to within. And then there's like an opportunity for me to practice out with humanity in the world to see if I've actually gotten it. So love what you're saying.
And I see a parallel here to the inner the inner locus of control, where we recognize that we are the director of our own system, and we can dialogue within ourselves, with our parts, with our subconscious, and impact our heart rate, impact our nervous system in ways that perhaps we don't think about. And when we start to recognize how we can transform our physical responses, and then it will demonstrate in that outward change, right? But it didn't come from outside of us, it came from within us.
Hmm. One way I like to look at it too is responsiveness versus reactiveness. And as we talked with the nervous system, we can be in this fight, flight, or freeze mode where, we are responding to the environment in a very reactive way, but not in a conscious way. So usually response is differentiated from reactive to say I'm more conscious of how I'm reacting. So it's not so much like I'm reacting, I'm choosing, like, this is what I want to do. This is how I want to feel. This is how I want to live my life, because all sorts of things can happen to me at any moment, and we're taking chances every day in our life. Becoming aware of that and going into that with a sense of trust, then it's like, okay, it's all right. I can have control over what happens to me at the end of the day because I am in control of my own mind. Like, all sorts of things can happen, right? It's like when Gandhi was put in jail for his beliefs, he's like, it's okay because they can take my body from me, but they can't take away my mind. They can't take away these ideas. They are timeless. They are beyond my body. It sounds spiritual, but that's just the nature of your mind, right? They can even take away your pieces of your brain, and scientists are finding out, wait, you can still function, you can still think certain things. How is that possible?
I think we're touching on a lot of Joe's work too, leads into this concept of training your mind in a way that you are ahead of your environment. So you're not being so impacted by what's in front of you that you're actually created such a strong locus of control, as Leslie's saying, and a spiritual connection that whatever is presenting to you, it runs through a purer filter within yourself so you can stay grounded before you get attached and want to act with that projection. And you're talking about consciousness too. You're talking about bilocal, where we are not just our brain that's creating our experience, but actually there's something beyond our physical body and brain that we are tapped into, a field of consciousness, a field of awareness, God, that actually may be contributing as the divine director, as we are the physical embodiment of the director with free will here.
Yes. And I also want to mention that it's worth noting there are different scientists and doctors who have explored this area of thought of saying, well, wait, there is something outside the brain that is conceiving of different ideas, and that maybe there's intelligence within DNA or other parts of the body, and that's kind of a holistic system rather than just placed in one part of the body. People like, I think his name is Sheldrake, talking about morphic resonance, right? And I think that's a fascinating idea because that's just one example of somebody who, is really challenging some mainstream academia. We talk a lot about how there's, alternative practitioners and they may not be, allowed to kind of be in the discourse. But also when it comes to science, there's people doing science who are doing, fantastic work and sharing different perspectives.
If I could share my two favorites that are at the cutting edge, it would be Yosha Bach and Michael Levin. They are both absolutely phenomenal in their scientific understanding of what we're coming to see as consciousness. So they're phenomenal. Top of the game, those two guys.
Love it. Thank you for sharing. And here's another individual, Bruce Lipton, who wrote a book called The Biology of Belief. Here's a quote: instead of trying to understand the natural order so that human beings can live in harmony with that order, modern science embarked on a goal of control and domination of nature. The technology that has resulted from pursuing this philosophy has brought human civilization to the brink of spontaneous combustion by disrupting the web of nature. And we talked a lot before about eco-psychology. There was a lot of researchers talking about this idea of like we're detached from nature and that modern science maybe isn't what we think, and maybe even some of the methodologies are kind of limiting more indigenous or methodologies that aren't really explored out there. And here's another quote: meanwhile, we are leading lives without a moral context. The modern world has shifted from spiritual aspirations to a war for material accumulation. And that was one thing that we also observed, was that we were looking at nature in kind of a spiritual, psychological way, and juxtaposing that with the material and the purely mental, and saying, well, morality is helping us see we have to have empathy, we have to have consciousness, and look toward these ideas that are greater and holistic, considering all these different things that are happening, not disregarding the material, not disregarding the left brain or disregarding the right brain, but seeing the integration with these, and then saying, okay, this is how I can act. Like the previous slide said, well, once we have the information, we know what to do, and we're kind of deprogrammed, maybe from a more natural point of view, because we're beyond our own mind and we're looking at other people and how they feel and how they react, then we can know how to better act for ourselves.
Another thing that Bruce Lipton and these gentlemen are coming to realize is that something spiritualists have had their eyes on a long time, but to have the data to back up that matter is just a condensified, dense version of energy. Right. So this is why you hear people in the new age say manifestation, manifestation. Well, literally, you can't really trick your mind into manifesting something. It's whatever your authentic core frequency is. If you condense that into matter, that's what's going to show up in your reality. So in terms of this biology of belief, it's not about what you want to believe, what you're working on believing. It is actually your core frequency of where you're at. So really, again, turning back in psychologically and spiritually to really honestly address where you're at and to take your time and to move slowly, authentically. So you're manifesting where you're at and you know where you're at. And you're not trying to get too ahead of yourself. You're not kind of usurping where I want to be, like the future, but you're not actually quite there. Then you can manifest all sorts of interesting things. So I just love this idea of now they're starting to be able to scientifically show us and study in the research that matter is a condensed form of our energy, our beliefs, which is phenomenal. So we are creating with our mind.
Yeah, and that's just one of many things that Bruce Lipton speaks about. And one of the things I really like about him is that for the materialist scientist viewpoint, he actually came from that background. And he's a very spiritual person now, but the way he presents this is in those terms. And he really practically proves the existence of spirit in separation from matter and in interaction with it in a way that anybody who feels like they come from a left hemisphere perspective with a lot of logic and really hard to see anything spiritual, this would be the book or the person to listen to or read, because he will really explain it in ways that really are grounded in science and that pretty much prove, in the way that science does, based on studies, how this works.
One thing I want to share is that you see there's a picture in the bottom of the slide says, I love me, right? And we have beliefs maybe even about ourselves that we want to look at. For instance, Mark Passio, which is a researcher we shared in this presentation, talks about this idea of self-loathing, how people may not truly respect themselves. And to heal self-loathing, you need to have self-respect. So maybe we can ask ourselves, what are our current beliefs? Do we think that we have intrinsic value? Do we understand that we own ourselves? How do we treat ourselves? Because that might be a reflection or a helpful projection to understand how we treat others in the moral context that he's talking about. And so that brings us to understanding how practitioners can address statism, which is to affirm basically the belief in authority, the right to rule, right? This is a belief system. We were just talking about how belief systems influence behavior and how we perceive ourselves and other people can definitely determine how our actions are being carried out and what's being manifested. So Scott, if you can kind of break this down for us here, we have 4 points talking about what practitioners can kind of do in their own practice or in their own lives to address this.
Okay, the first one is becoming aware of the stress of statism is not at all dissimilar to uncovering an abusive spouse or family member, or even the habitual pattern of turning on the news and taking on continual stimulation to stress. Once the stress caused by the state is recognized for what it is, duress caused by some degree of uncertainty or even terror of the state, a knowing doctor can recommend an approach of limiting the stress and seeking therapy. So this one is basically a doctor in the know basically can help the person identify, how much time are you spending scrolling? How much time are you spending watching the news? What are you doing in your life that's not making you feel good? What is stimulating the stress? And so that's an important factor in the whole medical plan of getting well. And number two, the second one is therapy should focus on reducing and remediating fear and trauma. That's very true. And fear and trauma is the entryway into deeper issues as well. So you can kind of, as they say, kill two birds with one stone. You can feel better talking about your fear and trauma, and in doing so, it's going to uncover some deeper issues that you may be able to get at, which will help you get to the roots of the fear and trauma and maybe not be so predisposed to reacting in fear and trauma when you can uproot those things. So the third one is, since statism is so common and not likely to become an official DSM label, that's as you probably we've talked about before, there's such an intertwined interaction, especially not just with the medical system, but especially in the psychiatric system, between the state and the system. It's not likely at all to become an official DSM label. We can bypass all of the above easily by keeping therapy directed at it in a, quote, personal improvement category. In other words, one does not get diagnosed with statism or even know they had such a mindset until after they have safely overcome it and can now look back on their earlier state of mind as a comparison. So this kind of relates to point number two. If you focus on the fear and trauma and where it's coming from, you're going to get to some degree to the state or to something connected to the state, and it's going to relieve that overall fear and trauma connected in that area. So the accidental results are you don't even have to address statism directly and by name. You can see it as one of the sources of your stress, fear, and trauma. So on the last point here is become an educator focused on empowering others to lead themselves and recognize psychological manipulation or ego. And so when we have done the inner work and we get some perspective on our relations and interactions with others, we can drop the pretenses of being dominant or submitting to domination, and we can actually treat people on an equal footing and actually empower them by helping them to get to that point as well.
Thank you, Scott. Yeah, and it's something worth noting that this idea of statism we have detailed in great depth in this whole seminar, where we showed that, hey, the state is causing trauma and fear in people's lives, and it is causing situations like democide, which is known as one of the top causes of unnatural death. So looking at this in a kind of a medical or psychological point of view can be quite helpful. But like Scott said, let's not get too focused on the label, right? We can have this tendency where we say, okay, we're looking at this idea, and now we just want to call this person a statist, call this person a statist. It's like, no, they're going through this mindset, this belief system of statism, and it's usually programmed at a very young age in the schooling system, as we talked about. So just becoming aware of it and then helping other people become aware of it, and then perhaps utilizing these different strategies can definitely help in different circumstances, right? Because of course we have a whole world of people under different systems that they're programmed into, and different governments employing different tactics. But generally speaking, the basis of it is this one belief system that is shared across the whole world. And so, Scott, if you can expand on this from the past therapies that have been used for treating kind of this statist, psychosocial pathology that we notice within the world where people are believing that some people should rule over their own lives and take control of them. Some, we talked about mental slavery, where people say, I want to be a slave, I want to be controlled. And also this hardness of how do I resist? How do I gain control of myself? The state is this powerful thing, we say, even though it's just a bunch of buildings and people, we perceive it as this kind of superhuman like entity. What have we done in history to kind of confront this?
That's a great question. And in order to kind of introduce this, um, we need to kind of think of a model of personal growth and personal therapy where we have things that we've done in the past we don't feel good about, and those can haunt us and get in our way. And then we have the things that have happened to us. Okay. Now, when it comes to groups and the state, and particularly cults, especially, they don't get much mileage from what's happened to you, but they get a lot of mileage about things that you've done that you don't feel good about. So let's read on and see what we have here. Past therapies for statism. Past therapies push the person to confess and admit need for change. Taken to extremes, it is the secret of secret societies. But the empowerment goes to the group. Even though the individual overcomes fear by overcoming fear of confession and bonding with their group over it, Alcoholics Anonymous, Catholic Confession, taken to extremes in the Jesuit groups, Scientology Confession, they do that too. Erhard's Seminars Training, which is a branch of Scientology, branched off of it, and other spiritual boot camps. All these have built powerful, fearless memberships which show that potentially one can achieve that level of release from the bondage of statism needed to empower the individual to challenge the state. These are the only known successful therapies outside military trauma bonding that tend to empower the individual before the might of the state. So you have these therapies are very successful, but they tend to be emphasized in these groups that use that result of your personal liberation now becomes theirs. It belongs to the group. And so you belong more to the group. You're happy that, and this also applies to drug addiction. Some of the most fanatic Scientologists I ever met, because I was in there for a certain time, were those who had come off drugs. They felt literally that this had saved their life, and they weren't wrong. It had saved their life, but they didn't have the perspective of how it was a technique, and the group doesn't necessarily own this technique, and that they were a big force in deciding to change, right? But it's just the way that the cult has these cults have of gathering up the people who have gotten results from this kind of therapy and channeling it for their own purposes, let's say. So these are successful therapies, so we should learn to apply them ourselves. And some of them, some of the most useful slogans might be like, confession is good for the soul. You got a partner, a spouse, or a friend that you really trust and is a good listener. Use that to leverage that to get that out of you and out of your mind or your head where it's driving you crazy, and get that release. And then as per the earlier slides, change your habits in present time and change the way that you interact with the world, and you'll get a pretty powerful transformation if you leverage that for your own good and using your own judgment.
Yeah, thank you for sharing. And I want to repeat, before I talked about how I interviewed different individuals, many people who were in the military, whether it was, veterans or policemen. I gave the example of Daniel Arnold, a good friend of mine who, escaped that system after 30 plus years. He was in all sorts of different departments, and he saw there was this kind of ego in himself that he didn't recognize till later on in life, and he ended up writing books about it. So it was profound for him to recognize his ego and say, whoa, I've had this all this time, and I thought I was doing the right thing, and I thought I was, protecting the people for the people, but wait, order following is not doing what is right. It is just doing what you're told. So he came to this understanding of statism, exactly so. And I wanted to give that as an example and also say that there are new therapies that people are creating in a sense. You can call them therapies or approaches, but like we mentioned, Candles in the Dark by Larkin Rose, where it's a Socratic method of asking questions and learning how to talk to somebody to help them see in themselves their own belief systems and what they think about the world, to kind of find the honesty, right? Where is someone being honest? There's another approach called literally radical honesty, and there's a best-selling book about it, where it's all about, can you be as honest as possible? Well, if we are being as honest as possible, we would recognize our fellow men as just our fellow men. We wouldn't recognize them as a king or as a slave or as any sort of identity that gives us more rights or less rights than our fellow man. We would see us all as equal because we all are within the same reality. What would give us that moral right to rule, right? These are the questions we would ask if we are truly honest with ourselves. We say, oh, well, this certain document, just because it's written down, just because someone puts on a certain outfit, does that change the nature of morality? Does that change reality itself? And don't forget that Carl Jung even said that religion can be one of the most powerful tools against the state, but that's also the reason why the state needs to have control over the religions. And you'll see many Christians and many, Buddhist or any religious individual will not challenge the governments. They will not challenge this authority that, is in man, even though it may even say in their own scriptures that you should not worship, more than one figure, and that would be idolatry, right? But yet it seems like we have these weird contradictions. We're breaking the golden rule. We aren't being honest with ourselves. What's going on here? That's where we need perhaps some of the self-reflection. So thank you, Scott, for summarizing that. And as we move forward, we can share more of those different therapies or approaches.
Yeah, I'd like to add one comment here. And this slide is talking about external witnesses, right? Revealing, confessing, being brutally honest about aspects of yourself that you're uncomfortable with, that maybe you have guilt, and the value, the power of being witnessed. And I want to add that you can also do this internally, and that it's very powerful as well to become your own witness to your confession, and that you can do healing work through providing compassion and witness to the parts of you that are in inner conflict, that have are suffering. And so if you are don't have availability to an external person or safe group, or you're apprehensive about trusting anyone externally, there is a way for you to do this healing within yourself, and in a sense, connecting to your higher self, which is really a powerful, compassionate witness self that is really providing a healing energy in itself. So
I would like to
one
just
very important thing I wanted to add to that, and as Leslie was just saying, the model that I introduced earlier about the things that have happened to you are incredibly important, because processing those things that have happened to you, getting somebody to listen to you, or if you're on your own, journaling that, or both, is very powerful and important, because these groups could not leverage this into the group if these people participating had identity. And you get identity from getting the things that have happened to you and being able to say, hey, I matter, and these things happened to me, should not have happened to me, It's sort of like nursing your inner child in some of the psychological approaches and the terminology that they use, or just basically learning to love yourself, saying, I was a child, I didn't know, it's not my fault. And it's a powerful left-right step forward. If you want to think of this slide here as the confession part as the right foot, if you're right-handed, you can do a lot of damage with a weapon or with your fist, or your right side is a good controller. It's very powerful. But you would never move forward or be able to run without that left step. And so that left step needs to happen pretty much in balance with this right step of confession and coming clean and becoming honest and straight. That idea that there are things that happen to you and you do need to retreat, be able to cry, be able to receive. It's kind of a feminine energy, and get some nurturing. And sometimes, unfortunately, you have to provide that to yourself because there may not be someone around to do that. But if you have a good therapist or a good listener around, that is a time to take advantage of that because it's doubly effective with another person. And to take those left steps in balance with these right steps can be very empowering. And you get to keep your identity. You get to actually and this is something I'll go on a bit of a limb here and just share that without this, the person almost has a difficult time coming to this a real conscience and a sense of right and wrong. Okay, that starts with being able to get through the trauma of the things that happened to you and to form an identity that's very intact and very healthy. And then when you get the confessions of the things that you regret from your past, you now are empowered to think about that in relation to others. And you now have cultivated some empathy. And now you can interpret and understand right from wrong and some of the nuances. We talk in our groups about objective morality, and there's also the interpersonal relations and how do we treat other people. You may not wrong a person objectively, but it may not be a good connection with the person if you're not a good listener, if you're not empathetic and caring. So those things need to be cultivated as well to succeed and to be happy in life. And so it's very important to have the balanced approach to therapy. The things that happen to you and the things that you've done that you regret, and try to keep those more or less in balance.
I would like to add a little caveat, a nuance to this regarding not just doing the work upon ourselves and kind of connecting to the higher self. Well, actually, I'll talk about it both ways, internally and externally. I think the internal caveat with learning to bring on the observer and the witness, it's a process to make sure that ego isn't actually coming in as your witness. And I've had so many countless people say to me, how do I know if this is my higher self, my intuition, or my shadow and my ego? That requires coming to relationship with your true, authentic higher self. It's like a college education. It takes a long period of time to do work upon yourself to make sure that you can discern for yourself very clearly between your own ego and your own higher self. They're two different things. And then externally as well, the caveat or the shadow would be having someone to process with, a partner, some sort of pair bonding, I think is phenomenal for what Scott was talking about with confession. But we have a massive movements with interference of relationship styles, attachment style, dysfunction, trauma, bonding. And there's this word that's been circulating around a very long time, which is, the empath. I'm an empath, right? I'm a healer. I'm an empath. I can absorb other people's feelings and I can feel what other people are feeling. I'd be very careful with that kind of language. That would indicate to me that someone is more so at the beginning stages of their their higher self process, because a lot of times what then will happen was people will sit with other people wanting to hear all their problems and wanting to help heal them, and actually they're not integrated enough in their own trauma experiences, and they may be reliving incidences that they need to heal through the reflection of another. And at the end of the day, it creates something more that looks like a trauma bond than a true empathetic as equals type of relationship. So I just think those are two mindful things as caveats to be aware of. The last thing I'll say is that with pair bonding and working through things, the degree of discernment, and I'd call it like an energetic resonance with the other person, is really important. If you feel as though you're on a healing path and you get into a pair bonded relationship for healing where someone is trying to claim hierarchy over you, it immediately, there's an immediate power differential. And I think what we're trying to do in this trauma healing is just be empathetic as humans and be participatory in our own collective healing process. So when you step into certain environments, even if it is a professional, even if it is somebody that holds a PhD or multiple degrees, they need to have the humility enough within themselves to truly meet you as another human being before their degree or their whatever it is that they're holding. So just a couple of nuances that I've seen in this sort of work with the internal shadowed caveats and some of the things that can happen externally as so far as empath, narcissist. This is all about really how holistically we're integrated within ourself, but we like to blame the projection before we take self-responsibility. And the other caveat is that doesn't mean to say there's not actual abuse that happens in the world, and there's not actual people that are have the diagnosis of being a narcissist or being codependent or borderline personality. It's a very slippery slope right now. So we're moving this paradigm, as Corey said. So we have to not throw the baby out with the bathwater because we don't have all the research behind this new paradigm to back everything up yet. We're not there yet, but there is a profound better way in this new paradigm that we need to start collectively entering, and then we can weed out some of the ways in which we can refine ourselves as we proceed. But we're all mindful that we might get that kickback from the scientific community because this is all quite new and really the antithesis of certain people's life's work. So
Yeah.
that's a challenge.
Yeah, Stephanie, really good points that I need to bounce off of here around the work of Richard Schwartz, who has created the model called internal family systems, which has become quite popular actually in the therapeutic community. And it's a model that I really appreciate. And he talks about this witness state, and he defines that there are really important key qualities of a healthy witness, whether it's internal or external. And he calls them the 8 C's. So to be a healthy witness to, our wounded parts, right, that it would involve these qualities of calmness, curiosity, clarity, compassion, confidence, creativity, courage, and connectedness. And this is a state that is, and compassion being probably the primary state. And it is one that creates a safety for the individual who is confessing, who is in pain. And to me, I think of it as the balanced divine parents, the divine masculine and feminine, the divine father and mother kind of present and holding that space in a loving way, So yes, there is a way to cultivate that state within oneself to do healing work for yourself and to help heal others.
The 8 C's flips the Western medical model on its head, and most things that traditional classic providers are taught in med school, so far as personal boundaries, and there's just no, this is something I've been harping on forever with the nonprofit that I had, is there's no classes on self-awareness and the self, understanding the self in medical school, really deep self-awareness. So the thing I love about Richard Schwartz's work that's taking off in the 8 C's, as you said, Leslie, is that it requires the providers to level up too. It's not something that I can learn from a textbook and spit out knowledge from. It actually has to be an embodied, integrative experience of our own healing process to be able to hold that proper, healthy space with another. That sounds amazing.
Yes.
Wonderful, guys. And one thing I want to mention from my point of view, looking at this and what we've been talking about, is becoming human seems to be one thing that we are talking about. And another thing is treating others as mere human, and not as gods over other men or slaves, right? Just becoming human and treating others as human, as simple as this is. And I love when Scott kind of talked about this idea of like learning how to walk. In a sense, we're kind of doing that psychologically in our world. People are going left, right, or they're starting out right, left on the political spectrum. And as they start to gather insights on both worldviews, they might get more centrist, right? And then it starts to become effortless, as if it's not really need of talking about left or right. And maybe they start to understand you need to just learn how to walk. And so in this coincidence here between what we talk about with illness and what is unnatural or what is immoral, these terms tend to go together in history, at least based on my own observations. You had the priest who was in the church, who was known as the healer, right? And now we have the medical profession, who is maybe not talking about morality as much, maybe isn't considered a religion, but how much are they functioning as a religion? If we see that the religions can help people overcome some of the problems that they have with disease. It's fascinating seeing that there's these connections between religion, medicine, and state that don't often get addressed because people are afraid of having looking into it. So I think just to be able to look at this, reflect on it, if you are out there and you're thinking about these ideas, that's an incredibly powerful thing, since throughout history, these ideas have been so tied together. It is profound.
I just want to add something real quick, just for our audience and people that are watching, is there are unique, gifted people with spiritual gifts that do exist within the world. And they may look like a surgeon. They may look like a school teacher. They might look like a mother at home helping in the community or working at the farmer's market. There are people that at times seem to have some sort of superhuman capability coming from source, God, coming from something to be able to profoundly serve. One thing about Jesus that I'm just kind of in love with is, like, he never liked to show off his gifts. He kept it very undercover, and it wasn't showy. It was only when it was absolutely necessary. And that's a good trait that humans who are gifted, whether it be, some people have talents, they're just like really exceptional at a musical instrument or a vocalist or a craftsman. Like, they have a really specific skill that they're really talented at. And then there are people that have spiritual gifts. But either way, it's really keeping humble in those gifts, that you could lose your voice at any moment and you're a professional singer, or you could lose a finger and you're a surgeon, or you could. So really just always being humble when we have those connections to some sort of like superhuman skill or, talent. So, when we talk about religion or the medical system, we're not just having a blanket statement that everybody's bad or all of your training sucked and like God isn't coming through any of you in any of these systems, because there are people that God is coming through these people in these systems. I think we're just trying to emphasize a more holistic, correct, balanced way of demonstrating this in public and with humans, as Corey said, like really understanding that there's something about elevating and ascension and getting a lot of spiritual wisdom and feeling moments of enlightenment going up, but then the descension back down into a human body and living in a very complex, disorganized, often chaotic, sometimes evil world. That's the real work. It's not like ascending out of here. It's actually pulling it back down and living as a human being, understanding your traumas and experiences, having the power to alchemize them, hopefully to help others, but then helping others in a proper way where you're super, super humble. And you understand this ain't all about you. It's about the work you did and what God gifted you to help others.
And I wanted just to add that these qualities of compassion, curiosity, all of these are qualities that as humans we can access. And I called them divine. And I see this as in a way where a material self can meet, the spiritual self, where we can find this huge heart, and it's can be called forgiveness perhaps, but there's a spiritual alchemy that can occur and we can all access it. It's not something that's just relegated to special people or priests or, defined healers, but this is something that we can all cultivate within ourselves.
Yes, I heard somebody say just this morning, people like to travel the world to get revealings and enlightenment about other cultures, but the best trip is the shortest trip that you'll ever take, which is the one from your head to your heart.
I love that. And I want to say, we were actually just talking before doing this that I was running across people in my day-to-day life, just being open, just being observant, just looking at what's going on and then just listening and hearing people. And all of a sudden there's people who are like sharing their traumas with me and sharing all these deep things. I'm like, I never expected that. Like somehow I'm reaching all these people that are in these circumstances. And I'm like, how? Right? But I was just there, present and open, kind of providing them like a group support, like what you guys are talking about. And just by being there alone, they were just like thanking me. And I was like, okay, I was just here, providing support as a human being, like Leslie said, just being empathetic, just being sensitive. And when we're sensitive, we're more aware to what goes on in our environment, right? So it's not a coincidence that as we become sensitive and aware, we might seem maybe paranoid at times, or maybe we're trying to navigate and we feel like, oh, maybe there's too many foods that I shouldn't eat. And we go down this rabbit hole. But then as we come to discern out of it, we're like, huh, maybe it is simpler than I think. Maybe I overcomplexified things because I got out of a world that was hard to ravel with. But I'm just finding myself and I'm helping other people find themselves. And by helping other people, I also find out I'm helping myself too. Isn't that interesting, right?
Just to bring it really down to earth here, I just saw right before we hopped on here on Twitter, Chris Cuomo, who I believe is had a show on CNN, which is not my media of choice, and we're not going to get political, but basically, he had a breakdown in his car and he recorded it and he posted it on X. And he said, man, I've been wrong. I've been wrong about my beliefs, my people, what things I've done. I mean, he just went on like a few minute explanation of basically crying out publicly and just saying, I've been wrong about this. 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 And again, in the comments, it's telling to see who's able to hold that fourth dimensional awareness of heart consciousness, because they'd be like, well, you didn't think of that when you did this, or you didn't in COVID, you didn't do this. And immediately I just wrote, that's awesome, buddy. Like, it's called being human. Welcome back. Like, just like always keeping the door open from your heart, even though maybe a year ago or 6 days ago, he was saying things that you totally didn't believe in. But when somebody has a moment of honesty and transparency about, I've been wrong, and seeing somebody that holds a position of power to come forth publicly and cry and said, I've been wrong about this, 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 that to me is one of the greatest elixirs of modern society that we could see demonstrated within the public sphere. So
Wow.
didn't like Chris Cuomo up 6 days ago, but now my heart's open, and I'm learning in this process that I have my own beliefs and my own systems that I abide to, but how can I put the love and the compassion above belief, no matter what? How can I just sit with somebody, no matter what their beliefs are and whatever's coming out of their mouth or whatever they're doing, and sit there and love them? And lastly, I'll say, I saw an exorcism the other day. And wow, to have the capability to sit with people who are, I mean, like literal demons coming out of other people, and there are people willing to sit with those people to try to create a release and a purge and a rebirth. And I think that's what's being called to us here. and us in humanity is, yeah, we've all missed the mark a hell of a lot, which missing the mark is sin in theology. We've all missed
Wow.
the mark. Come on, we've all missed the mark. And can we start the foundation with love? And then sort through the other things, our logic and our issues, sort through that, but keep that rootedness in love and compassion first.
And it is possible to live in this paradox and have both moral clarity and compassion and love, and to bring that together into one central place. And I think that is key.
One thing that comes to mind is I call it like a practitioner mindset. At least perhaps what a practitioner should do is listen and learn. But let's say, you were to treat the Rothschilds or the Rockefellers, or you were a doctor and you were saying, oh, well, Hillary Clinton or somebody that usually people have stigma around. They're saying, oh, well, I don't like these person. Would a practitioner say, I don't want to treat them. I don't want to help them because they're
No.
this person? Right? Should they do that? Or should they care for the body, for nature, for the soul beneath? Is that what they're trying to find? Are they trying to heal the person? And therefore, no matter where they are coming from, if they have cancer, some extreme thing, it's like, what can I find beneath those layers of disease or identities that are just holding them back, not just myself back? I mean, it's bad enough they have something that holds themselves back, that we have to put an extra layer on top of that and judge them for it and say, well, I don't want to help them because of that. I don't even want to listen to them. I don't, that's a mindset a lot of people have in politics. If you think differently, in religion, if you think differently, these barriers that we are creating on top of the barriers that already exist. And then we wonder why we can never connect.
That's the complexity of the modern healthcare model, is that typically you can't turn people away because they have different, like you can't do that. So they're seeing all sorts of people with all different kinds of belief systems spewing all sorts of things from their mouth, and they still have to be the doctor. And I think too, because of the lack of time or education around this inner process for the providers themselves, this is why I think we've become fragmented, a little judgmental, and especially very burnt out, because we're having to hold all of these perspectives and we haven't even done our own inner work.
I see. Thank you guys for sharing. Love the deep dive into this. And so I want to talk about something that is seen as the contrary to this idea of statism, at least in the kind of mainstream discussion around more of the philosophical, political sense, economical sense. Of course, we're sharing more of a psychological sense, so we shared some perspectives before that are more contrary to statism. But this is one that I think a lot of people are starting to come across, and this is the idea of voluntarism. Now, we've hinted to this a little bit before, talking about this idea of voluntary interaction and how this word anarchy is kind of skewed to be seen as chaos, when this word voluntarism is seen as anarchism, but under a more philosophical context where it's saying, hey, I want voluntary interaction. There still are rules and people can come together and there's leadership and there's hierarchy, but there just isn't dominative, involuntary hierarchy where certain people are taking on these positions and saying, you have to obey me or else. And so this idea you can see on the right hand side of the screen, it's even got some of its own identity, some of its own colors, right? And some people have made graphics about it. It says, good ideas do not require force. I believe in a voluntary society. Now, to me, this reminds me actually of people who talk about relationships and they say everything should be consensual, right? It's like if you're not in a consensual relationship, then, you got to really consider your boundaries. You got to think about this and that. And the question comes in my head is, well, are there non-consensual relationships in our own lives with the systems that we live with, right? Like, are we really participating in a consensual system? If we promote consent here, why don't we promote consent there? Like, what's the disconnect here? Is this a universal principle? Like, do we always respect an individual's own choice and their own property? What's going on? So here's a slide talking about this. Self-determinism and personal responsibility is actually the only guarantee of sane and rational conduct. It is the external influence of statism on the mind that prevents people thinking for themselves and thus exercising the mind in its full innate capacity to come up with solutions. The only alternative to statism is voluntarism, by which we deal not as collectives, but as individuals. And the reason why that is, and we talked about tribalism before, is because we're respecting individual rights or individual ownership. We say this person owns himself. So we can't make some greater good or collective good argument to say that we should violate this one person to provide for all these other people. We have to respect every individual because otherwise we'd be degrading them. We'd be saying, well, this person should be a slave so the rest of society could become civilized. I mean, this is what the abolitionists had to deal with in the 1800s. There's a bunch of people saying, well, without slavery, we can't get this done, that done. If we don't oppress these group of people, we can't help this group of people, right? So it's about trying to overcome those false or old belief systems and into the reality of, okay, again, we're all just humans, we all in ourselves. So the only way to form governments that don't descend into autocracy, oligarchy, and tyranny we can say is to make them voluntary. So we can call it a voluntary government, or we can simply call it voluntarism. We can call it maybe philosophical anarchism, agorism. There's a bunch of terms that people have created to kind of show, we can come together, we can do it voluntarily, and we don't need force, we don't need statism in particular. And 5 questions that are really helpful to kind of decipher this mindset of statism within ourselves or within others that we might want to help, in a sense, deprogram from this mindset. We can ask these 5 questions, and I encourage everybody out there to pause this recording, wherever you're watching this, to really sit down with yourself and ask yourself these questions. I find them to be very helpful for myself. When I asked some of these questions myself, when I was in a mindset where I was, increasingly becoming political, but yet I held very strong moral views on my own, and was a very nature-seeking person, I wasn't connecting the dots, and these questions really helped me do that. There's even simpler questions we can ask, such as like, is it right to steal? Okay, it's not right to steal. Is it right if a whole group does it? Is it right if it's a whole government? Can you delegate a right that you don't have to a group of people? Right? We can ask that. That's kind of question 1 here. But these questions cover, generally speaking, the whole scope of things. And this was taken from Larkin Rose, which he coined sort of this term statism through his book, The Most Dangerous Superstition, which we shared as the preface for a lot of our seminar here. So number 1, is there any means by which any number of individuals can delegate to someone else the moral right to do something which none of the individuals have the moral right to do themselves? And by the way, this is why you might want to pause the video, because it's like, okay, I'm not used to this language, not used to like asking myself these questions. You don't really come across these questions in your day-to-day life. Definitely not going to hear this in mainstream political talk, but this is definitely psychological. Number 2, do those who wield political power, presidents, legislators, etc., have the moral right to do things which other people do not have the moral right to do? And if so, from whom and how did they acquire such a right? Number 3, is there any process, constitutions, elections, or legislation by which human beings can transform an immoral act into a moral act without changing the act itself? And number 4, when lawmakers and law enforcers use coercion and force in the name of law and government, do they bear the same responsibility for their actions that anyone else would who did the same thing on his own? And finally, number 5, when there is a conflict between an individual's own moral conscience and the commands of a political authority, is the individual morally obligated to do what he personally views as wrong in order to obey the law? And you can think back again to World War II. What was the mindset of the soldier who had to bring people to camps or gulags or what have you? It was happening all throughout the world with different belief systems. Often these belief systems were at war with each other. But nonetheless, all those people, millions of people following the commands of one person per belief system that, again, disagreed with each other, regardless of the belief system, those millions of people, did they follow their conscience? Did they obey the law? Did they take personal responsibility for their actions? Did they understand morality? Were they taught morality? How did they view these people in power? How did they view themselves? Did they feel any guilt for the actions that they committed? Right? These are the questions we can ask, and this is what led Dr. Stanley Milgram to do his experiments, which led ultimately to this work that we have shared with you.
And I would add, what kind of psychological division would it require in order to do something that you know in your heart is immoral or wrong? How do you have to play tricks within your own mind? How would your psyche need to become split in order to do it and then live with yourself, in a sense, right?
Mm,
Think about that.
yeah. Here's a good graphic that we can use as well to kind of help us understand this. And again, this is not through a question format, but more through a story. So if John told you that you had to obey him or he would violate you, that would be wrong. Even if John claims that because he and his friends are in the majority, you must obey or be punished, that would still be wrong because the same action is still being committed here. Even if John and his friends vote to have an institution work on their behalf and that you must obey its dictates or be punished, that would still be wrong. Right now, by the way, this is where a lot of mind control or justification could be right here, number three, because they can convince you and say, well, you need this institution, it's for your benefit. And through our protection, we can protect you from this possible harm. But we have to guarantee this harm done to you. But we're going to ignore that and we're going to focus on the protection, the service that we're providing you. Even though there's this clear violation over here, no, 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 don't look at that. Right? So again, being honest with ourselves, reflecting on what's actually going on here. If you understand this basic concept and you understand that government neither has the legitimate or lawful right to violate you just because some people decided to vote for it, just because some majority said, just because some identity said, right? Does that change the morality of the action? Here's a great chart comparing statism and voluntarism, kind of in a nutshell. Statism requires force, voluntarism requires virtue. Statism divides people into controllable groups, whereas voluntarism leaves people free to associate. Now, again, don't get too stuck on the identity here. Just understand the concepts, the precepts, the actions being encouraged here. Look at envy, right? Destroying success, seeking to control others, limiting options, rewards loyalty as opposed to rewarding success, keeping others from controlling you, limitless options, loyalty to hard work and labor and what you're actually putting out there, not just because you're being obedient. So there's a whole different paradigm shift when you look at consensual interaction versus dominative or exploitative action per se. Now, Larkin Rose, he's often, pressed with this question of, well, is it human nature to have status in this mindset? It seems like so many people believe that, government and this moral authority of the state and should not be questioned. And it's just kind of just part of society. And everybody goes along with it. Everybody says taxes are normal and we need this police state that's centralized, and we need all these systems because without it, there'd be chaos. And it's just human nature that people are greedy, they're selfish, they're not going to let people live in peace. And there'll just be warlords that come over and take certain land as their own, and there'll just be a new government that gets created on top of the old one. But the problem with this thinking is it tends to ignore the psychology of statism, which we've been talking about through the course of this, which actually has been showing that, people can come together and voluntarily create communities and that people are not that bad. Generally speaking, most people know what is right versus wrong, but maybe they just have contradictions. They haven't asked themselves those questions. They haven't come to face with this idea of statism. They never heard of that before. Right? Just as the abolitionists had to face a whole world of people who are like, yeah, this is normal. This has been going on for thousands of years. That doesn't make it right. And so we can understand that maybe we have to evolve as a species, and maybe our old belief systems, like burning witches because the witch trials, right? They have some magical powers and we got to bring them to court. Like, we realized that was kind of not so great and that was a bit nonsensical. So why did everybody believe it? Why did everybody go along with it? There's a lot of barbaric practices of the past that were done away with. And to be fair, there's still some parts of the world where they still do practice some of that. But there's other parts of the world that doesn't. So that proves the fact that maybe we can evolve, that we can come to understand these concepts. Well, here's a summary of looking at statism and seeing if it's not human nature. Humans have tendencies towards both cooperation and conflict, but recent progress has been made in reducing violent behavior. And a good example I just mentioned is ending chattel slavery here in America and even the civil rights movement. Not so long ago, we just recognized, so different colors can actually live together in peace with each other. And, you don't have to have all these segregation and people can be treated as just people. right? Very simple. And so leadership, we can say, is different from authority. We can say it's somebody you want to voluntarily emulate their actions. It involves cooperation and consent. But statism, on the other hand, or authority, involves forceful domination against one's will, requires this presumptive claim of, again, you must obey me or else. So the desire for leadership, an example is like in a camping trip scenario where it's like, oh, I want to follow this person because he knows where to go. You know, he's been hiking his whole life. He's all skillful. I'm like, yeah, I want to follow that guy because if I don't follow him, I'm not going to probably survive that well. I'm not going to do that well. Like I want to follow him. But you can choose to say, I don't really want to go on the camping trip, right? And maybe I want to figure it out for myself, or I want to choose somebody else to follow instead. That is leadership in a nutshell, and it's natural, right? But this differs from accepting violent rule and then justifying that rule and saying it's actually moral and necessary. So statism requires extensive indoctrination and propaganda. Most living beings instinctively resist captivity and domination. In fact, animals in nature as well, if you put them in a cage, they want to resist. They don't want to be stuck in a cage, right? It's just part of us. We want to be free. In the same way we might say in the body with disease, it's like we want to be free of disease. So if statism and authoritarian rule were truly part of human nature, we would see people actively seeking to be dominated, which is not the case. The Stanley Milgram experiment showed that people are able to say no and not comply with the authority figure. And the people who often said no, by the way, which again was not many people, unfortunately, but the people who did, they said they studied history. They saw what happened in World War II. They said, I stand on my conscience. And I have a whole documentary with clips from all over the world where this has been repeated, and they show the 80% obedience rate. And then people come out of that and they say, I can't believe I did what I did. Like it's almost like they're profound by their own realization that they did such a thing. And so it's a profound reflection that they come to after the fact. And we tend to realize, oh, what Hitler did, what all these people did after the fact is bad. But what about if it's happening right now? What about if it's happening in our own country, in our own belief systems, and we don't see it because we're blind to it? This is what we're detailing here. And so additionally, I talk about the ancient philosophy of Taoism clarifies actually that our nature is that of spontaneous order and that it actually is freedom in order if we let it be and let it manifest. So a totally different view of human nature. And that's also considered among the first anti-statist or anarchist philosophy in the world, and a bunch of monks sitting around, abolitionists. You had inventors and orchestra leaders. You wouldn't call these individuals anarchists, but they have views that went against the status quo. And maybe that word was even used to attack them. They were just saying, "Hey, I want my fellow man to be treated as, humanity, just like I want to be treated." Very basic.
It may appear that there are large numbers of people who are seeking to be dominated or seeking to be controlled or following dominators. And I think it's important to say that when a person is following a dominator, that there's a psychological reason for that, and that it's generally based in fear or psychological programming rooted in trauma, that there's psychological wounding, a damage to self, a loss of self that's there. It's not healthy and it's not natural.
Hmm. Well, to further on that point, what is meant here by actively seeking to be dominated, most people don't think they're being dominated. They think they're being protected. They think it's actually moral and good. See, it's different if a gang or a mafia were to take somebody hostage and somebody's like, I'm in fear, I need to escape, because they perceive them as immoral, as opposed to somebody who's becoming, this this person who's being taken over their land, their business, which is the case with government, and people say, "Oh, that's okay, that's normal, that's necessary." That everybody's stolen from, that I'm a victim in this case. So they don't want to be dominated, but they don't realize they're being dominated. So there's a deception.
And it's mind control.
Yeah, you've heard
operation.
fear. You've heard fear is the mind killer. When you have this unconscious programming going on, fear is it's maybe the root cause, but it plays out in so many different pernicious ways. And it looks like entropy, laziness. It looks like complacency. It looks like not wanting to make a change and really being complacent. So it kind of starts to manifest as all of these different behaviors. And then it's almost like the bandwidth needed to really make a change once you've let this go and you've let your mind go and your sovereignty go for so long. It's like the degree at which it would take, the bandwidth, the energetic, the mental capacity to make a change. It requires more the longer we let ourselves go. But people do it. People do it, whether it's through suffering, whether it's through just a spontaneous act of God. But I think people need the education, like you said. It's just we're kind of being covertly fed behavior lifestyles that keep us complacent. And if people heard more people just kind of explaining it and all the nuances of this and the encouragement to break out of their own complacency and that they're supported. And to me, it feels like many of us have created lives out of our unconscious selves. But then once we've created a life around the unconscious mental components, now you have people involved in your story. It's like the Sims game, right? You've created a whole reality around, oh my goodness, my shadow self. Now what do I do when I'm coming to consciousness and I see that everything, and some people's worlds are much bigger than other people's worlds. And the bigger your world and the more you have in your world, the more it takes for you to break out of it, the more courage it takes to be willing
Right.
to lose it all to gain your true authentic conscious.
And don't forget, every struggle can be used as a justification to continue the old ways. So, they'll say, oh, well, it's so big, it's so massive, and there's so many people. That's why we can never go in that direction.
One common phrase I often hear people say is, I don't want to hurt anybody. And in essence, this sort of golden rule is if you're lying to yourself and you're not taking care of yourself and creating an authentic life for yourself, is that really the highest service you can do to the people that you love around you? They're adapting to your false self. So it's complicated. And, even in religious doctrine, like, they don't like divorce, they don't like to, and I understand. But I do believe that if you're coming into a rebirth of yourself, the action is to live it and then let people adapt around your authenticity, not your mask.
Mm. Yes. And I believe, Larkin actually even did a whole video talking about just be honest. And he talks about this idea of honesty as well in light of this topic.
You lose a lot, and that's part of the game. You
Mm.
have to be willing to lose it all to gain it all, depending on where you're at and what you've done in your life story. And that's the fear, I think, that keeps people stuck. But for
Yes.
myself, coming through the other side of this, I would always encourage people to do it. It's the
Yes.
pros outweigh the cons. It's going to be hard. It's not going to be easy, but do it anyway.
Yes. Well, remember the saying, liberty or death. I mean,
Yeah.
but yet they want liberty over death, or peaceful slavery or dangerous freedom. But yet the founding fathers want dangerous freedom, right? So if they are willing to prioritize that over the other, why is that? When they're literally saying that it's dangerous and they're saying the other one is peaceful, that right there is a mind warp of its own. So you're hitting on it absolutely. Awesome. So here's a quote from Edward O. Wilson, a biologist, who says the real problem of humanity is the following. We have Paleolithic emotions, medieval institutions, and godlike technology.
Amazing quote.
And one text that I love to share from the abolitionist time era here in America is from Aidan Ballou, where he discusses the difference between moral power and political power. So, moral power is the influence that operates on human affections, passions, reason, and moral sentiment without physical force. Political power is state authority that compels or threatens to compel subjection through physical force and laws. Now, this is a great text you can look up online. And the abolitionists, by the way, were, very religious individuals, so they used that as a method, I think, that really helped therapeutically bring everybody together and say we're united toward God's government, as they called it. I think that really strengthened their cause. But maybe we don't have to all become religious and revive the spirit. I think it's going to be a little different than it was back then, right? Every time changes. We want to go back to the past, say, oh, we got to do things this way or that way. maybe it's not going to be the way we think. This revolution or this awakening happens, right? And it's not even going to be perhaps a revolution per se, considering the fact that revolutions in history have just been repeating the cycle, maybe unconsciously, right? So moral power is exercised by all people, while political power is limited to a small fraction of citizens. Moral power does most of the work in changing society, while political power often claims undue credit, right? It's like, I'll take the philosopher's ideas and I'll use that for my political party. Um, Moral power influences in all aspects of life, while political power focuses on laws and punishment. Examples of moral power include religion, education, literature, arts, sciences, music, women's influence, and voluntary association. Now, notice he mentions women's influence because back then women weren't really respected. It wasn't just the slaves, it was also women. Like they didn't really have much say. So notice he also specifically mentions voluntary associations, and really looking at that whole list, to me, the word that comes to mind is culture. You shift the culture, you shift the narrative, all of a sudden people's mindsets shift. If I go to Korea or Asia and I'm in America, I notice they live totally differently. People leave their phone places, people leave their stuff, and they trust others. They walk away and they're like, yeah, no one's going to steal it because we trust each other. There's no police regulating the action there. They're just trusting each other to not take it. Like it's profound that certain parts of the world, you look at the way they live and you're like, huh, maybe it is possible. In Texas, we were talking about that when I traveled to Texas, Stephanie. You were saying people don't obey the traffic laws there. Like there basically isn't any. Like people just kind of do what they want over there on the roads. But yet everything is there's a lot of people who live there and everybody's moving there. And it's like, what's going on, right? So it's profound when I see stuff like that, like maybe just some truths in kind of plain sight. But moral power acts independently and precedes political power in initiating change. It's more flexible and not restricted by formal processes. It often operates at its own expense and without fanfare. It tends to purify and ennoble its adherents, while political power corrupts, and it often works despite opposition and persecution from political power, only to later be accepted. So, what a profound text talking about the nature of change.
Corey, I just want to add in with this the power of mentioning here the arts, literature, music. I mean, we think about politics or statism as just being like a political, really connected to politicalism, but even in the music industry or Hollywood, I mean, you see this play out so evidently that they know the power of the arts to move society and move culture. So it's really about, the people at the top who are wielding the power. And it's pretty clear and pretty evident that most people in the highest levels of power at this point have not done the introspective psychological work that we're talking about here, or they have and they don't care, which is even worse.
Mm. Yeah. Well, talking more about the moral development, as we see this seems to be quite encouraged here, and even Mark Passio, I don't think we have a slide talking about it, but he often creates this idea called the law of freedom, which is that as morality increases, freedom increases, and that these two are basically linked to one another. That goes hand in hand with what we're talking about here. Auburn Herbert, who was a founder of the voluntarism philosophy, if you look up that term, you're going to see a lot of works from him. This is a direct quote from him. He says, if you lose all respect for the rights of others, and with it your own self-respect, if you lose your own sense of right and fairness, if you lose your belief in liberty, and with it the sense of your own worth and true rank, if you lose your own will and self-guidance and control over your own lives and actions, what can all the buying and trafficking, what can all the gifts of politicians give you in return? So this is the mindset of these individuals. It's like, I see the honest reality, I see the honest self. I'm willing to sacrifice my life toward it because I see it's a greater purpose. I see this is the truth. How profound is that? And here's a little chart on the side of this. It says the act of voting, picking a master, 6,000 years of state abusing minds. Vote to control others and those under you. You will learn to be grateful for who's over you. Statism is a mental abuse issue, right? And this is just a random image that we found online. People are kind of relating it to psychology, relating it to health. And is that a coincidence based on everything we've been sharing here?
Corey, I want to bring up something real quick about religion. You were talking about using it as a moral framework. that can help organize people's psychology together. And I think one of the biggest hurdles in our history, culture at this time is overcoming fear, is really overcoming fear. And one thing about really solid people of faith, really solid ones, is that they don't fear death. So when you don't fear death, you live a lot braver, which is actually quite an exceptional. I mean, there's nothing more powerful than someone that says, of course I'm going to speak up, because what they can take my material goods, they can cancel me, they can even take my life. I'm good. So it is such a powerful testament, and something that I'm really pro, is that mentality, because they're not fearful of battling in the material world, because they're not afraid of death
Yeah.
or loss of material goods, or loss of identity or moral status or virtue. They're not afraid of that. They're real Christians, or religious people, I should say, because if you are truly religious, then you shouldn't have those fears. I mean, I don't want to say that you have no fear of dying and you're going to throw yourself out in front of traffic every day. That's ridiculous. But what I'm saying is, ultimately, you have made that peace with your own death process, and that gives you incredible power to act in the physical world.
Wow. Yeah.
That's
And
a great statement, and the reason that the state and religion have always been competitive. The state eventually will want to be the religion. So because of that very thing, that's a great point.
Right. And that's why there's probably a battle there. And you see people, I mean, I just saw in the news again, people killing Christians, or people, because the true people of faith aren't afraid.
Hmm.
They're not
and
afraid.
and to reiterate, I know a lot of people who call themselves atheists who also understand this point of view.
They
So
do, right?
it's not really about the identity so much as it is understanding the actions and what is being done. But I'm sure even them can understand the type of devotion that they have toward their cause. In fact, that's what drives people away from religion, right? Is
Yeah.
like you're too devoted, and you think your way is the best. So it's being able to
Conviction.
navigate this.
It's a conviction. And
Mm,
that can really turn people away. But in the grand scheme of the game theory of this life, is that it's incredibly powerful to not have that fear, so you can stand up.
yes. And going back to the roots of government we talked about with Sumeria, there was this idea of religion being a core part of the foundation of government, where it's like I have the divine right to rule. But simultaneously, you look at Jesus and how he was hung by his own government, and you look at some religious figures and you see how they were at odds with the governments, and it's like, maybe religion is both the tool of most control and most freedom, depending on how we use it. So again, coming from that kind of nuanced stance, it's worth recognizing that.
That's what Jesus was crucified for, his faith and his trust in knowing that this wasn't going to be the last place he was going to be.
Hmm.
So he was crucified by the lawmakers, the politicians, the Romans of the time, right? And the crazy thing is, after Jesus was crucified, eventually most Romans came around to become Christians. So it's almost like he was ahead of his time. And you see that nowadays, and in history as well, is people who come with too much visionary information, they get tapped into some sort of divine information and they share it too soon. It changes culture eventually, but often at the peril of their own life, because people don't like what they're bringing to the table. But
Wow.
very often it turns out to be true, right? I mean, look at just the phenomenon of conspiracy theories. Is like, this is Russell Brand talks about this all the time. He's like, 4 years ago, I was a conspiracy theorist, and now everybody's coming to me saying, did you hear about this? He's like, yeah, I was telling you that 4 years ago when you were writing me off because I was a conspiracy theorist. So it's just, it seems to be that certain people come into wisdom or knowledge a little bit sooner than others. And it's so funny. This has happened with me. I'm sure it's happened with all of you and people watching this. Is I come into some really amazing information that feels like prophetic, and I tell one of my friends and they're like, okay, like, and then like a year later, they're like, oh my gosh, did you know XYZ? I'm like, I told you that a year ago. But it's like their brain, it's like they forget that you've ever said it. But that's the power of planting seeds. But
Mm.
the people who are visionary thinkers, they gotta be prepared that people are gonna come back to you and say the same thing that you said to them, and you have to just smile and say, "There's that seed that blossomed."
Hmm. And there's the
That's
peace
the
of mind.
humility.
There's a peace of mind too, so you're not too concerned about like, oh, everybody's got to wake up. It's like, okay, you know, it'll
Just plant
happen, but
seeds.
right. And not to be again nuance, too egoic, like I've got it all figured out. I'm just gonna wait, and everybody will find out eventually, and I'll be proven right. Right? It, it's amazing that we have to share this nuance, but once you see beyond those types of nuances, that's when you see the even greater insights. So amazing.
Yeah.
Here's another individual, Herbert Spencer, who was a psychologist, polymath in the 1800s. And he has a quote. He says, that moral sense whose supremacy will make society harmonious and government unnecessary is the same moral sense which will then make each man assert his freedom even to the extent of ignoring the state. It's the same moral sense which, by deterring the majority from coercing the minority, will eventually render government impossible. And as what are merely different manifestations of the same sentiment must bear a constant ratio to each other, the tendency to repudiate governments will increase only at the same rate that governments become needless. And he actually developed whole frameworks around this and great works, incredible about this particularly. And he, as a polymath, he was respected in so many fields. And also, by the way, he was known to coin the term survival of the fittest. That's not Darwin, that's Herbert Spencer, who studied from Darwin, took a lot of his ideas and evolved it. So a lot of people say, oh, well, it'd be survival of the fittest, law of the jungle. But then you look at the people who actually wrote that, it's like, wait, they actually believe in anarchy or freedom? Like, they don't think it's chaos? See, this is a very interesting thing. But you can also see a chart on the left side of the screen says, without government, who would provide blank? You could ask yourself, is it important? Well, if it's important, okay, would you be willing to pay for it even if you weren't forced to? You say, okay, I'd be willing to pay for it voluntarily. This is what I want to do with my own labor, my own property. But if you say no, right, I don't want to pay for it, then you're choosing what to do with your own life and property. But people here take the caveat and say, well, again, if we need it for the greater good, for the collective, then you have to be forced for the greater good. And by the way, if it's just not important, then we shouldn't be wasting money on things that are not important. So interesting here that we see there's a waste of resources either way, essentially with government, or a deception going on, a dishonesty. And if we are willing to confront that fact alone, because many people want to just look at economics or look at the politics, confront the psychology of it, confront the morality of it, are we standing on the principles that we personally uphold in our personal lives and our day-to-day actions? Let's not go around it. Let's not avoid it or ignore it because people love to do that. Let's confront it. And that's how we can perhaps evolve ourselves as we see it's like facing our own shadows, our own traumas. And I love this whole idea of, ignoring the state. It's not so much that we have to rebel and fight and, oh my gosh, got to create a whole new crusade. It's like, what if it's just like we live our lives, we respect each other? It kind of just goes away on its own because of it.
One thing interesting about I was at church last week and somebody said to me, if we all can look away from politics more and look to God in serving our community, we'd be a whole heck of a lot better. And I mean, you go onto any social media platform, X is really guilty of this. It's just an unhealthy environment of people who are really frustrated and really angry about governmental decisions. But so many people in humanity have surpassed a lot of the being in the know of what's going on. I mean, I don't even think Donald Trump, our president of the United States, is privy to all of this stuff in this presentation alone, yet along what other people are bringing to the table. So
Yeah.
we have an authority-ship where aspects of humanity have surpassed intelligence than our highest leaders. And so, in that respect, I don't engage that much anymore with people in political debate or conflict. I don't really waste my time. I understand it's frustrating and there's a need for certain people to be there, but I like the principle of look away from politics. Look away from your TV, put your phone down. You don't need to participate all the time in debates on social media, and turn your face towards God, the middle path, and what you can do in your community. Just shift your focus of
Mm.
attention.
Yes, where your attention goes, your energy goes, right? It's the saying.
But we have brilliant people kind of stuck in that realm right now, and medical doctors are one, and they have the right. Many medical doctors and healthcare providers have the right to be very frustrated over what's gone on the last 5 years now. Was it over 5 years? I
Mm.
understand the right to frustration, but at some point, going back to the beginnings of this conversation, is moving into the new paradigm, the heart-based creative paradigm of, okay, I'm not seeing the right way to do it in our system, so I'm going to do what I can to cultivate something anew in my community. So, trying to drive the frustrated polymaths, PhDs, providers out there that are still pissed at the system into look in a different direction, because I don't think that's going to get fixed. I think
Mm.
we have to honestly focus on doing parallel ways of serving our fellow man.
Yes. And by the way, this is why Trump or different figures can seem so, I think, addictive for people because they sound like everyday people, especially if they themselves are being kept away from the same knowledge that of the people that they serve. Both, I would say, the leaders that are put in the front for everyone to see and the followers are perhaps ignorant of a lot of these ideas that we're sharing. They've never even heard of it. They've never even gone into any sort of discourse with them, at least in my understanding of it. So I think it makes it difficult because, I feel like probably Trump could be a human being. People think that. That's why it's so deceptive. That's why people believe in them wanting to change things for them because they sound like me. They look and they say everything that I'm saying. So, that's the deceptive part about it. You get someone who sounds really good, who says everything people want, or is so much like the common man, and you're actually going to make the problem potentially worse because still this understanding of trauma and ego and projection is not really being understood.
Back to what Leslie said, talking about the internal, purifying the internal locus of control, is that I do believe, the more humanity comes into a broader sense of self-awareness and does work upon themselves, it demands more aligned holistic leadership, right? So it's almost like the politicians and our culture are kind of very kind of synergistic with each other. It's kind of like a reflection. They can't be too far away from each other or they can't influence each other. The politics couldn't influence us if they weren't like the people or the mainstream culture. So the more we do that work upon ourselves, maybe we don't immediately get to a volunteer society with no leadership whatsoever, but maybe we can at least have higher quality leaders. The reflection with the political state is coming from people who are demanding more. Their standards are a little bit higher, more holistic.
Mm. Yeah, and this is definitely a high standard because people don't want to say, "Oh, it's anarchy or this, that." Don't want to look at it, right? So, I mean, that's the highest standard that we can give ourselves, like being our most honest selves. And yeah, it might be to the extent of ignoring. It might be this extent where it becomes impossible for rule. But then we know we've done it correct, in a sense, right? Ironically
I,
enough.
I've had leaders or bosses, and yes, I think no government would be ideal. But I have had incredible mentors and people
Hmm.
that have hold positions of power rightly, and they've been incredible teachers and fellow members of my soul tribe, actually, quite honestly. And I'm at least looking for those people to step up,
Yes.
who are the good bosses and the good leaders and the mentors and the really, like Leslie said, a demonstration of more of a healthy mother father figure, not
Mm.
someone who's going to use coercion and tactics to manipulate people and keep them shoved into their
Yeah.
lower base nature.
You never know. I mean, it could be a billionaire. Like people always attack all these people. Oh, you have a lot of money and you're a capitalist or somebody who's exploiting people and you could use that money for something better. It's like, you don't know. Maybe if they come across certain information, I met Jim Gale, who was a billionaire, had this ego experience where he sort of had this spiritual awakening and Then he said, all right, I got to buy some land and demonstrate permaculture and show people how to grow food. And now he's calling out other billionaires saying, why aren't they doing the same thing? I'm sure it can happen to anybody. I'm all ears. I'm all open, right, to what is possible. The universe might bring people at you. Never know. There's been families that have been targeted. Look at RFK and, what's happening with his family and sort of the history that was behind him and what the media attacks him about, right? I'm pretty sure that yes, there's definitely shadows there and there's traumas and they know some of this and some of it's maybe being suppressed or some of it's not being looked at or maybe there's even people who are beyond them who are truly in power of things, right? People talk about the bankers and these sort of shadow systems and maybe they have a deep understanding of psychology and they're using other people as strings. Like there's all little things where then maybe that opens up the potential for that person who's being controlled to speak up later down the road. Like you look at Bob Marley and see maybe he was killed by the CIA and his daughter starts speaking up about that and she becomes like a super spiritual person, right? Daughter or sister. I don't know if you guys know who I'm talking about.
Mhm.
But there's a lot of people like that where it's like historic figures, their family starts to realize, wow, this is what happened, you know?
Mhm.
Not a
Yeah,
surprise.
I think us keeping an open mind right now is really important. I listen to certain people that hold power. For instance, Elon Musk. There's certain things about Elon that I don't agree with, but then he has a tremendous audience. He is
Hmm.
on the world stage. He's an actor in the world stage, and it really delights me when I hear him saying, I see people in this world who want to act like they're, they are focused more on looking good than actually doing good within this world. So it's like we're so influential. We really are to the people that hold the power. So even Elon Musk not being perfect, doing things that I don't agree with, but there are some things coming through that I'm like, that was a brilliant thing to say and for humanity to hear. You know what I mean? So
Yes.
it's just it's a tricky environment right now, and at least for myself, I work on trying to keeping my mind open that everybody is kind of awakening at their own, you know, in their own time. And even our leaders or somebody like Elon Musk, like who knows, maybe Elon Musk is going through a dark night of the soul right now. And like, he's going to have that shift of consciousness. So just
Hmm.
trying to be open to the people who seem like they're saying things that are going in that right direction.
Yeah.
But it's tricky.
Good example, I think, is the Epstein stuff that has been going on, and a lot of accountability is being pushed on certain figures, and a lot of questions are being raised. And I love just to see that conversation. Now, of course, I don't love seeing all the things that are being exposed, and the fact that it's been hidden for so long, and people, it was all out there. And now the people, like you said, of the past are now being proven right. Um, it's just cool to see that now, people are really like, this needs to happen, especially because children are involved and it makes people really start to think, right? You hit the hearts of people, it can really change the mind.
Yeah. Yeah, it's difficult information when we start talking about child sex trafficking and satanic ritual abuse. Like this seems so far-fetched for people, but it's the attack on innocence at an adult's desire, and it's the most pernicious evil really that exists. And interesting about Epstein and Trump, I heard somebody this morning talking about how, like you said, Corey, Trump can really appear to be for the people, like really want to relate with like the down home kind of blue collar type of workers and feel really relatable. But when in the press conference he had recently, where he said, oh, we're still talking about the Epstein files. Like, I don't want any supporters to follow me who are still worried about the Epstein files. And a lot of people started to second guess Trump's relatability because the public is starting to want the truth.
Mm.
And if the politicians, if the more we start demanding, hey, we want to know the truth, even if it hurts, if it's dark, if it's real nasty and evil, we're ready to hear the truth. They need to follow through with that. And when they say,
Yeah,
oh, we don't want to talk about that anymore, humanity's like, something's not right here, you know?
that's right. Yeah, and so concluding here on the moral development, Herbert Spencer says, as fast as voluntary cooperation is abandoned, compulsory cooperation must be substituted. Some kind of organization labor must have, and if it is not that which arises by agreement under free competition, it must be that which is imposed by authority. So again, he's saying People should come together. There always will be organization. He's saying, but the type is really important. And Wade Horn, a psychologist, says if we are going to abolish modern day slavery, then we have to put the traffickers out of business, which is interesting. We were just talking about that. And he says that's going to demand, unfortunately, the cooperation of the victims. And the reason why I include this quote is because that has to demand, unfortunately, the cooperation of the victims. It's not just about freeing humanity, it's about helping people free themselves, because that's where the morality is going to come from.
I just want to bring something else up about Epstein and the victims, the cooperation of the victims. There was a young woman, one of his alleged victims. I believe her name is Virginia Gaffier, something like that. I forget her name. But she recently died. She recently passed away, and she was only in her 30s, but she was one of the bravest victims to come forth, talk about Prince Albert. And she just kept standing that evil directly in its face. And I found out later in her life, which was just in her 30s, she was just in her 30s, that she got diagnosed with chronic kidney disease, which is something that I have experience with. And immediately it just hit me in the gut and heart that she developed these health conditions because of her trauma. And she was standing up in the face of evil. She wasn't always getting the support that she needed. She was constantly trying to be hushed and to silence her voice of her trauma. So that is the thing, is that victims have to come together and stand up, and they need a lot of support because the oppression coming on them, not only from their unintegrated trauma that they've experienced, but then people trying to silence them is so incredibly powerful. So cooperation of the victims and support of the victims speaking out needs to be a high priority of protection and support for them.
Yes, and as many things start to unravel, I think people start to gain more trust in themselves. Like, yeah, okay, I can speak out because other people are doing the same thing. And here's a quote from Larkin Rose who says, "If you personally advocate that I be caged if I don't pay for whatever government things you want, please don't pretend to be tolerant or nonviolent or enlightened or compassionate. Don't pretend you believe in live and let live, and don't pretend you want peace, freedom, or harmony." Basically saying, hey, if you're contradicting the things that you say you believe in, then don't claim to be moral and enlightened and all these things that you claim to be. And we, again, we see this especially, with politics and deception. It's like, oh, they claim this one thing and the next moment they're not. It's like, what's going on here? Right? It's like this doctor claims to care about me, but it's like at the same time, does he really care about me? Right? It's like we start to second guess, question this. And I must say too, the quote about modern slavery, many people don't know that chattel slavery still exists now, and actually more than it ever has in history. And you can say that's due to population and other issues, but also in our jailing system, which is created by these systems. Chattel slavery is done in the jail systems. And it's amazing how all these modern slavery websites, trying to abolish what's going on, just kind of go around the psychological, moral aspects of the bigger picture that we're sharing here. And the same thing I noticed with, psychologists kind of going around the government, not really questioning it that much. Same thing with cult leaders in the country, people who study cults, they go around the government. Same thing with leadership experts, they go around the government. It's very interesting to me that there's just this profound ignorance in academia that is tied into what we're sharing. And yet we're sharing a bunch of people from academia who aren't being recognized as much. And I think that's why we're doing this work, is to put a spotlight and say, look at all these people who are doing this amazing work, who are writing such incredible things. And let's give that some attention, right? With the influencers, the people that are out there, it could absolutely spread.
Those are the blind spots of humanity, which we could say are the contents of the subconscious being expressed outwardly. So it is a psychological solution and a psychological problem that we're experiencing, a mass. It's like the opposite of the principle, the principle of freedom. It's like how to create slavery, Yeah.
It's like our mind has, it's like different realms. So I love what Leslie's saying, but I also see the part of it too, working in the healthcare system where, okay, you got a surgeon who spent 15 years of his life again, channeling into that masculine logical part of the brain. It's like he's making a tunnel so narrow to be so skilled and to be able to stand there for 10 hours and just stare at blood. And it's like, so in a way, it's like I don't want to shame those people because they've been channeled or funneled into something very specific by a specific system. So this is on the other end of the spectrum. This is like Leslie said, this is like something deep in the subconscious or the other sides of the brain that maybe you haven't really had the chance to explore or go into. It's a profound coupling. What an awesome time in history where we can introduce this very rich information that people have cultivated over years and say, here's a template for things that you haven't had any time to research about what's going on within the world. Here, take it, learn. That's such a gift for people who want to rule it out. It's almost like they're too lost in that one part of the brain or that hemisphere. They're shut off to curiosity, as Leslie was saying. They're shut off from their curiosity. But I think we have an amazing opportunity because people have aggregated, especially in the psychospiritual community. We have been doing so much work in a particular realm that a lot of the materialists haven't. So if we could just share this with them, and it would be an incredible gift to be able to share with each other these very different realms to become more intelligent. But you have to be open.
Yeah, for sure. Thank you guys. I appreciate that. Here's a final quote from Herbert Spencer. It says, "Pictures of the slave and the tyrant are exhibited to excite its abhorrence. A state of pure freedom is described to it as the one to be loved and hoped for, and it is made sensible of the sacredness of human rights. After men's minds have been for many years thus exercised and stimulated, a sufficiently intense manifestation of feeling is produced, and then comes the reform. But this feeling, mark, proceeds from that same combination of facilities by which, as we have seen, free institutions are upheld and made practicable. One of these agitations, therefore, is a kind of apprenticeship to the liberties obtained by it. The power to get freedom becomes the measure of the power to use it. The law of social forms is that they shall be expressive of national character. They come into existence bearing its impress, and they live only so long as it supplies them with vitality. Now, a general dissatisfaction with old arrangements is a sign that the national character requires better ones." And, I love the language of how he writes, right? It's so incredible. But he's talking about this idea of art and pictures, and it's being used to kind of show, like, this is what's possible. This is a different reality. Slaves would also sing when they're on the plantations working about a better reality, living free, and it would inspire them. It's not just a way of releasing their trauma. It's a way of inspiring them to move on and say, wait, we can get past this. And I look at a lot of lyrics from like the 80s, the 90s, like I hear songs that people hear and they talk about this idea of like loving one another and, treating others with respect and world peace and like all this stuff. It's like, is there some sort of thing that's being shared here through the music, through the symbolism? And you see a lot of these artists do that. Right. So once after many years, people are exposed to this and we see it on TikTok, all these new creators are coming in. People are like, I'm having all these spiritual awakenings. I'm seeing this, I'm seeing that. After a while, after there's a lot of stimulation, he's saying a manifestation is produced and then comes the reform. So I find that to be quite profound.
A desire to remember the beautiful and true. Like, what are we fighting for? What is all this for?
Yeah.
It is like that masculine figure longing for his beautiful counterpart. Like, I'm doing this for you, for the family, for our world. It's like, it's almost like a muse. A muse would be for an artist or a musician is like having that. It's like the feedback loop of the masculine and feminine. It's like the same thing. It's like you inspire me to be better, or this vision inspires me to go on in the face of what feels hopeless.
Yes. And the law of social forms is one of the frameworks that he created. There's also other ones like the law, I think, of equal freedom, which says like everyone is free, basically. And he has like these. It's like kind of what Mark Passio created. These certain systems of natural laws that help govern behavior based on different psychological insights. So definitely worth looking into for those who don't know. And that concludes part 8 of Health Revealed. We have our final part 9, next time. So join us if you want to hear our personal solutions and approaches to this problem of statism and delving into the solutions primarily in our final part. So thank everybody for watching, and be sure to share your insights with us. We're open to always hearing all your critique, all your comments, and getting involved on our website, healthrevealed.org. Thank you.
I'm going to skip a whole bunch of this because a lot of what this person wrote I actually agree with. They talk about, you can't delegate rights you don't have, aggression isn't okay, and forced extortion isn't okay, even if you call it taxation. So again, most of the way there, but then just couldn't take that last little step. So here we go. I'm going to start reading under the heading of legitimate government. So it says, so if government is such a tool for oppression, and if laws should be broken if they are immoral, why have a government at all? First, there must be a clarification of what legitimate government is. What makes the United States federal government any more legitimate than a street gang who claims an area as its turf? This is not quite as easy to answer as most people would think. And then it goes through a few things that, again, I agree with, like the fact that something is legal doesn't make it moral. The fact that something is voted for, even if it's approved by the majority, that doesn't magically make it moral either. And it points out how a bunch of the worst tyrannies in history were legal and they were voted into existence and all that. So I totally agree with bashing those excuses for legitimate government. So, okay, so far we're on the same page. Then it says, it's a bit disturbing that it's hard to define the difference between your government and a street gang. At least the street gang is honest about its threats, but the politicians are always smiling and shaking hands with their victims while pretending to be so caring and compassionate. So far, so good. Then it says, so shall we do away with government and just have one big free-for-all? No. If the strong can use force to get what they want from the weak, as happens without laws or police, the concept of God-given human rights will be a memory. In addition, and I'm sure you've heard that argument before, that we need it there to protect individual rights. In addition, anarchy never exists for any length of time. As soon as there is complete anarchy, authorities begin to reappear, whether in the forms of gangs, dictatorships, democratic governments, or militias. Then we are back where we started. You've all heard that argument as well, as it'll make a vacuum, it'll make a power vacuum, and governments will come in and take over. So here we go. So what is legitimate government according to this person? I'm sure you've heard this before. So what is a legitimate government? Government has one legitimate job and only one legitimate job: to protect the God-given rights of every citizen. And this duty comes only from the right of individuals to defend themselves, not from the name government. So once again, you have somebody who they all the way understand that individual rights is the thing that matters, the thing that needs to be protected, but they think there can be such a thing as government that only protects individual rights. Like, this person doesn't comprehend the fact that if you had an organization or a group of people that only protected individual rights, it wouldn't be government. It couldn't tax, it couldn't legislate, it wouldn't have any special territory or jurisdiction, it wouldn't have any authority. It would be indistinguishable from the people right next to it who say, if you want to hire us to help protect you, we can do that too. So it also doesn't have a monopoly. But there's this clinging to the propaganda and what we've always learned and what we've always heard everywhere and what we've always believed about government. So even people who all the way understand enough that they should obviously have come to the conclusion that government is inherently aggressive and therefore inherently illegitimate, and that government and a thing that just protects individual rights are totally mutually exclusive. There can't be a thing that's both. But there are some people who, because of their indoctrination, they're still trying to cling to that idea of, well, I want to protect our government that only does these good things, that only defends individual rights. And this person just doesn't freaking understand. But I'm using this as an example because it does succinctly express the bogus position of a lot of people, of a lot of minarchists. So it goes on, with government, as with individuals, the only good use of force is in defense of someone's freedom. true, except if that's the only thing it does, it isn't government, it isn't authority. It goes on, imagine a large group of people with no government. When someone in the group attempts to violate another's God-given rights by injuring, killing, or stealing from another, the intended victim has a right to defend himself. Okay, that's totally true. Because the victim is often unable to defend himself adequately, the group appoints some individuals to deal with those who try to violate the rights of others. They also create written laws based on the idea of God-given rights, which can be simplified as no one shall willingly deprive another of life, liberty, or property. See, this person still has a remnant of the authoritarian fetish in their brain, and they think, well, we need a law that says that. Like, we need some holy written down thing, as if that makes it legitimate. Like, defending yourself doesn't require somebody to write something down and do some dumb ritual and say, no, it is the law of the land. It's just a description of reality. I mean, that's just as dumb as saying, well, 2 plus 2 won't really equal 4 until we have a math authority that writes down, we hereby declare that 2 plus 2 equals 4. Like this, and I can sympathize. I can sympathize that they're trying to reconcile the statist indoctrination with understanding individual rights, and they don't get that they can't be reconciled. There can't be a government that's only a protector, and the notion of law and having a final decider, and we're going to have this all-powerful thing that does the right thing, that does the good thing, that protects us. And one of the most pathetic things about this this mentality is it's still trying to imagine a superhuman entity that will make sure everything's okay, despite the fact that I'm sure this person would admit that never, anywhere in the history of the world has government only done this. But there are still some people who argue we need to have government because we need it to do this thing, just protecting individual rights and nothing else. Even though not only is it never done that anywhere in the world at any time in history, it has always been an aggressor, it has always been a violator of individual rights, but every single time it has ever been tried, it has been the opposite. It has been an aggressor, like I said. It has been the violator of individual rights. So they're basically saying, we need to hang on to this thing that has not only never done the thing that we say we need it for, but has always done the exact opposite and made it worse. So it's frustrating to see people so close, but who are still so clueless and couldn't let go. So he goes on, the reason for putting the law into writing is to have everyone know what acts are considered a violation of another's rights and what the consequences will be for committing that act. Okay, but why do you need to call that law? Like, I could write down, if you try to break into my house, I'll shoot you. Like, I don't have to pretend it's law, I don't have to pretend I'm authority. If it's just a matter of letting people know, here's what we're going to do to you, like here's what we feel justified doing ourselves, that's just kind of a threat or a warning. It doesn't have to be law, it doesn't have to be authority. And the notion of having some centralized authority declaring those things, immediately it's a bad idea, and immediately it turns into authoritarian control. The only freedom a legitimate government ever takes from an individual is the freedom to deprive another of freedom. In this case, it becomes clear that government is simply a hired enforcer for the people, nothing more. Government does not have the authority to make up laws that are outside of the realm of protecting freedom. Well, what are you going to do to stop it when it does? Well, vote really hard. It is not allowed to be exempt from law. When it uses force, it is the force of self-defense that rightfully belongs to the people, which they in turn extend to the hired government. I see this argument so often, and it's so misguided, and I can sympathize with it, but it's so misguided to think we need that authoritarian thing doing something that's completely not authoritarian, and that it has never done in the history of the world. But it really is just a problem of not being able to let go of a comfortable belief system that you've had in your head all your life, and it's hard to let go and realize that whole thing start to finish is bogus. So like this person is still trying to like hang on to, well, okay, we still need government, but it needs to be very different. It needs to be this thing that has never been before. Individuals have a right to defend themselves and their property by force. Individuals do not have a right to use force to violate someone else's property. The very same thing is true of government. God does not give government any special rights. That is legitimate government. Anything else is not. So it's I understand, I sympathize with the argument, and it's totally bogus, and people need to question things enough to realize, just let go. Just let go of the word government. Let go of the concept. Because I know that this person is like drastically hanging on to, but we need a government. I can't imagine like nothing, like people just being people and figuring it out without some central lawmaker saying, don't worry, this is the right rules that we will enforce. And by the way, if you think I'm being demeaning and like presumptive about what this person thinks and why they think that, and insulting to this person, it was me. I wrote this a quarter of a century ago. Note the name. This was in 1994, when I was still a little bit of a statist, and I understood enough of the principles that I should have known better, but my brain was still doing the tap dance, still trying to imagine that there could be such a thing as government that was only a protector, because I didn't want to let go of that security blanket of a big centralized power that will make sure the right thing happens, because I didn't realize government is completely incompatible with that. So yeah, that was me, and that's what I thought back then.